Assalamualaikum
Assalamualaikum
warahmatullahi
warahmatullahi
wabarakatuh.
wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Before we start the international conference event, please carefully listen to the safety briefing. Good morning, ladies and gentlemen. Welcome to Herbal Medicine Department Hall Building. Let me introduce myself. My name is Novia Putri Nurhaliza. On this moment, I will explain about safety in this building. We will read out the safety procedure in the Herbal Medicine Department Health Building, Campus 3. In the case of an emergency such as an earthquake, the invited guests are expected not to panic and take security measures by protecting the head with a bag or at least with the hand. Keep away from hazardous objects such glass. Quit immediately without haste and move away from the building and gather at the gathering point in front of Herbal Medicine Laboratory building. For the exit point, you can go through one door in this building, which is located in front. It is hoped that you will be orderly and not jostle so as not to endanger yourself and other people. Wait until everything are completely calm and safe. That's all we can say. Thanks for your attention.
And for all participants join virtually on Zoom meeting, please be sure to mute your microphone so there will be no noise during this session. Thank you. Good morning. The Honorable Director of Health Polytechnic of Surakarta, Mr. Sudiro Eskapeners, MPD. The Honorable Vice Director of Health Polytechnic of Surakarta, Mr. Widodo Magister of Nursing. The Honorable all the Head of Department in Health Polytechnic of Surakarta. The Honorable Lecturers and the academic community of Health Polytechnic of Surakarta. The Honorable Speaker, distinguished guests, ladies and gentlemen.
On behalf of the organizer, we would like to extend a warm welcome and express our gratitude for participating. The fourth International Conference on Traditional Medicine, and this event is proudly presented by
Health Polytechnic of Surakarta. I'm Tadit Kuntawijayadanu and my colleague
Novia Putri Nurhaliza.
acting as your master of ceremony for this event today.
Ladies and gentlemen, the
The
theme
theme
for
for
this
this
fourth International Conference on Traditional Medicine is integration of traditional and conventional therapy for cardiovascular system. There will be 9 speakers. Mr. Hussein Ahmad Badri, MD, PhD, as a founder Indonesian Holistic Integrated Hospital. Dr. Abhishek Joshi from Purnayo Arogya, Niketanam Ayurveda Hospital, Kerala, India. Mr. Muhammad Sahiswan Abdul Wahab, B.Pharm, Master of Clinic Pharmacy, PhD, RPH from Faculty of Pharmacy, University Technology Mara, Malaysia.
Dr. Kalpana Budal Arial from Tirbuhan University Institute of Medicine, Birkut Nursing Campus, Nepal. Dr. Sri Wahyuni M. Midwifery Department, Health Polytechnic Ministry of Health, Surakarta. Ms. Arum Dwi Akusina, SE, MSc, from Pharmaceutical and Food Analysis Department, Health Polytechnic Ministry of Health, Surakarta. Ms. Murwati, SKM, MKes, from Pharmacy Department, Health Polytechnic Ministry of Health, Surakarta. Apotheker Ibu Ms. Apotheker Pramita Yulipati from Indonesian Traditional Herbal Department, Health Polytechnic Ministry of Health, Surakarta. Mr. Solikan Berti, SSTF AKP, MPH from Acupuncture Department, Health Polytechnic Ministry of Health, Surakarta.
Before the event begins, we will read the conducted rules for the guest today. First, please rename the username Zoom by name underscore. Second, for guests who get the access Zoom, please keep turning on the camera, dress appropriately, and behave politely. Third, during the event, please be sure to mute your microphone so there will be no noise during the session. Guests who join YouTube also please pay attention properly and in an orderly manner. Or guests who want to ask questions can send it through the Zoom chat room using name underscore institution underscore question format. The question will be read by the moderator during the discussion session.
To begin with, allow us to read the agenda for today's conference. First, listening and singing Indonesian national anthem, Indonesia Raya. Second, sending prayers. Third, report from the chairman of the Fourth International Conference on Traditional Medicine, held Polytechnic of Surakarta 2023. Fourth, welcoming speech by the Vice Director of Health Polytechnic of Surakarta. 5. Keynote speech by Head of Traditional Health Council Indonesia Health Workers Council. 6. Sharing and
Bukan kok lagi
discussion
rotinya.
session. 7. Photo session award of today's event.
Ladies and gentlemen, to honor our country, let us all rise for the listening and singing Indonesia national anthem, Indonesia Raya.
Lawan. Yes. Adanya waktu corona tapi biar kayak gitu daripada nangis.
Please be seated. Ladies and gentlemen, the next session is praying session for Mr. Surya Indrajaya. Time is yours.
Assalamualaikum warahmatullahi wabarakatuh. Ladies and gentlemen, before the international conference begins, let us bow our head for a moment. Pray to God Allah Subhanahu wa Ta'ala. I will let this pray based on Islam and those who are not Muslim. Please pray according your belief. Alhamdulillahirabbil alamin. Allahumma sholli ala sayyidina Muhammad wa ala ali sayyidina Muhammad. Allahumma inna nas'aluka salamatan fid din وعافية في الجسد وزيادة في العلم وبركة في الرزق وتوبة قبل الموت ورحمة عند الموت ومغفرة بعد الموت. Oh Allah, today, November 4, 2023, in this beautiful place, we gather here to help the Fourth International Conference on Traditional Medicine. With them, integration of traditional and conventional therapy for cardiovascular system. Make this international conference as useful science assembly as a medium for sharing useful ideas, knowledge, and experiences of scholars, researchers, and students. We hope would bring benefit our lives, expand our knowledge, and let us to become successful people who will unity of our nation. Oh Allah, guide and bless our mind with the light of your guidance. Impart your supreme wisdom upon our activities. Help us to speak our clearly. Help us to listen each other, respect each other, love each other, so that we are included to blessed person. Oh Allah, protect us from unintended temptation. Show us the right path and give us knowledge and strength to become good things. Actually, show us the bad things and give us knowledge and strength to avoid them. Oh Allah, you are the one who can fulfill our dua. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina azabannar. Subhana rabbika rabbil izzati amma yasifun. Wassalamu alal mursalin. Walhamdulillahi rabbil alamin. Amin. Amin. Amin ya rabbal alamin. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you for Mr. Surya Indrajaya. Moving to the next agenda is the report from the chairman of the Fourth International Conference on Traditional Medicine held Polytechnic of Surakarta 2023, Mr. Apotheker Muhammad Anugrah Alamwaris, S-Farm MSc. Time is yours.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. The Honorable Head of Traditional Health Council, Indonesian Health Workforce Council, Mr. Arto, Bachelor of Applied Science, Physiotherapy, Magister of Health, the Honorable Director of Health Polytechnic of Surakarta, Mr. Sidiro, Bachelor of Nursing, Nurse, Magister of Education, in this case, represented by Vice Director 1, Mr. Widodo, Magister of Nursing, the Honorable Head of Center of Excellent Science and Technology for the use of Indonesian traditional herbal medicine to improve public health, Health Polytechnic of Surakarta, Mrs. Emi Suryani, Magister of Midwifery, the Honorable Head of Alumni Family of Health Polytechnic of Surakarta, Mr. Muhammad Syafi'i, Bachelor of Applied Science, Occupational Therapy, Magister of Health, the Honorable all of the head department in Health Polytechnic of Surakarta, the Honorable all of the invited guests, all of speakers, moderators, seminar participants, and attendees. First of all, let us offer thanks to presence of Allah subhanahu wa ta'ala, the most gracious and merciful God. Because with his permission, today we can gather here to jointly take part in the international conference on traditional medicine, which is being held in collaboration, Center of Excellence for Science and Technology, utilization of Indonesian traditional herbal department to improve public health degrees, Health Polytechnic of Surakarta, and alumni family of Health Polytechnic of Surakarta. Especially big thanks to all crew who help this event. Ladies and gentlemen, our theme for this event is integration of traditional and conventional therapy of cardiovascular system. Background of choosing this theme is related to the increasingly rapid development of science and technology in this century, about integration of traditional and conventional therapy, which has also given birth to change or renewal in various areas of life, including treatment for cardiovascular system. As we know, heart disease is still leading cause of death globally, taking an estimated 17.9 million lives each year. Ladies and gentlemen, based on this theme, we present some expert speakers. Dr. Hussein Ahmad Bajri, Philosophy of Doctoral from Indonesia Holistic Integrated Hospital, Purwakarta, Indonesia. Dr. Abhishek Joshi from Purna Yoga Aragya Nikethanam, Ayurveda Hospital, India. Mr. Muhammad Saheswan Abdul Wahab, Bachelor of Pharmacy, Magister of Clinical Pharmacy, Philosophy of Doctoral RPH from Faculty of Pharmacy, University Teknologi Mara, Malaysia. Mrs. Kalpana Paudel, Philosophy of Doctoral from Tribhuvan University, Nepal. Each of whom will convey their presentation to all of us. Also, our great speakers from Health Polytechnic of Surakarta, Mrs. Dr. Sri Wahyuni, Magister of Midwifery from Midwifery Department, Miss Arum Dwi Agustin, Bachelor of Science, Magister of Science from Pharmaceutical and Food Analysis Department, Mrs. Murwati, Bachelor of Public Health, Magister of Health from Pharmacy Department, Mrs. Apotheker Pramita Yuli Pratiwi, Bachelor of Pharmacy, Magister of Science from Indonesian Traditional Herbal Department, and Mr. Solikan Badri, Bachelor of Applied Science, Acupuncture, Magister of Public Health from Acupuncture Department. Ladies and gentlemen, this conference was attended by 464 participants, consisting of students from Indonesia, India, Nepal, and China. Traditional health workers, health practitioners, and the general public, which held in a hybrid system or offline in the Health Polytechnic of Surakarta and online by Zoom, Cloud, meeting and YouTube live streaming. Ladies and gentlemen, we realize that the implementation of this seminar still has many shortcomings in terms of even presentation, administrative services, and limited facilities. For that, we apologize profuse. And finally, I hope that all seminar participants who attended will get great benefits from this seminar activity. Thank you for your attention. Wallahu wali taufiq wal hidayah. Assalamualaikum warahmatullahi wabarakatuh.
Thank you, Mr. Apoteker Muhammad Anugrah Alam Waris, S-Farm MSI. The next agenda is welcoming speech by the Vice Director of Health Polytechnic Surakarta, Mr. Widodo Magister of Nursing. Time is yours.
Okay, thank you very much. Just for test first, can you hear my voice, MC?
Yes.
Yes. Okay. Thank you. Okay. Let's begin then. As Vice Director 1 for Academic Affairs of the Health Polytechnic of Surakarta, allow me to convey a speech from the director because he, at the time, is currently carrying out other official duties as well. Assalamualaikum warahmatullahi wabarakatuh. Peace be upon us all.
Warahmatullahi wabarakatuh.
Om Swastiastu, Namo Buddhaya, Salam Kebajikan, Salam Sehat, Good morning. First of all, let me convey my greetings to the Honorable Mr. Sunarto, Magister Kesehatan, the Chairman of the Indonesian Health Council. Then, dear speakers, all speakers, first, Associate Professor Hussein Ahmad Bajri, Medical Doctor PhD from Holistic Hospital Purwakarta, Indonesia. Then Dr. Abhishek Joshi from Purna Yoga Arakya Niketanam, Ayurveda Hospital, Kerala, India. Third, Mr. Muhammad Sahwan Abdul Wahab, PhD, from Deputy Dean for Academic Affairs, Faculty of Pharmacy, University Technology, Mara, Malaysia. Then fourth, Associate Professor Kalpana Putel, PhD from Pokhara Nursing Campus of Medicine, Tribhuvan University, Nepal. Then also honorable speakers from the Health Polytechnic of Surakarta. The first is Dr. Sri Wahyuni, Master of Midwifery from the School of Midwifery. Ms. Arum Dwi Agustina, MSc from the School of Pharmacy. Then Pharmacy and Food Analysis. The third, Ms. Morwati MKes from the School of Pharmacy. The fourth, Ms. Pramita Yuli Prativi, MSc from the School of Indonesian Traditional Herbal. And the fifth, Mr. Solikan Badri, MPH from the School of Acupuncture. Invited guests, colleges, vice directors, and staff, head of the schools or department in Health Polytechnic of Surakarta, and colleges, chairman of the committee, and all staff, all invited guests, all lecturers and staff, and the other important thing is all participants and attendees. First of all, let us be grateful for the extraordinary blessing for God Almighty, so that today we are here to share this extraordinary moment of friendship and knowledge. To all honorable speakers, thank you for being willing to enliven this event, sharing your valuable time and expertise. It is an honor to hold the 4th International Conference on Traditional Medicine with the theme of the integration of traditional and conventional therapy for cardiovascular system, which presents speakers from India, Nepal, Malaysia, and of course from Indonesia. Ladies and gentlemen, as we all know, health problems in various countries are increasingly complex and require handling effort that not only requires a seriousness but also togetherness. Various countries come together to discuss and share experiences to jointly overcome this problem. As well, in Indonesia, the Ministry of Health of Republic of Indonesia has launched the transformation of health in order to speed up the process of overcoming various health problems. One of the efforts that the government is focusing on through a preventive and promotive effort. This effort aims to strengthen the primary care transformation sector. The public must receive adequate education on how to carry out prevention efforts while still in the community, especially through primary care facilities. Ladies and gentlemen, in our respected guests, traditional medicine is a health services sector based on local wisdom from each country, which has been proven for generations to contribute to preventive and even promotive efforts. Therefore, your presence at this activity is very strategic and effort to provide discussion and variety. Through this international conference activity, it is hoped that there will also be sharing of breakthroughs on new innovation that can be shared with the wider community by considering the situation and condition in each country. Universities and other institutions working in the health sector are certainly eagerly awaiting their significant contribution in helping to overcome this various health problem. Inseparably, the Health Polytechnic of Surakarta also feels very responsible in helping to resolve this health problem. Therefore, one of the efforts made by the Health Polytechnic of Surakarta is to hold this activity with the hope of constructive discussion and sharing from various countries. Ladies and gentlemen, in the audience, on behalf of the Director of the Health Polytechnic of Surakarta, once again, we would like to thank you for your willingness and presence. Have a good conference. Hope it will be enjoyable and don't forget to be happy. Last but not least, important, to the Honorable Mr. Sunarto, respectfully request you to give the keynote speech and at the time to officially open this activity. I think that's all we can convey. Sorry if there are any shortcoming. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Mr. Widodo, Magister of Nursing. The next agenda is keynote speech and officially open this event by Head of Traditional Health Council, Indonesian Health Workers Council, Mr. Sunarto SST, FT, FTR, MKes, time is yours.
Ya, Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone.
Good
To the
morning.
Honorable Mr. Widodo, the First Deputy Director of Health Polytechnic, Ministry of Health Surakarta, to Honorable Head of the Herbal Medicine Department of Health Polytechnic, Ministry of Health Surakarta, to Honorable Head of the Herbal Medicine Study Program of Health Polytechnic, Ministry of Health Surakarta, to Honorable all speaker from India, Malaysia, Nepal, Turkey, Thailand, and Indonesia, and all participants of the 4th International Conference on Traditional Medicine Surakarta Health Polytechnic. Allow me to present and welcome in bahasa, no problem. Mohon maaf, saya akan menggunakan bahasa Indonesia dalam presentasi dan juga sambutan saya pada hari ini. Bapak Ibu sekalian saya hormati, pertama-tama dan yang utama marilah kita panjatkan puji syukur kepada Allah Subhanahu wa taala, Tuhan Yang Maha Esa, atas segala limpahan kasih sayangnya kepada kita semua sehingga pada hari ini kita bisa bersama-sama mengikuti kegiatan International Conference yang keempat di Politeknik Surakarta. Bapak Ibu sekalian kami hormati, sebagaimana kita ketahui bersama bahwa pada tanggal 8 Agustus tahun 2023 yang lalu telah disahkan dan juga diundangkan Undang-Undang Kesehatan Nomor 17 Tahun 2023 tentang kesehatan. Dengan adanya undang-undang yang baru ini tentu ada beberapa hal perubahan-perubahan yang cukup signifikan dalam pelayanan kesehatan, termasuk juga dalam pelayanan kesehatan tradisional. Namun demikian, dengan adanya undang-undang ini dan sebelum ada turunannya yang baru, maka peraturan yang ada, undang-undang sebelumnya masih tetap dinyatakan berlaku sampai nanti ada peraturan yang baru. Kalau kita bicara tentang pelayanan kesehatan tradisional, termasuk di dalamnya adalah pelayanan kesehatan tradisional integrasi, ini sebenarnya sudah berjalan dan sudah diatur, namun demikian sampai saat ini pelayanan kesehatan tradisional integrasi ini belum bisa terlaksana secara menyeluruh di seluruh Indonesia. Mungkin Panitia bisa izinkan saya share sebentar. Saya akan share screen beberapa poin mungkin yang perlu sampaikan sebelum kami buka acara. Bisa dilihat PPT saya, Bu, Bapak Ibu?
Bisa.
Ya, Bapak.
Ya,
Bisa,
baik.
Bapak.
Bisa dilihat.
Bisa, Pak, bisa.
Baik, terima kasih. Ya, Bapak Ibu, sebelumnya kami kenalkan dulu bahwa sesuai dengan Undang-Undang Nomor 17 Tahun 2023 bahwa dalam rangka meningkatkan mutu dan kompetensi tenaga teknis keprofesian tenaga medis dan juga tenaga kesehatan, serta dalam memberikan perlindungan dan kepastian hukum kepada masyarakat, maka dibentuklah konsil. Konsil ini berkedudukan di bawah dan bertanggung jawab kepada Presiden melalui menteri dan dalam perannya bersifat independen. Konsil berperan merumuskan kebijakan internal dan standarisasi tugas konsil, juga melakukan registrasi terhadap tenaga medis dan juga tenaga kesehatan, tentunya juga termasuk tenaga kesehatan tradisional. Kemudian melakukan pembinaan teknis keprofesian tenaga medis dan tenaga kesehatan. Dalam konsil tenaga kesehatan tradisional itu ada 11 konsil, salah satunya adalah konsil tenaga kesehatan tradisional. Kemudian dalam Undang-Undang 17/2003 disebutkan bahwa tenaga kesehatan adalah setiap orang yang mengabdikan diri dalam bidang kesehatan serta memiliki sikap profesional, pengetahuan, dan keterampilan melalui pendidikan tinggi yang untuk jenis tertentu memerlukan kewenangan untuk melakukan upaya kesehatan. Perlu kami tegaskan kembali bahwa tenaga kesehatan adalah memiliki pendidikan tinggi. Sehingga kalau kita bicara dalam pelayanan kesehatan tradisional, secara yang ada di Indonesia itu adalah tidak hanya dilakukan oleh tenaga kesehatan, ya, jadi ada yang tidak memiliki pendidikan tinggi. Namun dalam ini kita bicara sebagai tenaga kesehatan tradisional. Tenaga medis itu memiliki pendidikan kualifikasi minimal profesi, sedangkan tenaga kesehatan memiliki kualifikasi minimal adalah diploma 3. Dan untuk Indonesia adalah ada 3 jenis, yaitu adalah jamu minimal diploma 3, kemudian ada pengobat tradisional dan juga interkontinental. Ya. Pengelompokan tenaga kesehatan itu adalah 11 kelompok, ya. Ada satu lagi, yang ke-12 itu adalah tenaga kesehatan lain yang ditetapkan oleh Menteri, dan tenaga kesehatan tradisional dan melakukan salah satu jenis yang ke-11 yaitu tenaga kesehatan tradisional. Dan saat ini yang existing dan ini telah tertulis atau tercantum dalam Undang-Undang yang baru Nomor 17 Tahun 2003 Pasal 199 bahwa jenis tenaga kesehatan yang termasuk ke dalam kelompok tenaga kesehatan tradisional terdiri atas tenaga kesehatan tradisional jamu atau ramuan, dan kesehatan tradisional pengobat tradisional, tenaga kesehatan tradisional interkontinental. Jadi saat ini existing ada 3 jenis tenaga kesehatan tradisional, dan ini yang bernaung di dalam Konsil Tenaga Kesehatan Indonesia. Kalau kita melihat penyelenggaraan upaya kesehatan dalam undang-undang, itu salah satunya dari 24 penyelenggaraan upaya kesehatan, salah satunya adalah pelayanan kesehatan tradisional. Jadi pelayanan tradisional adalah merupakan suatu pelayanan yang memang menjadi bagian dari upaya kesehatan yang menjadi program dari pemerintah. Kemudian pelayanan kesehatan tradisional, kesehatan adalah segala bentuk kegiatan atau serangkaian kegiatan pelayanan yang diberikan secara langsung kepada perseorangan atau masyarakat untuk memelihara dan meningkatkan derajat kesehatan masyarakat dalam bentuk promotif, preventif, kuratif, rehabilitatif, dan atau paliatif. Ya. Secara umum, pelayanan kesehatan di Indonesia itu terbagi dalam 2 kelompok, yaitu kelompok konvensional dan yang kedua adalah kelompok tradisional. Dalam kelompok pelayanan kesehatan tradisional itu terbagi lagi dalam 3 kelompok, yaitu empiris, komplementer atau tradisional, dan juga integrasi. Dalam pelayanan kesehatan tradisional, empiris itu dilakukan oleh penyihat tradisional. Kemudian dalam kelompok kesehatan tradisional komplementer dan integrasi, itu dilakukan oleh tenaga kesehatan tradisional. Dan saat ini kita mempunyai jenis ramuan, ya kelompok kesehatan tradisional ramuan, kemudian kelompok tenaga kesehatan tradisional ramuan plus keterampilan Indonesia. Yang ketiga adalah kelompok ramuan dan keterampilan interkontinental. Jadi kita ada tenaga kesehatan seperti yang satu dalam undang-undang yang baru. Jadi ada ramuan, kemudian ada BATRA atau kelompok tradisional Indonesia itu yang akan melakukan pelayanan ramuan dan juga keterampilan asli Indonesia. Dan kemudian interkontinental itu dalam kegiatan pelayanan tradisional ramuan dan juga keterampilan yang berasal dari luar Indonesia. Kemudian pelayanan kesehatan tradisional itu dalam undang-undang disebutkan pasal 160 berdasarkan cara pengobatannya terdiri dari pelayanan kesehatan tradisional yang menggunakan keterampilan dan atau pelayanan kesehatan tradisional menggunakan ramuan. Jadi bisa menggunakan keterampilan saja, bisa menggunakan ramuan saja, atau menggunakan dua-duanya. Kemudian pelayanan kesehatan tradisional ini dilakukan berdasarkan pengetahuan, keahlian, dan atau nilai yang bersumber dari kearifan lokal. Kemudian dalam pembinaannya dilakukan oleh pemerintah pusat, pemerintah daerah, agar dapat dipertanggungjawabkan manfaat keamanannya serta tidak bertentangan dengan norma sosial budaya. Kemudian pelayanannya meliputi pelayanan promotif, preventif, rehabilitatif, dan paliatif. Dan pelaksanaannya untuk pelayanan kesehatan tradisional ini saat ini bisa dilakukan di tempat praktek mandiri, puskesmas, fasilitas pelayanan kesehatan tradisional, rumah sakit, dan fasilitas pelayanan kesehatan lainnya. Dari di sini kita bisa lihat bahwa sebenarnya pelayanan kesehatan tradisional itu cakupan tempat pelayanan sangatlah luas ya. Bisa mandiri bisa, dan sedangkan untuk pelayanan integrasi nanti akan dilaksanakan itu di puskesmas maupun juga di rumah sakit. Kemudian pada pasal 162 itu pemerintah pusat dan daerah bertanggung jawab atas ketersediaan pelayanan kesehatan tradisional, dan pada 163 itu masyarakat diberi kesempatan seluas-luasnya untuk mengembangkan, meningkatkan, dan menggunakan pelayanan kesehatan tradisional yang dapat dipertanggungjawabkan manfaat dan keamanannya. Pemerintah pusat dan daerah mengatur dan mengawasi pelayanan kesehatan tradisional sebagaimana dimaksud pada ayat 1 dengan didasarkan pada keamanan, manfaat, dan perlindungannya. Kemudian ketentuan lebih lanjut ini nanti akan diturunkan di dalam peraturan pemerintah. Nah, jadi kembali ini bahwa untuk pelayanan kesehatan tradisional ini sebenarnya diberikan kesempatan yang seluas-luasnya kepada masyarakat untuk memanfaatkan dan mengembangkannya. Nah, ini sebenarnya menjadi suatu tantangan dan juga peluang bagi kita sebagai tenaga kesehatan tradisional bagaimana bisa mengembangkan, namun juga menjadi tantangan karena pemahaman di masyarakat tentang pelayanan kesehatan tradisional ini masih belum begitu paham perbedaan antara tenaga kesehatan tradisional dan juga penyihat tradisional. Ini yang menjadi PR buat kita tenaga kesehatan tradisional, bagaimana kita bisa membranding dan juga membuat tenaga kesehatan tradisional menjadi eksis dan bisa diterima masyarakat dan juga bisa memberikan pelayanan kepada masyarakat dengan sebaik-baiknya. Ya. Ya, pembagian pelayanan kesehatan tradisional dan PP 103 ini kalau kita jabarkan perbedaannya antara empiris, komplementer, dan juga integrasi, bahwa untuk empiris itu diterapkan penerapan kesehatan tradisional yang memanfaatkan parameter pusara empiris, kemudian dilakukan oleh penyehat tradisional. Pendidikannya di sini adalah informal dan non-formal, kemudian areanya hanya promotif dan preventif. Ya. Kemudian perizinannya adalah STTT atau surat tanda tradisional, tempat pelayanan yang di sehat dan rumah sehat. Ini memang polis cukup banyak dibandingkan Nakesrat, ini jauh lebih banyak, itu ada 24 perkumpulan dan populasinya lebih dari 100.000. Sedangkan untuk komplementer atau tenaga kesehatan tradisional, itu adalah memanfaatkan ilmu biomedis dan biokultural, dalam jelasannya secara manfaat keamanannya terbesar ilmiah, dan ini dilakukan atau SDM-nya adalah oleh tenaga kesehatan tradisional yang berpendidikan tinggi, minimal diploma 3, sedangkan untuk areanya tentu lebih luas dibandingkan empiris, yaitu promotif, preventif, kuratif, palliatif, dan juga paliatif. Kemudian perizinannya ini adalah dia harus memiliki surat tanda registrasi tenaga kesehatan tradisional, kemudian dan kemudian dalam jalan prakteknya dia harus memiliki surat izin praktek tenaga kesehatan tradisional. Tempat pelayanan adalah di gerai sehat dan juga praktek mandiri. Yang untuk integrasi, ini juga dilakukan oleh tenaga kesehatan tradisional. Ini kesehatan yang menggunakan pelayanan kesehatan konvensional dengan pelayanan kesehatan tradisional komplementer bersifat sebagai pelengkap ataupun pengganti. Berpendidikan minimal diploma 3 untuk tenaga kesehatannya dan juga tenaga kesehatan tradisional. Kemudian areanya atau upayanya meliputi promotif, preventif, kuratif, rehabilitatif, dan juga nanti paliatif. Perizinannya sama dengan yang tenaga kesehatan secara umumnya, yaitu memiliki STR dan juga SIP. Tempat pelayanannya adalah puskesmas dan juga rumah sakit. Ya, perlu diketahui bahwa untuk tenaga kesehatan tradisional sampai saat ini dari 3 jenis tadi, itu kurang lebih baru 1.500 tenaga kesehatan tradisional. Jadi dengan demikian memang sangat-sangatlah secara jumlah ini memang masih sangat minim untuk memenuhi kebutuhan dari pelayanan ya. Kalau kita lihat puskesmas saja itu sudah 10.000 lebih, sedangkan tenaga kesehatan itu baru 1.600. Seandainya seluruh puskesmas itu menyelenggarakan pelayanan kesehatan tradisional dan itu dilakukan oleh tenaga kesehatan tradisional, tentu kita masih kekurangan tenaga kesehatan tradisional. Pengertian dari pelayanan tradisional integrasi adalah bentuk pelayanan kesehatan yang mengkombinasikan ya pelayanan kesehatan konvensional dengan pelayanan kesehatan tradisional komplementer, baik itu bersifat sebagai pelengkap ataupun pengganti. Jadi dalam merupakan gabungan ya Bapak Ibu, merupakan antara pelayanan kesehatan konvensional dan pelayanan kesehatan tradisional. Ya. Di dalam Peraturan Menteri Kesehatan Nomor 37 2017 tentang pelayanan kesehatan tradisional integrasi, bahwa penyelenggaraan kesehatan integrasi dilakukan bersama oleh tenaga kesehatan tradisional dan tenaga kesehatan lain untuk pengobatan atau perawatan pasien. Dan diselenggarakan di fasilitas pelayanan kesehatan menggunakan pelayanan kesehatan tradisional komplementer atau kesehatan tradisional. Jadi perlu diketahui kalau dalam undang-undang yang baru memang tidak disebutkan adanya tenaga kesehatan komplementer, Bapak Ibu. Jadi disebutkan sebagai tenaga kesehatan tradisional. Kemudian terintegrasi paling sedikit dengan satu pelayanan kesehatan konvensional. Kemudian pelayanannya bisa aman, bermanfaat, bermutu, dan sesuai dengan standar, dan berfungsi sebagai pelengkap dan juga pelengkap pelayanan kesehatan konvensional. Tenaga kesehatan tradisional dan tenaga kesehatan lain yang memberikan pelayanan kesehatan tradisional integrasi wajib memiliki SIP sesuai dengan ketentuan peraturan perundang-undangan dan dilaksanakan berdasarkan standar profesi, standar pelayanan kesehatan, dan standar prosedur operasional. Nah, dari 3 jenis tenaga kesehatan tradisional kita yang ada, alhamdulillah sekarang sudah memiliki standar profesi ketiga-tiganya, kemudian juga sudah memiliki izin dan pelanggaran praktek ya, PMK tentang izin pelanggaran praktek juga ada. Tinggal memang sampai saat ini masih belum termanfaatkan dengan baik karena kendala salah satunya adalah belum adanya jabatan fungsional bagi tenaga kesehatan tradisional, sehingga untuk memenuhi kebutuhan di puskesmas dan rumah sakit kita masih terkendala. Ya. Kemudian pelaksanaannya itu dilakukan melalui pendekatan holistik dengan menelaah dimensi fisik, mental, spiritual, sosial, dan budaya dari pasien. Kemudian mengutamakan hubungan dan komunikasi efektif antara tenaga kesehatan dan pasien, diberikan secara rasional, kemudian diselenggarakan atas persetujuan pasien, jadi ada informed consent-nya untuk penyelenggaraan pemberian pelayanan tradisional. Kemudian mengutamakan pendekatan ilmiah, meningkatkan kemampuan penyembuhan sendiri, dan terapi bersifat individual. Dan di sini perlu digarisbawahi bahwa pelayanan kesehatan tradisional integrasi hanya dapat dilakukan dengan menggunakan jenis pelayanan kesehatan tradisional yang ditetapkan oleh Menteri. Jadi pelayanan kesehatan tradisional integrasi itu ya harus dilaksanakan, harus dilakukan oleh tenaga kesehatan tradisional yang ditetapkan Menteri. Kalau sekarang sudah ditetapkan dalam undang-undang, ada 3 tenaga kesehatan tradisional. Ya, memang sebelumnya itu masih dilakukan oleh tenaga kesehatan lain dengan kompetensi tambahan. Namun dengan ketentuan PMK 37 dan juga PP 103, sebenarnya pelayanan kesehatan tradisional ini harus sudah dilakukan oleh tenaga kesehatan tradisional. Sekali lagi memang kendala kita adalah tenaga kesehatan tradisional belum ada jabatan fungsional sehingga untuk menjadi ASN P3K masih terkendala, sehingga sampai saat ini memang beberapa pelayanan kesehatan tradisional integrasi masih dilaksanakan oleh tenaga kesehatan konvensional dengan kompetensi tambahan. Nah, ini menjadi PR buat kita semua. Mudah-mudahan nanti ke depan bahwa pelaksanaan tradisional integrasi ini benar-benar dilaksanakan oleh tenaga kesehatan tradisional. Kemudian Pasienkes yang menyelenggarakan integrasi itu adalah rumah sakit dan puskesmas. Bahwa Pasienkes kesehatan yang melakukan pelayanan integrasi adalah puskesmas dan rumah sakit. Kemudian penyelenggaraan integrasi ini harus ditetapkan oleh pimpinan kesehatan pelayanan kesehatan, menetapkan bahwa melenggarakan pelayanan integrasi. Jadi pimpinan kesehatan harus menetapkan pelayanan kesehatan tradisional yang diintegrasikan di fasilitas kesehatannya. Jadi kalau tidak bisa rumah sakit atau puskesmas tiba-tiba menyelenggarakan pelayanan tanpa ada ketetapan dari pimpinan rumah sakit ataupun juga pimpinan dari puskesmas. Kemudian penetapan pelayanan kesehatan tradisional kalau di rumah sakit itu dilakukan oleh kepala atau direktur rumah sakit berdasarkan rekomendasi dari komite medik. Kemudian apa yang ditetapkan? Penetapannya meliputi minimal penetapan jenis dan model pelayanan kesehatan tradisional komplementer yang diintegrasikan. Jadi harus ditetapkan dulu jenis dan modalitas apa yang akan diintegrasikan dengan pelayanan kesehatan tradisional. Kemudian penetapan standar prosedur operasional pelayanan kesehatan tradisional integrasi. Kemudian juga ditetapkan adalah unit pelayanan kesehatan tradisional. Jadi keberadaan unit pelayanannya harus ditetapkan terlebih dahulu. Kemudian pembentukan dan penetapan tim yang akan memberikan pelayanan. Kelima, penerbitan kewenangan klinik tenaga kesehatan yang menyelenggarakan pelayanan kesehatan tradisional integrasi. Jadi ini untuk pelayanan integrasi di rumah sakit. Sedangkan untuk di puskesmas itu ditetapkan oleh kepala puskesmas setelah mendapatkan rekomendasi dari tim yang dibentuk oleh Kepala Dinas Kesehatan Kabupaten atau Kota. Yang ditetapkan setidaknya adalah 3, yaitu ditetapkan tentang penyelenggaraan pelayanan kesehatan tradisional integrasi di puskesmas, kemudian ditetapkan jenis dan modalitas pelayanan kesehatan tradisional yang diintegrasikan, kemudian yang ketiga, pembentukan dan penetapan tim yang akan memberikan pelayanan. Jadi intinya sebenarnya untuk pelayanan integrasi ini baik di puskesmas maupun rumah sakit merupakan kebijakan dari pimpinan rumah sakit ataupun puskesmas, dan juga apa yang diintegrasikan juga tergantung dari kebijakan atau ketetapan dari pimpinan Pasienkes yang akan melakukan pelayanan kesehatan tradisional integrasi. Kemudian siapa yang mengawasi? Bahwa pembinaan dan pengawasan dalam pelaksanaan kesehatan tradisional integrasi ini adalah dilakukan oleh Menteri, Kepala Dinas Kesehatan Provinsi, dan Kepala Dinas Kesehatan Kabupaten Kota, melakukan pembinaan dan pengawasan terhadap penyelenggaraan pelayanan kesehatan tradisional integrasi di Pasienkes sesuai dengan tugas dan kewenangannya. Tujuan dilaksanakannya pembinaan dan pengawasan adalah untuk mewujudkan kesehatan tradisional integrasi yang aman dan tidak bertentangan dengan norma yang berlaku, kemudian juga untuk memenuhi kebutuhan masyarakat akan pelayanan kesehatan tradisional integrasi yang memenuhi persyaratan keamanan dan kemanfaatannya. Bapak-Ibu sekalian, sampai saat ini itu hanya ada 16 rumah sakit yang telah menyelenggarakan pelayanan kesehatan tradisional integrasi, yaitu di Surabaya, kemudian di Semarang, Wonosobo, kemudian di Aceh Besar, Sarjo Yogyakarta, kemudian di Bangka, RSUD Polisi NTB, kemudian RSC Prof. Surojo Magelang, Sanglah Bali, kemudian Pati, Bali, Papua, Aceh Timur, Pasuruan, Banda Aceh, Maluku Tenggara, dan Kalimantan Timur. Jadi kalau kita lihat rumah sakit ini, memangnya rumah sakit pemerintah ya ini, dan ini juga baru 16, jadi jumlah ini benar-benar sangat sedikit dibandingkan jumlah rumah sakit di seluruh Indonesia. Dan lagi-lagi di sini untuk pelayanannya belum semuanya dilaksanakan oleh tenaga kesehatan tradisional. Ini tentu menjadi PR buat kita semua, Bapak Ibu. Dan di Puskesmas sampai saat ini ada kenaikan memang dibandingkan tahun 2021, dari 262 sekarang menjadi 350 puskesmas yang sudah melaksanakan pelayanan kesehatan tradisional. Ya, apa yang dilakukan di sana adalah pelayanan kesehatan tradisional, pembinaan kelompok asuhan mandiri, pendataan tradisional, dan juga memiliki ruang terbuka hijau. Lagi-lagi di sini adalah belum semuanya ini dilakukan oleh tenaga kesehatan tradisional. Jadi masih dilakukan oleh tenaga kesehatan dengan kompetensi tambahan. Nah, kemudian kalaupun ada tenaga kesehatan tradisional melaksanakan kegiatan atau pelayanan tradisional di puskesmas maupun rumah sakit integrasi saat ini, itu statusnya itu bukan ASN ataupun juga P3K, Bapak Ibu. Jadi mereka itu masih PPNPN atau honorer. Dan saat ini pemerintah sepertinya sudah akan melakukan untuk tidak merekrut atau akan menghapus tenaga honorer. Kalau ini benar dilakukan, maka teman-teman yang melakukan pelayanan ini akan terkendala dalam hal statusnya. Karena untuk mendaftar sebagai P3K maupun juga ASN, saat ini masih terkendala belum adanya capung bagi tenaga kesehatan tradisional. Nah, ini benar-benar menjadi PR, mohon doa dan dukungan dari Bapak Ibu, mudah-mudahan nanti pelayanan capung untuk tenaga kesehatan tradisional bisa segera ditetapkan, dikeluarkan, sehingga teman-teman yang nakesrat ini bisa melakukan pelayanan kesehatan tradisional sesuai dengan tempatnya tentunya, bisa menjadi ASN dan juga menjadi P3K di puskesmas maupun juga di rumah sakit. Karena ini peluang yang sangat besar sebenarnya Bapak Ibu, karena dari 10.000 puskesmas baru ada 350 dan itu pun juga belum dilaksanakan oleh tenaga kesehatan tradisional. Jadi ini benar-benar menjadi PR buat kita semua. Mudah-mudahan nanti kegiatan pada hari ini itu bisa mendorong atau bisa memberikan motivasi kepada kita semua, tentunya tenaga kesehatan tradisional, untuk bisa memberikan pelayanan terbaik dan juga kita bisa berpartisipasi dalam melaksanakan pelayanan kesehatan tradisional, khususnya integrasi di rumah sakit maupun di puskesmas. Karena ini menjadi tantangan ya, tentang dari konsil, kami dari Konsil Tenaga Kesehatan Tradisional terus berupaya untuk mempercepat adanya pengesahan jabatan fungsional bagi tenaga kesehatan tradisional agar kesehatan ini mendapatkan tempat dan kedudukan yang sama sebagaimana tenaga kesehatan tradisional kesehatan pada umumnya. Itu harapan kami sehingga nanti dengan demikian tenaga kesehatan ini bisa sejajar dengan ada tenaga kesehatan pada umumnya dan juga bersama dengan tenaga medis. Ini tentu harapan kita semua dan saya sangat bersyukur dengan kegiatan pada hari ini, pelayanan integrasi ini, sehingga masyarakat bisa memahami, masyarakat bisa mendapatkan pelayanan yang terbaik. Ya, tentu intinya adalah pelayanan kesehatan ini baik itu nasional, apalagi integrasi ini adalah ditujukan untuk memenuhi kebutuhan masyarakat dan untuk memberikan pelayanan yang terbaik buat masyarakat. Dan ini juga memberi kesempatan peluang kepada tenaga kesehatan tradisional untuk bisa eksis, bisa berperan dengan sebaik-baiknya. Sekali lagi, mudah-mudahan kegiatan sebentar ini bisa mendorong terwujudnya pelayanan kesehatan tradisional integrasi di seluruh Indonesia, di puskesmas dan rumah sakit. Mudah-mudahan nanti bisa terisi oleh tenaga kesehatan tradisional secara keseluruhan ya, paling enggak ada 10.000 rumah sakit yang puskesmas yang bisa kita isi. Demikian Bapak Ibu yang kami sampaikan, dan dengan mengucap Bismillahirrahmanirrahim, maka kegiatan The 4th International Conference on Traditional Medicine Surakarta Health Polytechnic with tema Integration of Traditional and Conventional Therapy for Cardiovascular System secara resmi saya nyatakan dibuka. Akhir kata, kurang lebihnya mohon maaf. Wassalamualaikum warahmatullahi wabarakatuh.
Salam warahmatullahi wabarakatuh.
Thank you, Mr. Sunarto, SST, FT, FTR, MK.
Distinguished guests, ladies and gentlemen, now we come to sharing and discussion session. In the first session, the speaker will be Mr. Hussein Ahmad Bajri, MD, PhD, the Holistic Hospital Purwakarta, Indonesia, with the theme Holistic Integrated Approach for Cardiovascular Disease in Indonesia. The second speaker is Mr. Dr. Abhishek Joshi from Purnayo Arogya Niketanam Ayurveda Hospital Kerala in India, with the theme The Use of Traditional Medicine for Cardiovascular Disease Effectiveness and Safety Concern.
The first session will be moderated by Ms. Atanasia Budi Astuti, SCAP, MN. Before we start, we will read out the CV of moderator. She is Ms. Atanasia Budi, SCAP, MN. Atanasia Budi Astuti is a senior lecturer community health nursing at Ministry of Health, Health Polytechnic Surakarta. Atanasia, she achieved her master in School of Postgraduate Nursing from Melbourne University in 2003. First degree in nursing from University of Indonesia in 1996. Interprofessional Education and Collaboration Certificate from Gunma University, Japan in 2018, and Diploma of Nursing from Academy of Nursing, Bandung in 1983. Her current teaching and research interests in community health nursing include interprofessional education and collaboration. The name is Atanasia Budi, SKP, MN. Email ataatika500@gmail.com. Mr. Atanasia Budi Astuti, SKP, MN. Time is yours.
Thank you for. Okay. Ladies and gentlemen, good morning.
Good morning.
Okay.
Good morning, madam.
Hi. Yeah. Okay.
Morning.
Are you ready for follow this event? Ready? Okay. Let me start. So for this session, maybe we have two speakers. The first session, we have two speakers. The first one is Associate Professor Dr. Hussein Ahmad Bajri, PhD, and the second one is Dr. Abhishek Joshi. So before we start, we just clarify. Dr. Abhishek Joshi, are you with me? Okay.
Yes, I'm there with you.
Okay, welcome then to this.
I'm online, I'm there with you.
Yeah. Lagi this morning, just welcome to the 4th International Conference on Traditional Medicine Surakarta Health Polytechnic. We can conduct for the first speaker. We will invite Dr. Hussein first. And I just inform you all of the participants. Maybe you can, ask for question both in personality, just directly, or just drop your question in the chat room. Okay. Before we start, we invite Dr. Hussein Ahmad Bajri, PhD. Please welcome. Just give applause for. Okay, good morning, Dr. Hussein.
Good morning.
Yeah,
and good morning,
welcome to Klaten. Now we are in the Jamu department, room of Jamu department. So, lucky us, because Dr. Hussein already with us today, and we will, he will, give explanation about what the doctor. Holistic integrated approach for cardiovascular diseases in Indonesia. Is it
Yes.
right? Yes.
Hospital.
Do you have CV for Dr. Hussein committee? No? Yeah. No? If you don't know, just this one. Oh, so many. Yeah. Dr. Hussein Ahmad Bajri, PhD, and too many. Yeah. Doctor of Philosophy, Doctor of Naturopathy and Yogic Science, Diploma in Homeopathy, Diploma in Childcare, Diploma in Handicap, Diploma in Korean Koryosoji Gym, Diploma in Acupuncture, Diploma in Acupuncture and Pin Control, Diploma in Naturopathy. So many. So really, Dr. Hussein is the expert for all of this one. So that's why the title is Holistic Integrated. Okay. Excuse me, you have time around 30 minutes.
Okay.
Yeah, and then continue with discussion. Please, Dr. Hussein.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning, everybody. My respectful, the Dean of Faculty, all the lecturer, all the foreigner speaker, and good morning, all the 4th International Conference for Traditional Medicines, all the delegates. Ladies and gentlemen, when we talk about cardiovascular diseases, we wait for the slide. Okay. When we talk about cardiovascular diseases, it means we talk about the cardiovascular system, which include the blood vessel, and the heart. Okay. Holistic approach, it means, okay, we have to look at the disease by understanding the whole body system. When we treat the body, it is not the same than we are treating the diseases. Do I have to explain in Indonesian as well or not? Okay, ladies and gentlemen. Ketika kita berbicara penyakit dalam tubuh manusia yang mesinnya paling rumit yang diciptakan oleh penciptanya, kita tidak bisa memahami penyakit hanya berdasarkan pada penyakit semata. Tapi we have to look at the body as a whole. Kita harus melihat tubuh secara utuh. So, holistic approach, it means we have to treat the body physically, mentally, emotionally, and psychologically. It means treat the body, mind, and spirit. Memperlakukan tubuh, kita harus perlakukan tubuh secara utuh, body, mind, and spirit. Di mana fisik dan non-fisik harus diperlakukan yang sama. Itu yang membedakan pendekatan secara konvensional dengan holistic approach. Next, please. Di dalam metode pengobatan holistik, in holistic science, we have to listen to the body. We have to understand the body as a whole. So we should not listen only to the symptom of the body. Di dalam mengobati penyakit dalam metode holistik, kita tidak boleh melihat penyakit hanya berdasar pada gejalanya saja. Tapi kita harus melihat penyakit, the root cause, sumbernya di mana. Contoh, apabila kita sudah mulai merasakan ada gangguan pada jantung, biasanya kita mengenal gejalanya. Gejala yang paling ringan yang kita bisa lihat adalah kalau seseorang sedang berjalan nanjak dan tangannya memegang pada jantungnya. Atau mungkin kita seringkali melihat orang memijit-mijit di dada sebelah kirinya. Itu sudah sinyal minor heart attack. Dan kalau kita melihat orang jalan nanjak dengan terkesan napas terengah-engah, tapi kalau jalan datar tidak merasakannya, itu juga satu sinyal. Ladies and gentlemen, cardiovascular disease is #1 killer in the world. There are almost 18 million deaths every year. So penyakit kardiovaskular pembunuh nomor 1 di dunia, hampir 18 juta per tahun orang meninggal. Cardiovascular disease is a silent disease. Before the disease reach to the damage more than 70%, you don't feel any symptom. So, kebanyakan penyakit jantung atau kardiovaskular, dia tidak merasakan gejalanya secara awal. Menurut teori, sebelum penyumbatan itu lebih dari 70%-nya, kita tidak merasakan gejalanya. Maka, kenali jantung kita sedini mungkin karena Tuhan menciptakan tubuh manusia begitu hebat dan kompleksnya. Dia memberikan sinyal alarm ketika keruksakannya sedini mungkin. Kita seringkali menyepelekan alarm awal. The first symptom or any alarm that is telling you that the heart is already been disturbed. Next please. Karena waktunya 30 menit, jadi saya agak percepat. Ladies and gentlemen, we should know exactly the basic principle of holistic medicine. So, basic prinsip dalam pengobatan holistik, #1, natural. #2, non-invasive. #3, minimum chemical approach. Di Rumah Sakit Holistik Purwakarta, obat kimia dipakai untuk kedaruratan. Jadi kalau tidak darurat, obatnya apa? Obat dari bahan alam dan makanan sebagai obat utamanya. Lalu person-centered. Person-centered, what does it mean? 2 orang dengan penyakit yang sama, karakter tubuhnya belum tentu sama, pendekatan dan pengobatannya juga tidak bisa sama. Lalu yang terakhir, friendly environment. Ingat, separuh obat untuk orang sakit adalah lingkungan dan suasana. Next please. Okay. When we talk about cardiovascular disease, it means we talk about the blood. So most of the heart disease is not due to the heart problem. It is due to the problem of the blood and the blood vessel. Do not put the blame on the heart. Jangan salahkan jantungnya kalau jantung kita rusak. Salahkan darahnya. So when we talk about the blood, we have to see how good is our quality of blood. Next please. Kita lihat. Ladies and gentlemen, blood is life. So darah itu sumber kehidupan yang menentukan seluruh tubuh kita sehat atau tidak, khususnya jantung kita. So the quality of heart and the quality of our health is depend on the quality of your blood. So kalau darah kita kayak rendang Padang, karena pagi-pagi ketemunya nasi goreng dan mie instan, siang ketemunya rendang Padang, malam kurang lebih, apalagi generasi muda yang dimakannya bakso, seblak, racun semua. When we put toxics in your body, it's mean you keep toxics to your blood, don't expect your heart, okay, to be healthy. Kalau kita memasukkan oli campur dan bensin 2 tak ke tubuh kita, maka jangan harap darah kita akan seperti oli super dan bensin Pertamax Plus. Jadi mobil sebagus apapun kalau dikasihnya oli campur dan bensin 2 tak, apa yang terjadi? Karburatornya cepat kotor. Apa tandanya kalau karburator cepat kotor? Oh, mobil tenaganya sudah kurang, jalan nanjak sedikit ngos-ngosan, tired very easily. Nah, salahnya kita rawat mobil kita jauh lebih intens ketimbang tubuh kita. Mobil tidak mau terlambat ganti oli. Sedangkan tubuh tidak pernah ganti oli sepanjang masa. Karena kalau sakit justru toksiknya ditambah dengan berbagai obat. Walaupun obat perlu, tapi kita harus tahu sumber keruksakannya di mana. Because most medicine, they treat the symptom, not the root cause of the problem. Next please. Bapak dan Ibu sekalian, ladies and gentlemen, the quality of our blood is depend on the quality of food and drink that we eat and drink. So, kualitas darah kita tergantung dari makanan dan minuman yang kita masukkan ke tubuh kita. Next please. Setiap orang, every one of us, we must be our own doctor for our own body. So if the body considered like a car, we are the driver of the owner of the car. Jadi kalau tubuh diibaratkan mobil, tubuh itu mobil milik kita yang paling mahal. Sopirnya kita sendiri. Jangan bergantung untuk merawat mobil yang mahal, yaitu tubuh kita, hanya bergantung kepada dokter. Dokter bisa membantu, tapi dokter bukan orang yang paling paham tentang tubuh kita. So, be your own doctor. Why? Because everybody is unique. Setiap orang itu unik dan berbeda. Maka tugas kita, learn how to communicate with your own body. Belajar berbicara dengan tubuh kita to keep your body healthy. Ini satu contoh sel darah yang kualitasnya bagus. Ya, pagi-pagi bukan nasi goreng dan mie instan, Rendang Padangnya tidak terlalu sering. Next please. Ini contoh darah yang anak-anak kita kebanyakan mie instan. Jadi kalau dicek darahnya keriting kayak mie instan. Bapaknya kalau dicek lengket darahnya kayak rendang Padang, nyatu ya. Next please. Next please. Bapak dan Ibu sekalian. In this case study, okay, I'm giving you a very simple method to understand your quality of your blood. Pada contoh kasus ini, saya akan jelaskan bagaimana kita memahami kualitas darah kita. Untuk memastikan jantung kita memompa darahnya sambil cemberut atau sambil senyum. Kalau jantung kita kerjanya sambil senyum, jalan nanjak, oh kenceng larinya. Mobilnya, wah, hebat. Walaupun cuma Avanza, Bapak dan Ibu sekalian, kadang bisa mengalahkan Mercy yang tidak terawat. Mr. A, seorang laki-laki, age 43, usia 43 tahun, dyslipidemia, coronary heart disease, dan sudah beberapa kali kena serangan jantung. Pasien ini tidak mau mengkonsumsi obat kimia karena kalau orang sudah bertahun-tahun minum obat diminum nggak diminum sudah tidak berdampak. So he did not feel any different. He take it medicine or not take it medicine. So normally he decided to stop all medications. When he comes to me as a patient, okay, ketika dia datang jadi pasien, dia nekat sudah berhenti obat. Dan banyak pasien yang tidak mau minum obat. Ketika kita tanya, why? Because I don't feel any different. Atau ketika dia minum obat, dia tidak merasakan lebih baik. Many people when they take medicine, they feel even worse. So talk to your body. If you take any medicine and you don't feel any better, stop it. Biasanya, most of the cases of cardiovascular diseases, I'm not allowed to stop instantly. Kebanyakan kasus jantung saya larang untuk berhenti obatnya sekaligus. We reduce slowly. We look at how damaged is the heart. Tapi kalau orang sudah nekat dan tidak merasakan ada perbaikan, that is the choice. Because our patients who knows the body better, not we are the doctor. Kadang pasien kita, dia bisa paham lebih baik tentang tubuhnya. You know, most of cardiovascular diseases, there are two main medicines. Number one is statin to reduce cholesterol. Number two is like cardioaspirin to reduce the viscosity of the blood. Ada dua obat utama untuk penyakit jantung. Nomor satu, penurun kolesterol, merek dagangnya banyak. Nomor dua, pengencer darah. For the long run, untuk jangka panjang, pengencer darah itu umumnya akan berdampak pada lambung. Maka banyak dokter bingung ketika menghadapi pasiennya, diminum lambungnya kambuh, bahkan terjadi pendarahan tidak sedikit. Tidak diminum, jantungnya mengkhawatirkan. Jadi solusinya bagaimana? Bingung ketemu bingung, dua bingung hasilnya Bapak dan Ibu sekalian. So, when we come to the patients which are confused and bingung, they will come to holistic hospital. So we deal with a lot of bingung patients. Jadi kita sering menangani kasus-kasus yang sudah bingung. Ya. This case, okay, ketika datang, kita cek lab triglyceride 1,200. The total cholesterol 800, uric acid 13. Ladies and gentlemen, we have to understand three: triglyceride, cholesterol, and uric acid. This is I call trio wek-wek. Jadi kolesterol, trigliserida, dan asam urat ini trio wek-wek yang nggak mau berpisah. Di mana salah satu ada, yang lain selalu ingin ikut beriringan. This is package. And these three, okay, mostly the most that affected viscosity of the blood increase. 3 unsur ini penyebab utama kekentalan darah kita naik. Kalau darah sudah kental, apa yang terjadi? Jantung cemberut pompa darahnya. Selama 24 jam dia bekerja, dia sudah cemberut, napas sudah ngos-ngosan, kita cuekin juga, maka dia juga akan cuek pada kita. Next please. I did a very simple method to see, okay, the quality of the blood and the viscosity and the cholesterol in blood plasma. Take the blood out and do centrifuge. Okay? Exactly on the same day I did the centrifuge. Look at the blood plasma like margarine. How can the heart be smile? Working for 24 hours. Plasma darahnya kayak margarin. Okay? This is before treatment. Okay? So do not depend on laboratory result. Because lab result can be spoiled by drug. Hasil laboratorium itu bisa dibohongi dengan minum obat. Kalau kita minum obat, nampak kolesterol, trigliserida, asam urat kita normal. Tapi yang ngumpat di pembuluh darah tidak bisa dilihat dengan hasil laboratorium. Standar laboratorium hanya bisa memeriksakan kolesterol, trigliserida, asam urat yang mengalir di dalam darah. Tapi yang ngendap di pembuluh darah, yang ngendap di ginjal dan di sendi untuk asam urat, tidak bisa dilacak dengan laboratorium. So, sometimes a simple method of diagnosis is as important as standard diagnosis. Next, please. What we do? The first day, I'm giving ozone dialysis. Ozone dialysis, okay. This is high doses of ozone for 1 hour. Next, please. Look at this. This is from the right hand, take the blood out. Darah yang kita ambil dari jalur kanan tangan sebelah kanan, itu darah yang belum terozonisasi warnanya gelap, dan yang sudah terozonisasi warnanya merah. So I'm doing 1 hour ozone dialysis to reduce viscosity of the blood. Next, please. Exactly after 1 hour of ozone, the viscosity of the plasma is reducing a little bit, not much. Next, please. What I'm suggesting to the patient, stop all red meat. Stop semua daging merah. Stop all oily food. Stop semua goreng-gorengan. Ini orang Indonesia semua makanan digoreng, Bapak dan Ibu sekalian. Ya, datang ke Malang ada apel goreng, datang ke Subang ada nanas goreng, datang ke sini ada juga tuh bayam goreng katanya. Bayam pakai tepung digoreng, Bapak dan Ibu sekalian. Semua digoreng, yang tidak digoreng apa? Sendal jepit, Bapak dan Ibu sekalian. So our people, they like fried food. And this is the worst part for the heart and for the blood. Once in a while is okay, but not every day. Nasi digoreng, sambal digoreng, apapun. Sandal pun digoreng nanti. I recommend to eat fruit and vegetable not less than 40 to 50%. In some cases, I even add it to 60% of the diet every day. Jadi 40 sampai 50% makanan hariannya harus buah dan sayur. Lalu, I give herbal medicine. I recommend to do boiled coriander seed. Ketumbar. Biji ketumbar. Oke. 3 gram. Boleh diseduh dengan air panas atau digodok. Minum 2 kali sehari. Ketumbar salah satu yang sangat baik sebagai vasodilator. Dia bisa memperbaiki pembuluh darah, melebarkan pembuluh darah, and very good antioksidan. Maka kalau masak di rumah, jangan pakai bumbu penyedap. Bumbu-bumbu alami itu mengandung antioksidan yang sangat hebat. Kalau ada racun, dia bisa sebagai pencegahnya. Kalau pakai bumbu penyedap, jangankan masakan, ladies and gentlemen, air kali dikasih bumbu penyedap jadi gurih. So I recommend to drink olive oil twice. Saya anjurkan minum olive oil 2 sendok makan pagi sebelum makan, 2 sendok makan sebelum makan. Look, herbal medicine, jamu can be very effective if you follow the diet correctly. Jadi obat tradisional itu akan jauh lebih efektif ketika diikuti dengan diet yang benar. Bukan makan bebas, ngikutin iklan TV. Oh, mentang-mentang ada obat, kita bisa makan seperti raja. Ini kebodohan, Bapak dan Ibu sekalian. Don't follow. Okay. So I give garlic extract. Capsule in the morning, 2 capsule in the evening, because slightly hypertension also. On Q10 is coenzyme antioksidan. Lalu saya berikan Blazyme. Ini salah satu kandungan formulanya adalah lumricus yang dikeringkan dengan suhu rendah. Ada yang tahu lumricus? Cacing, Bapak dan Ibu sekalian. Kita kembangkan secara organik, lalu diproses dengan suhu sangat rendah. Karena apa yang baik dari lumricus itu ada 3, next please, ada 3 enzim utama sebagai anti-trombos. Dan ini termasuk salah satu obat herbal utama kita. Oh ya, when we talk about food, okay, for the heart, I always recommend apple, avocado, and pineapple. 3 buah ini, kalau pencernaannya toleransi, berikan pagi 2 bakul, malam 2 bakul. The heart is going to be smiling. 3 jenis buah ini suruh makan ya yang banyak pagi, malam. Ingat, makan buah yang terbaik pagi, perut kosong. Bukan cuci mulut habis makan. Next please. Salah satu keunggulan koriander, okay, dia mengandung oleic acid, linoleic acid, palmitic acid, ascorbic acid. Next please. This is, okay, lumbricose contain collagenase enzyme, fibrinolysin enzyme, and profibrinolysin active enzyme. I give the patient high doses of this before meal. Sebelum makan kita berikan. Next please. Ini kalau dimatikan akan lebih jelas sebetulnya ya. A few days after holistic treatment, the blood plasma is much better. Bisa dimatikan nggak ininya ya? Dia perubahannya hampir 50%. Okay. Only a few days after following the diet, herbal medicine, and doing one-time ozone dialysis. Next, please. Ini perubahan lebih signifikan, cuma nggak begitu jelas ininya ya. After 1 week of the treatment, okay. Next, please. This is after 1 week of treatment without chemical drug at all. Tanpa obat kimia sama sekali. Karena banyak pasien yang kadang menolak, dia merasakan I don't feel any different. Ya sudah. Trigliserida dia turun dari 1200 ke 518, total kolesterol dari 800 ke 282. Lalu uric acid masih tinggi, cuma sedikit turunnya 12,5. Next please. Look at the changing. Okay. This is the changing process of blood plasma week after week. Next please. Next please. Sebelum, sesudah. Okay. After 2 weeks, I don't give any ozone dialysis anymore. Okay. The blood plasma is changing a lot, but look at this. The thickness, okay, still quite a lot. At this moment, I added, next please. Do you know Ashitaba, Shalcon of Ashitaba? Ini disebut dengan seledri Jepang. Dan ini sudah dikembangkan di Jawa Tengah. Karena ini harus tumbuh di daerah dingin. Shalcon atau getah dari asitaba itu paling banyak didapat dari batang dan sedikit dari daun. Ini sebagai pengencer darah alami yang begitu hebat. Saya punya pasien retinopati sudah hampir 2 tahun tidak bisa melihat. Rutin selama 3 bulan kita berikan ini, kembali lagi bisa melihat. Retinopati diabetes, kebutaan karena gangguan retina pada penderita diabetes, dunia kedokteran tidak bisa berbuat apa-apa. Oke. Chalcone, high flavonoid antioxidant. And I call it, this is natural aspirin. Aspirin alami, which is good for the stomach, good for the heart, high antioxidant, and even good for the cancer. Bagus untuk jantung, bagus untuk pembuluh darah, bagus untuk pencernaan, bahkan untuk kanker sekalipun kita berikan. Cuma ketika kita memberikan dalam bentuk cair, hati-hati karena resiko alerginya sangat tinggi. Maka kita harus seleksi betul, terutama alergi pada kulit dampaknya. So we have to evaluate. Kita harus evaluasi 1-2 minggu pertama. Oke, tapi kalau diberikan dalam bentuk sudah formula kapsul, selama ini tidak punya banyak masalah. Next please. Ini 1 minggu setelah ditambahkan Chalcone asitaba, blood plasma just like normal. It takes only about 3 weeks from dari trigliserida 1200, kolesterol total 800, asam urat 13, and we do checks again. Next please. This is a different, okay. Next please. Ini setelah 3 minggu tanpa obat kimia sama sekali. Trigliserida, kolesterol total, uric acid. Next please. And this is the difference from the first before the treatment. This is first lab and this is second laboratory. Next please. Ini ada sedikit contoh kasus. A 24 years young man. Seorang anak muda 24 tahun. Keluarganya banyak dokter. Pengusaha. Asli dari Sumatera Barat. Pecinta rendang Padang. Usia 24 tahun sudah stroke 3 kali. Dan sekarang penderita penyakit jantung dan stroke semakin kesini semakin mudah. Kenapa? Why? Because we all do not understand talkings to our body. Kita tidak belajar berbicara dengan tubuh kita. Dan our lifestyles are toxic. Okay? We love eating instant food, instant drink. When we get sick, we are looking for instant drug. Gaya hidup kita sudah terbiasa dengan pola hidup. Makanan instan, minuman instan, dan kalau sakit juga sibuk nyari obat instan. Oke, yang super. Dimakan terus kabur semua penyakit. Ladies and gentlemen, cardiovascular disease is degenerative process. And it starts since you are at kindergarten. Penyakit jantung dan pembuluh darah adalah penyakit yang prosesnya tidak ada yang dadakan. Puluhan tahun. Dan dimulai dari sejak kita di sekolah TK mengenal makanan racun. Yang parah, di luar makanan kita racun, di rumah juga racun. So we are living in a toxic environment. Next please. Next please. Next please. Next please. Oke. Ini yang terakhir. Saya akan mengajarkan kepada kita semua. Oke. Biasanya kalau palm reading itu fortune teller. Oke. This is not fortune teller. Biasanya kalau kita membaca telapak tangan itu mencari keberuntungan alias dedukunan. Ini bukan dukun, Bapak dan Ibu sekalian, ya. Kita lihat. Kita sejak dini bisa memahami darah kita masih bagus, sudah pekat, atau sudah banyak toksik dalam tubuh kita. So, telapak tangan yang sehat, dia warnanya harus kemerahan. Walaupun orang Afrika, telapak tangannya nggak ada yang hitam. Ya, warnanya kemerahan, tidak pucat. Lalu kalau dipijit di ujungnya, ya, kita tekan ujung ininya, biarkan darah berkumpul di ujung jari, maka warnanya harus merah aduhai. Bukan merah pekat atau pucat. Next please. Coba lihat ini. Ini bukan karena hitam, ya. Ini kalau lihat gambar aslinya yang jelas, warnanya apa? Purple color, keunguan. This is the indications of, next please. Ini satu contoh high blood viscosity, darahnya pekat, kurang oksigen, and possible high toxic. Orang ini yang saya foto, dia tidak merokok. No exercise, and no proper diet, and obesity. Gemuk. Tidak selalu kalau tidak merokok itu sehat. Next please. Ini yang kedua. Oke. Dia warnanya lebih ke merah tua. Di ujung-ujung jarinya itu gelap. Orang ini masih relatif muda. Dia perokok berat, tapi rajin berolahraga. Dan kebiasaan makannya adalah tinggi protein. Next please. Ladies and gentlemen, superb health can be achieved by balanced nutrition, exercise, and positive mind. Next, please. My advice. Listen to your heart. Ada lagunya ya. So be your own doctor. Di dunia ini banyak metode pengobatan. Ada metode pengobatan alopati, ada homeopati, ada naturopati. Sebagus apapun metode pengobatan, there is no like sympathy to your own body. Sehebat apapun pengobatan, tidak ada yang lebih baik daripada bersimpati dan belajar memahami tubuh kita sendiri. Thank you very much and all the best. Bye-bye. Assalamualaikum.
Thank you so much, Dr. Hussein. So, interesting and mercy. You agree with me? Yes. So that's why we have around 10 minutes to discuss about the material that already done by Dr. Hussein. Is there any student or participant in this room want to ask something? Come. And invite also from Zoom. You can drop your question in the chat, and then Dr. Hussein will answer whatever you want to ask. Okay, I give the chance. Okay, you can ask in bahasa deh. Yeah.
Can discuss in bahasa
Yeah.
Indonesia.
Ini sudah mengerti atau? Are you clear enough with his explanation about blah 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 blah? Hello. Yeah. And we are still waiting for the
There's one
audience.
question.
Which
Oh,
one?
later.
Oh, yeah. Oh, cameraman. Yeah. Okay. Just say who are you and where I come from. Department or something. Just.
Baik, sebelumnya perkenalkan nama saya Muhammad Hakim Mujadid. Saya dari semester 5, jurusan Jamu. Saya ingin bertanya tentang friendly environment, khususnya untuk penderita masalah kardiovaskuler. Bagaimana menciptakan suasana lingkungan yang baik untuk penderita masalah kardiovaskuler? Dan satu lagi, selain ketumbar, tanaman obat apa yang dapat digunakan sebagai ramuan penderita kardiovaskuler? Terima kasih.
Saya rasa sudah jelas ya dok pertanyaannya, silakan langsung.
Baik. Lingkungan yang terbaik untuk orang kalau sudah punya penyakit kardiovaskuler adalah tinggal yang jauh dari kerumunan dan kebisingan kota. Maka kalau sudah tua, jantungnya mulai cemberut, pindah ke gunung. Walaupun di gubuk, tapi jantungnya akan tersenyum. Itu satu. Yang kedua, banyak tanaman yang bagus untuk kardiovaskuler, termasuk jahe sangat bagus, termasuk black seed oil, jintan hitam, itu juga bagus. Cuma yang harus hati-hati, ada sebagian obat tradisional juga berdampak menurunkan tensi dan menurunkan gula darah. Contoh misalkan jintan hitam. Jintan hitam atau black seed, dia punya sifat panas. Penelitian di India itu paling banyak. Dan indikasi yang paling baik sebetulnya untuk sebagai penunjang terapi diabetes dan kolesterol. Tapi kalau seseorang yang tidak punya diabetes, tidak disarankan mengkonsumsi dalam jumlah yang terlalu banyak. Karena gula darahnya akan cenderung turun, dan dia akan sering sakit kepala, atau akan merangsang selera makan lebih banyak. Terutama bagi yang sudah gemuk. Maka bagi mereka yang tidak punya diabetes dan mengkonsumsi black seed, sarankan minumnya di malam hari. Dan porsinya tidak harus banyak. Kecuali kalau dia punya hipertensi, punya kolesterol, punya diabetes, itu boleh diberikan standar treatment. Yang kedua, black seed itu sifatnya panas. Sebenarnya lebih cocok dan lebih tepat untuk penyakit-penyakit yang bersifat lembab. Apa penyakit yang bersifat lembab? Seperti apa? Infeksi pada paru-paru. Tapi pada gangguan yang misalkan sensitif lambungnya, ada gastritis atau stomach ulcer, lambungnya luka, cenderung malah tidak nyaman. Atau harus dikombinasi, dicampur dengan kandungan herbal yang bisa mengurangi unsur panasnya. Begitu pula jahe. Orang Jepang itu dikenal jantungnya paling sehat. Kenapa? Karena mereka konsumsi jahe. Menurut data, jahe merah dari Indonesia itu paling banyak dikirim ke Jepang. Orang Jepang tuh biasa kalau makan, ya, itu jahe itu di slice kayak dibikin difermentasi. Mereka makan mentah-mentah ya, dalam jumlah yang kadang-kadang cukup banyak. Dan kita harus membiasakan melatih kebiasaan itu. Apalagi pengkonsumsi goreng-gorengan. Orang yang hobi goreng-gorengan seperti budaya masyarakat kita, itu mutlak harus belajar mengimbangi atau mengkonsumsi herbal-herbal yang bisa mengurangi dampak jelek dari gorengan tadi. Terima kasih.
Sepertinya cukup jelas ya penjelasan. Ada yang belum dijawab?
Sudah.
Sudah ya. Thank you.
Terima kasih, Pak.
Ya. Actually your explanation is amazing, but because of time also we have to finish. Ya. Thank you untuk semuanya. And then to our participant, maybe in the room chat, there is no question. Yeah, maybe clear enough your explanation. So I just want to, resume a brief resume. If we, share or, provide the, to our client. So we have to think about the holistic as a whole, not just one point in our body. And then the second one is person center. Yeah, we also call as people is unique person, as a different one to other. And then we have to, equilibrium, menjaga keseimbangan mind, body, and soul also. And then the environment. And then just our doctor is not not our daughter is you, but our doctor is my yeah. And yeah, many also explanation about this topic. This topic is very interesting for us. Thank you, doctor. And maybe may I have like your phone to participant if sometime they want to ask directly. Okay, thank you. Then give applause to Dr. Hussein. And before, doctor, excuse me, just 1 minute maybe. Yeah, and have a seat. And then maybe from committee, you will give like a certificate. Yes, certificate. Yeah.
The next agenda is the chairman of the committee is invited to hand over the certificate, the Honorable Mr. Apotheker Anugrah Alamwaris, MSE. And the next session is taking photo together with all participants in this building.
The Honorable Miss Apotheker Indri Kusma Dewi SPAM MSc, Miss Atanasia, and any lecturers of Traditional Herbal Department on Health Polytechnic Ministry of Surakarta,
Okay, give
welcome
applause.
to take a photo session.
Silakan untuk I do apologize from the participant in the virtual while we are waiting for take picture together. So just give us time. Okay, ladies and gentlemen, we will continue with the second speaker, Dr. Abhishek Joshi. Okay, are you ready?
Yes, I can.
Yeah, thank you. Okay, we continuing for the second speaker, Dr. Abhishek Joshi. Yeah, Dr. Abhishek Joshi was born and raised in the Indian family where Ayurveda and yoga was in daily practice. So he is, expert in the Ayurveda and yoga. He took Bachelor of Ayurveda Medicine and Surgery and Medical Doctor, PhD in Ayurveda, and then postgraduate diploma in yoga therapy for doctors, and then chair of Ayurveda, Fakultas Kesehatan Ayurveda Universitas Hindu Indonesia, Bali. So I think you can also speak Indonesia.
Ya, bisa, sedikit bisa.
Sedikit. Yeah, thank you. Ayurveda doctor and teacher, 14 years of Ayurveda practice, and then co-founder Vaidya Ayurveda USA, and visiting physician Ponayo Arogya Niketanam Ayurveda and Yoga Center, Kerala, India. Okay, as you have 30 minutes, doctor, to present your material, yeah, and then 15 minutes for discussion. Time is yours.
Yes, thank you for the brief introduction. Salamat pagi to everyone at Surakarta. I'm sorry that unfortunately I could not be there with you all, especially the students. I hope I am audible to everyone. Can everyone hear me?
Yes.
Yes. Can you see my slide as well? I have just.
Yes, sure.
Okay. Okay. So I'm an Ayurveda doctor by profession. Ayurveda doctor is someone who has done 5.5 years of study into Ayurveda medicine. Yeah. So I'm going to tell some research-based studies which are linked to Ayurveda for cardiovascular diseases. Yeah. As Mr. Ahmad Bajri very beautifully explained, the cardiovascular system is mainly linked with heart, blood, and the blood vessels. Yeah. The core of the whole system being the heart, and that's why we celebrate the World Heart Day every year. Yeah. And the theme for this year was use heart to know heart. Yeah. So let us know something about heart. Why heart is special? Because it beats 100,000 times a day. And sometimes if it beats for anyone else, your partner, it beats more than this, definitely yes. Yeah. But on an average, it beats 100,000 times per day. Around 5.6 liter of blood is pumped every minute from the heart. And that's why in cardiovascular disease, apart from the blood vessels, heart plays a very important role, because that is the one which is pumping and circulating in the whole body. So in the early morning, it is around 5.6 liters per minute, which can go up to 7.5 liters per minute in the evenings. And heart also supplies, because it is functioning well, it can supply 60,000 miles of blood vessels in your body. 60,000 miles is equal to, you can go around the globe, around the whole world 2 times. That much blood vessels are there within your body. Yeah. And the one thing which is supporting the whole process of cardiovascular system is your heart. But this also gives a lot of load on the heart. And that's why the cardiovascular diseases, mainly comprising of heart problems and stroke, is a leading cause of death. Around 18.6 million annual deaths, which is around 31% of the total global mortality. This was way back in 2003. But now the World Health Organization estimates that by 2030, this number will go up to 23.6 million deaths because of cardiovascular diseases. Yeah. And we usually think, our heart problems are an old age problem. Mr. Bajri, Dr. Bajri very beautifully told how a 24-year-old kid, I can tell, had 3 heart attacks. And this is very common nowadays, because it is not restricted to older people at all. Yeah. Over 35% of heart attacks are in patients below 50. And 10% of heart attacks are for people below 30. Yeah. So everyone has to start taking care of the heart right from young age. Yeah. And there are several risk factors. Yeah. Smoking is the first and the most prominent risk factor. High fat diet. Yeah. Dr. Bajri mentioned about nasi gorengan. Yeah. If you're so much fond of nasi gorengan on a regular basis, this is not good for your heart. A sedentary lifestyle without activities, without exercise, without any movements is also a big contributor for heart diseases. Also, psychological factors, this is very important. Psychology affecting the cardiovascular system. Yeah, when you're under stress, you always feel, oh, I have some pain. Yeah. This stress is also a leading factor which is contributing to coronary heart diseases, causing heart attacks. So we'll discuss some things about this stress also. Yeah. Now, medication for heart disease is very effective. The modern science is evolved beyond imagination. You know, a lot of treatments, invasive, non-invasive medicines are there for heart diseases, for cardiovascular diseases. But this is chronic in nature, and the patient has to take these medicines throughout the life because of the chronic nature of the disease. Yeah. And they have to take these medicines for the rest of the life. And that's where, you know, the integrative approach, yeah, Pa Sunarto mentioned in his talk about integrative approach, yeah, wherein you are taking the modern medicines, the Western medicines, allopathic medicines, but with that, how can you contribute with the herbal medicines, yeah, which can reduce the burden of things on the patient, yeah. So the latest trends, what is running, you know, the robotic assist heart surgery program is the latest trend in modern surgery. It is like the surgery which is done by robots, which is operated by a doctor sitting somewhere far. Yeah, this is the latest trend. So heart invasive approaches to cardiovascular diseases have seen a big leap in modern medicine. Yeah. Coming to integrative medicine, Ayurveda and yoga are a holistic discipline. Yeah, the word holistic has been explained very well by Dr. Bajri, where he tells it is the whole system which you have to understand. Our human body, even though it can be divided into systems, all the systems of the body work as a single unit. Yeah, it is not different. It is working as a single unit. And this, if you understand, yeah, if it works as a single unit, if you understand this holistic approach, a lot of burden of diseases can be reduced. Yeah. Also, it is very pocket friendly to the patient. It is very economical. So it reduces the burden of medication and cost to the patient with least side effect, because this is not chemical, this is herbal in origin. What is Ayurveda? Ayurveda is a very traditional and scientific system of natural healing from India, yeah, which is recognized by the World Health Organization. Yeah. The word Ayurveda is Sanskrit. You know, there are many Sanskrit scholars, even in Indonesia, with whom I have met. So this is a language, you know, in which all the ancient science, all the Vedas, the Puranas were written in Sanskrit. So the word Ayurveda means the knowledge of life. Yeah. And this knowledge of life is not limited to one system. It is a holistic approach to a disease which is explained in Ayurveda. Yoga, we all know, it is a comprehensive and holistic system which focuses on body, mind, and consciousness. Yeah. It is a very integral part of Ayurveda. So when a patient of cardiovascular diseases, it may be heart issues or blood issues or stroke or paralysis because of the stroke, all these diseases, along with herbal medicine, in my practice, we do recommend yoga, therapeutic yoga, which can be given to all the patients. So this is very simple yoga, which can be practiced for good health. Yeah. Yoga promotes longevity, long life. It reduces anxiety, promotes well-being, and good quality of life is very much the effect of yoga. And safety profile is excellent. It is non-invasive and hence can be given to people very easily. Ayurveda, yeah, it is an unhealthy lifestyle with low levels of physical activity and high intake of unhealthy processed food, main cause of heart diseases. Yeah. So when you come to Ayurveda, the diet plans, the herbal preparations, yeah, like you have Jamu in Indonesia, yeah, the therapeutic practices, yoga and pranayama play a very important role when it comes to Ayurveda healing. Yeah. The treatment helps to control and even eliminate the causative factors. Yeah, because the root cause is in the blood, is in the heart, is in the blood vessels, which is getting blocked because of the dietary lifestyle sometimes. And what this herbs does is removing this basic causative factors and hence helping the heart to live healthy. Yeah. So the onset, even for modern medicine, was herbal in origin. Yeah. A careful review of modern pharmacology indicates that cardiovascular drugs, all the medicines of cardiovascular, were developed from plants. They were the source initially. In 1776, when it all started, Willem Withering reported that digitalis, a plant, had shown miraculous effect in many cases of dropsy. 1911, when the cardiovascular diseases, the Western medicine, the allopathy was reaching its peak, Sir James Mackenzie demonstrated that digitalis blocks the atrioventricular condition. This invention unearthed the potentialities of medicinal plants for the management of cardiac failures. And thus opened the Pandora of modern medicines. Cinchona bark, quinidin, an isomer for anti-malarial drug quinidin, is one of the natural alkaloids occurring, and it is an anti-arrhythmic drug. Means if the heart is not pumping properly in proper rhythm, cinchona bark is a very useful medicine. Sarpagandha, it's an Ayurveda medicine. It has an alkaloid called as reserpin. It is from the root of Rolfia serpentina, a plant. By far, until now, it is the most potent of all hypotensive alkaloids. Whereas ajmalin has quinidin-like properties. So Sarpagandha, one herb, is very good for hypertension. Where hypertension and Nike, this herb is till now the best alkaloid, having the best alkaloid to bring down the hypertension. And this herb is widely used in Ayurveda as a medicine. Ergot, dihydrogenated ergot alkaloid or hydrogen is indicated in hypertensive therapies to reduce hypertension. Aspirin, we all know, aspirin and ecosprin, aspirin is one of the very good allopathic medicine to reduce the clotting factors in the blood. It is developed initially from natural resources. And from Willow Salix alba tree, this extract was developed initially, but later it is made chemically in the labs now. It has demonstrated to reduce the incidence of myocardial infarction. Myocardial infarction, the heart attacks, happen because the blood is thick. When the blood becomes thick and it gets clotted in the small arteries of the heart, that is when myocardial infarction or heart attack happens. So this specific plant, willow tree, has the capacity to reduce that congestion of blood vessels, thickness of blood vessels, and thereby preventing heart attacks. Now, why Ayurveda herbs? Why herbal medicine? Because it has proven effects to lower high blood pressure, hypotensive in nature. It improves the circulation. Dr. Ahmad Bajri very beautifully explained that it is the blood which is responsible for most of the heart diseases, heart attacks. Herbal medicine has the capacity for antiplatelet and thrombolytic activities in the body. It also increases the aerobic function. When heart is getting good amount of oxygen, we are breathing well. The aerobic function of the small capillaries is good in the heart. Definitely heart attacks can be prevented. It lowers the cholesterol level. There are Ayurveda herbs which are hypocholesteremic, reducing cholesterol levels, like statins, which are giving in the modern medicine, Western medicine. The herbal medicine also has these properties. It improves the elasticity of arteries, decreases stress levels, because stress is one of the major factors contributing to cardiovascular incidences. And generally the herbs, the natural form of herbs is cardioprotective in nature. Let us go into some herbs, understanding some herbs which are used in Ayurveda medicine, Ayurveda herbal medicine for treatment of cardiovascular problems. Arjuna, Terminalia arjuna. Clinical studies have shown the efficacy of bark of this tree in congestive cardiac failure, chronic stable angina, heart pains, the chest pains which come as a precursor to heart attack, and it also reduces hypertension, hypertension. Terminalia arjuna and its constituent, arjunolic acid, which is an active ingredient in the tree Terminalia arjuna. It has shown cardioprotective effects because of antioxidant activities in vivo studies. Another very simple, very easily available herb. Yeah, it is also available in Indonesian kitchens. Ada dari dapur-dapur Indonesia juga ya, namanya bawang putih, ya, or garlic. There is scientific evidence that alcoholic extract of the bulb, yeah, bawang putih, or Allium ascalonium, yeah, single clove garlic, the English name, it showed significant anticoagulant properties, fibrinolytic properties, and hypocholesterolemic activities. Means it reduces the thickness of the blood. It is anticoagulant, yeah, so it does not allow the blood to coagulate very easily, thereby preventing the clots in the blood, which is responsible for heart attacks, and it also lowers the cholesterol in the body. There is also evidence that bawang putih is associated with blood pressure reduction. If there is a lot of hypertension in any patient, it can reduce the blood pressure, the systolic blood pressure, by 10 to 12 and 6 to 9 of diastolic blood pressure in hypertensive patients. Another very common herb available in Indonesia, we know it dari Indonesia, namanya sambiloto. Yeah, it's a very common herb which is used in Jammu, which is used in Ushadha Bali, the medicinal system in Bali, which I have seen. And in Ayurveda, this herb is called as Kirata Tikta. Yeah, Latin name is Andrographis paniculata. Yeah. The crude extract of Kirata Tikta sambiloto and its active ingredient is androglufonide, has shown hypotensive activity. It reduces the hypertension in people when given in extract forms. Yeah, this is proven in vivo studies in laboratories. Studies also revealed that sambiloto inhibits human platelet aggregation. Yeah, again, it prevents the coagulation of blood vessels, that prevents the thickness in the blood vessels, which is responsible for heart attacks. It also helps in restenosis of artery and coronary after coronary angioplasty. After operations, what is the ultimate thing? You'll go for an heart operation if you have a heart attack. But there is chances of reoccurrence of again and again stenosis in the arteries, which can again lead to a second heart attack or a third heart attack or a fourth heart attack. In such cases also, the extract of Kirata Tikta or sambiloto has proven very effective. Another herb is turmeric. Yeah, turmeric, which we all know, which we all use in our dapur, yeah, which is all available in the kitchen gardens in Indonesia. The rhizome of Curcuma longa, turmeric, and its constituent, active constituent, curcumin. It processes hypolipidemic. It reduces the lipid or cholesterol in the system. Anti-atherosclerotic action. If given in certain concentration, it can prevent the plaques which are there in the arteries, the deposition in the arteries, it can reduce, and it has anti-thrombotic effects. Jatamansi, another very well-known herbal Ayurveda medicine. It has constituent known as Jatamason. It has significant effect on hypertension in patients. It also regulates the heartbeats. The rhythm of heartbeat, if it is not proper, Jatamansi can also help to regulate it. Yeah, it has also sedative and tranquilizing activity, which helps to go down into a good sleep to the patient also. Pushkar Guggulu, another formulation of Ayurveda made from two herbs, Pushkarmul and Guggulu. It has proven anti-anginal and hypolipidemic activities, which helps in heart diseases. Hawthorn, yeah, it's the leaf and the flower extract has shown a very promising effect in chronic heart failure. It is approved by German Commission as a medicine, the extract of hawthorn leaf and flower in heart failure grade 2. It is a very good medicine for chronic heart failure as well. Flax seeds, another very common thing, pumpkin seeds, which is available very easily around you. The meta-analysis has determined that supplementation of this flax seeds is associated with a decrease in blood total and LDL cholesterol, HDL and LDL cholesterol, which is known as the bad cholesterol in the body, it decreases, goes down with regular consumption of flax seeds. Also, the HDL, which is the good cholesterol, it goes up. Yeah. The study reported that flaxseed interventions related to significant reductions in total and LDL concentrations. Flaxseed also contains large amount of fiber, yeah, dietary soluble fiber, which is shown to lower the cholesterol, and it is also a rich source of dietary lignans. Yeah, a multitude of cardiovascular benefits have been proposed for flax seeds due to its alpha-linoleic acid content. This is the active ingredient which is attributed for its activities. Another very important herb is ashwagandha. Yeah, there's a very nice study, clinical study on patients done wherein the maximum oxygen consumption of a person, yeah, which is very important for cardiorespiratory fitness, for the fitness of the heart. It was shown that there was significant increase in the maximum oxygen consumption which your body does by consumption of ashwagandha. It's a herb, yeah, Ayurveda herbal medicine, by after 12 weeks of consumption. Yeah, this finding suggests that the root of this plant improves the cardiac health, yeah, the heart health, by increasing the total oxygen consumption capacity in the patient. Now, stress is equal to risk of cardiovascular disease. Why? Because with a lot of stress, there is a lot of inflammation in the body, yeah, which is in turn linked to the factors which can harm your heart. Stress also increases the hormone called as cortisol in the body. Increased level of cortisol can increase the level of cholesterol in the body, the triglyceride, the blood sugar, and blood pressure in the body is attributed to cortisol. So stress is directly related to cardiovascular problems, issues in the body. Ayurveda, where Ayurveda helps for stress, ashwagandha, again, is a very potent medicine. It significantly reduces stress. Yeah, many research studies have been published on ashwagandha as a stress reduction medicine. Yeah, it reduces the serum cholesterol levels also. Another tablet, MR tablet, you know, a study was done. It is basically a combination of 4 herbs, Mandukaparni, dari Indonesia, namanya Pagagan, Guduchi. Yeah, Guduchi is another very common Indonesian herb which is available in Indonesia, namanya Brutowali. Yeah. Third one is Yashti Madhu. Yashti Madhu is also available in Indonesia and India as well, namanya Akar Manis. And fourth one is Shankha Pushpi. A combination of these 4 herbs, a tablet was made and a clinical study on patients was done, which indicated that it helps in reducing the stress in children. Again, Mandukaparni, yeah, Pagagan. Many studies have been done on Pagagan as a stress reducer. Yeah, a significant increase in mental ability of children was observed. Also, their behavioral patterns changed after giving Pagagan for 6 months. There are some Ayurveda therapies, yeah, treatments which we use in Ayurveda. These are all herbal therapies. Like in our hospital in India, we use around 60 external therapies for treatment. Some of those therapies which are very potent to heal your heart, yeah, one is Abhyanga, an Ayurveda oil massage. Yeah, there are many clinical studies which have shown effect of this Abhyanga to reduce the stress in the body and thereby help in proper functioning of the heart. See, a pilot study on Abhyanga or a body oil massage with Ayurveda, it reduces significantly, it reduces the stress experience. It is also beneficial in lowering the heart rate and blood pressure in pre-hypertensive patients. Many other studies have been done where deep tissue massages reduces the systolic blood pressure. Yeah, यदि hypertension या नाइक A good massage will help to reduce the blood pressure by 10 to 10.4, the diastolic by 5.3, the mean arterial pressure by 7. On an average, a single deep tissue massage or a abhyanga can reduce heart rate by 10 in a patient. So this is all effective for cardiovascular diseases. Another treatment which is done is Urovasti. Now, a bridge is created with floor on the heart area, and herbal medicated oil is poured on that bridge, inside that bridge. Yeah, this is another very effective treatment for heart diseases, which is used in Ayurveda. Another very potent medicine is Shirodhara, wherein the herbal oil is poured on the forehead of the patient. Yeah. So this has shown clinically, I'm talking about clinical studies which are about Shirodhara, which has shown significant improvement in stress. It has reduced serum cortisol level, which is a very potent hormone in the body to increase stress, which is initially high. Shirodhara reduced the serum cortisol and DHEA in the body. So this therapy was found very effective in reduction of stress and thereby helping in the cardiac health. There is also an antidepressant effect of this therapy, Shirodhara. It is also effective in neuroendocrine modulatory influence, with Shirodhara. It cured. In Ayurveda classical literature, when I talk of Ayurveda, the herbal medicines, there are 13 single herb remedies and 133 compound formulations which are indicated in heart disease or cardiovascular diseases in Ayurveda. There are total 146 formulations. Out of these, 203 are plants, 6 are of animal origin, 5 are inorganic compounds, 7 are metals, and 8 are salts and ashes. What is the add-on benefit of Ayurveda? Why herbal medicine? Why Ayurveda medicine? Least side effects. Because it is not chemical medicine, it has least side effects. It has easy access. I enumerated a few medicines which is easily available in Indonesia. Jahe, easily available. Sambeloto, easily available. Bawang Putih, ada dari Indonesia. Akar Manis, ada dari Indonesia. This is easily available and economical. Pocket friendly to all the patients, and it improves overall health of the patient also. And that's why Ayurveda or herbal medicines, integrating this to the Western medicine is of great benefit to the patient. Yoga, we all know, yoga is one of the most popular thing in the world right now. When the World Yoga Day was planned in United Nations, was proposed by India, but it was accepted, by first few countries, and Indonesia was one of them. I'm very happy to tell that Indonesia was one of the few countries who voted in UN that there should be a World Yoga Day, in the United Nations. And thereby 21st June was adopted as World Yoga Day in United Nations. Yoga for cardiac patients is most commonly for stress, emotional health, and general wellness. It is also very good for stress management and coping skills and cardiac rehabilitation. It also works by reduction of cortisol. It works on hypothalamic pituitary adrenal axis, HPA axis, which is a regulator of many hormones in the body. It causes typically it is very good for increased heart rate. It is scientific studies are there which shows decrease in heart rate by regular practice of yoga. Many studies have been done in which yoga has helped in weight loss, reducing blood glucose, reducing the blood lipids, the triglycerides, the LDL, and reduction in the anginal episodes in patients with coronary heart diseases. Even post-surgery, suppose a patient has gone for a surgery of heart, CABG is the most common surgery which is done for heart patients, yeah, modern surgery, allopathic surgery, coronary artery bypass graft surgery. Yeah, this is an ultimate thing for any heart patient which will be done in allopathic medicine. In this also, post-surgery, yoga has helped to decrease anxiety, the pain, and the depression, which is very common with the surgeries. Yeah. Again, Surya Namaskar, yeah, the sun salutations of yoga. There is a scientist, Dean Ornish, yeah, who has developed a program to reverse heart diseases without drugs or surgery just by using yoga and lifestyle modifications. Now, yoga is not equal to exercise. This is sometimes, where people fail to understand. Yoga is mental, spiritual, physical practices. Yeah, exercise is just physical fitness. Yoga is synchronized breathing pattern. Yoga is steady postures and relaxation in that posture. Yeah, it relieves the stress on the heart. There is no risk of injury in yoga. Yeah. Now, the difference between yoga and exercise, there was a very interesting scientific study wherein the patient was subjected to intense exercises, and the second, the patient was subjected to yoga. Yeah, yoga is also low intensity exercise. In yoga, you don't have to jog too much. You don't have to run. Yeah, yoga is low intensity exercise. Low intensity exercise has proven to reduce the cortisol level in the body, and it improves the sympathetic stimulation. Sympathetic stimulation, what is sympathetic stimulation? If I explain it in simple words, your heart is beating. It is not in your control. It beats on its own. Yeah, that is sympathetic, parasympathetic circulation. Yeah, so this is controlled by low intensity exercises, whereas high intensity exercises, jogging and running, yeah, or weightlifting and all, it increases the pressure, it increases the cortisol level, yeah, the system. Hence, yoga is more beneficial than exercise for cardiac patients. There is another very important, very powerful technique called as Sky Yoga, Sudarshan Kriya Yoga by The Art of Living, and it has shown, yeah, reduction on Beck's depression inventory. It has shown reduction in depression, and it is equally comparable to antidepressants, yeah, like imipramine. Yeah, a clinical study was done. So practices of yoga along with breathing practices, breathing exercise is very beneficial in patients of cardiac. Relaxation techniques have shown statistically significant reduction in systolic and diastolic blood pressure in hypertension in the patients. Shavasana, lying down comfortably and easily. You can listen to some calm, composing music. It has shown reduction in depression among university students. Yoga Nidra is another very powerful technique, yeah, of reduction for promotion of complete health, physical, mental, and emotion. It has shown significant reduction in blood pressure and CRP levels. Stimulate the second heart to keep your main heart healthy. I'm going to tell you 3 simple exercises to stimulate your second heart, which is your gastrocnemius muscle and soleus muscle, which is located in the calf muscles. The pumping action is very critical to the blood flow, and that is why it has earned the name secondary heart of the body. So these 3 exercises, which I'm going to suggest you, yeah, which I was going to show you in the video, it is very important to keep your heart healthy. Exercise number 1, stabilize your feet properly on the ground and then lift your body on the toes. Yeah, as you see in the video, just lift your body on the toes up and down, up and down. This is a very good exercise for your gastrocnemius or the soleus muscle, which is known as the second heart of the body. This is exercise number 1. Exercise number 2, when you increase, when you are raising your body on the feet and the heel. So it is a synchronized movement on the heels, on the feet, on the heels. Exercise number 2. On your heels, on your toes. On your heels, on your toes. Exercise number 3. This is an excellent exercise as recommended by Dr. Hegde, a leading cardiologist in India and UK. He recommends this exercise daily, 10 times, 10 to 15 times. Practice this to increase the capacity of your heart. For your healthy heart, this is a very, very effective exercise. So daily habits along with this exercise, these 3 exercises which I mentioned, daily habits which can do wonders for your heart health. A good balanced diet with a lot of fruits, a lot of veggies in your diet, yeah, and do not overeat. Practice regular yoga. 20 minutes of yoga daily can enhance the functioning of your heart to a great extent. Drink plenty of water, adequate sleep, stress management through meditations, through deep breathings can keep your heart healthy. Limit your salt intake, quit smoking, moderate alcohol consumption is again very good for your heart. These 3 food habits are very good if you have any heart issues, and this will also keep your heart healthy. Regular checkups for your blood pressure and socially connected, stay connected to people around you. Have a healthy chat, a healthy laugh with your friends, good positive relationships. A happy heart loves good company. If you want to stay connected with me, I'm available on Instagram as Dr_Abhishek Joshi. I have a Facebook page called as Ayurveda Expert. You can connect to me also on my website, ayurvedaexpert.in, and on my YouTube channel, where you can see a lot of informational videos about Ayurveda, about health, about herbal medicine. My channel is Ayurveda Expert. You can find me authentic.ayurveda expert on YouTube. So, terima kasih untuk semua, for listening patiently, and let the heart blossom and let your heart be healthy. Thank you very much.
Terima kasih kembali. Tepuk tangan. Let's give applause. Thank you, Dr. Abhishek Joshi. It's so interesting for us actually about this your topics. And because time is limitation, so I invite this maybe participant will ask something. Yeah. Is there any? I mean, one. Yes. This question from Raymond Arif. Yeah. How should saffron and safflower in Ayurveda? Do they have same similarity activity or not? And how about herbal interaction with cardio drugs in Ayurveda? Just your time to answer.
Yes, saffron is used in Ayurveda. Saffron is a very potent medicine. Yeah, and the flowers, the stamens of saffron is basically used as a medicine. Yeah, which is known as safflower. Yeah, in Ayurveda we call it as kumkuma. In Ayurveda, saffron is known as kumkuma, and it is a very potent medicine. But specific indications of saffron in cardiovascular diseases is not indicated. Yeah, I have not come across any studies or saffron as a medicine for cardiovascular diseases. No. Do they have similarity in activity or not? Saffron basically is the whole plant. Saffron flower, safflower is the one which is used as a medicine. So yes, it is the same plant, the same thing which is used as medicine. And herbal interactions. Saffron is basically used in Ayurveda as a beautifying agent. We have a oil known as Kumkumadi Thailam, which is a very good skin, beautifying agent. Yeah, so saffron is more used in that senses. How herbal interactions with cardio drugs in Ayurveda? Yeah, Raymond Arif has asked again. Whenever we give Ayurveda herbs, we never stop allopathic medicine. Yeah, we should not stop it. As Dr. Arif, the previous speaker, yeah, he mentioned, we never stop it. So in Ayurveda, we never stop it. It is a very slow progression of Ayurveda medicines given along with allopathic medicine. Yeah. Slowly as the health, like this is what I do with my patients. Any hypertensive patient, any cardiac patient coming to me, I will not stop their regular medicines. I will tell them to consult that regular cardiac doctor for the allopathic medicines. I will introduce my Ayurveda medicines and tell them for a regular checkup. Yeah, so the patient is regularly checking the blood pressure, the triglyceride levels, the cholesterol levels. Things are improving. I will slowly taper down. I will refer him to the cardiac patient and he will taper down his medicines. Yeah, because the heart is getting healthy. This is how I practice Ayurveda in my patients. What kind of herbal oil? There's another question from Noor Atika. Yeah, what kind of herbal oil is used to treat hypertension? And that you mentioned before, is there any evidence based about it? Herbal oil, basically herbal oil internal consumption, we are not suggesting. Yeah, reducing the oil in the food substances is very important when you have cardiac diseases. We suggest use of ghee. It's a common preparation which we find in India, and it is available in Indonesia also. It's called as ghee. It is made as a fat, mono unsaturated fat, which is made from milk. Yeah, it's a fat. Ghee is a fat which is made from milk, and this fat is excellent for your heart. So if you want nasi goreng, if you cook it in ghee, yeah, because you're fond of that food, if you cook it in ghee, this is an excellent food. You can still eat nasi goreng. It gives you a better taste, and it is good, healthy for your heart also. Yeah, ghee is basically clarified butter. Yeah, and it is a very potent oil which can be used on a daily basis. Olive oils are again good for the heart. If you're asking for a particular oil, olive oil is very good for the heart. What I mentioned in my talk is of a therapy on the heart, and the medicated oil is poured over that. Yeah, it is not internal consumption of that oil, it is external application of the oil on the heart. And there are hundreds of oil which are used, but this oil is used after assessment of the condition of the patient.
Okay, thank you, Dr. Abhishek. Thank you also for Raymond and Ika who already asked the question, and Dr. Abhishek also give clear enough about the answer. Is there any participant will ask? No? Also in the room chat also. Okay. I think it's because of limitation, so we have to close from this session. And thank you very much to Dr. Abhishek Joshi.
Very good question.
Hopefully that next time maybe we will see you again. Maybe not on the cloud, but if you
Sure.
come to Indonesia, just come to Poltekkes Kemenkes Surakarta, Health Polytechnic of Surakarta. Thank you so much. And before we are closing for this session, from committee, you will just give like online, yes, hey, online. Okay, Miss.
Thank you.
Mr. Alam will. To Dr. Okay, on behalf of committee, I just thank you for Dr. Abhishek Joshi. This is a certificate that actually give you, but we will maybe send letter about the physically. Yeah. Thank you again, Dr. Abhishek Joshi. God bless you.
Thank you.
Yeah, good afternoon. Okay, thank you. Ladies and gentlemen, I think this session already done, and thank you for speaker Dr. Hussein and Dr. Abhishek Joshi and all participants in this room. As person, and then from the chat of Zoom. And as moderator, I do apologize if I have, some any mistaken that I did since this event. Yes. Thank you again. Good morning. Wassalamualaikum warahmatullahi wabarakatuh. And time I give you back to MC. Thank you.
Thank you, Miss Atanasia Budi Astuti, SKP MN. The next agenda is the chairman of the COMET is invited to hand over the certificate for the Honorable our moderator, Miss Atanasia Budi Astuti, SKP MN. We would like to thank you for the Honorable Mr. Hussein Ahmad Badri, MD, PhD, and Mr. Dr. Abhishek Joshi, and our moderator, Miss Atanasia Budi Astuti, SKP MN.
Distinguished guests, ladies and gentlemen, now we come to sharing and discussion session again. The third speaker is Mr. Muhammad Zaheswan Abdul Wahab BPharm, Master of Clinic Pharmacy, PhD, RPH, the Deputy Dean for Academic Affairs, Faculty of Pharmacy, University Technology Mara, Malaysia, with the theme, The Use of Traditional Medicine for Cardiovascular Disease Effectiveness and Safety Concern. Also, the fourth speaker is Mr. Kalpana Paudal Aryal, PhD, from Tirbuhan University Institute of Medicine, Birkun Nursing Campus, Nepal, with the theme Yoga as Powerful Intervention for Prevention of Cardiovascular Disease and Associated Comorbidities.
The second session will be moderated by Mr. Ardian Julianto, AMD. Good morning, Mr. Ardian Julianto, AMD. Before we start, we will read out the CV of our moderator. He is Mr. Ardian Julianto, AMD. Mr. Ardian Julianto, Laboratory Staff. Profile, born in July 9, 1904. Currently working as a laboratory staff at Pharmacy Department, Health Polytechnic of Surakarta, a language enthusiast. Education, Indonesia Open University, English Literature Undergrad Program. 11 Maret, University Pharmacy Diploma Program. Language, Indonesia Native, Javanese Native, English Intermediate, Korean Elementary. Working experience, Health Polytechnic of Surakarta, Laboratory Staff Pharmacy Department. 11 Maret, University Hospital Pharmacy Technician. Mr. Ardian Julianto, AMD, time is yours.
Okay, Assalamualaikum warahmatullahi wabarakatuh. Morning, ladies and gentlemen. Welcome to the 4th International Conference on Traditional Medicine. I'm Ardian Julianto, and I'm going to be your moderator for the second session today. And there will be two speakers in the second session. There are Mr. Muhammad Zaheswan Abdul Wahab BPharm, M. Klein Parm, PhD at PH, the Deputy Dean of Academic Affairs, Faculty of Pharmacy, University Technology Mara, Malaysia. And the second is Dr. Kalpana Paudel Aryal, PhD from Institute of Medicine, Tribhuvan University, Nepal. Okay, first, I would like to greet Mr. Muhammad Saheswan. Hello, Mr. Muhammad Saheswan. Are you with us now?
Yes. How are you? I'm good.
Okay, I'm good, sir. Thank you. And the next is Dr. Kalpana. Hello, Dr. Kalpana. Are you with us now?
Yes, hello, good morning. I'm here, yes. I'm in.
Yeah, okay, thank you. And I would like to explain each speakers for this session has 45 minutes to deliver the presentation and will be followed by discussion session. Ladies and gentlemen, this conference is conducted by hybrid conference. So if there are any question for participants who join offline here, you can just raise your hand and ask the question directly. And for participants who join online via Zoom or YouTube, you can raise a hand or type your question through chat box and I will read it for you. Okay, I'm going to the first speaker in this session, Mr. Muhammad Saheswan. Hello, Mr. Muhammad Saheswan. How are you today?
I'm good. Thank you very much. How are you?
Yeah, I'm good too. Thank you for coming in here for International Conference of Traditional Medicine. And first, I will write your profile. Mr. Muhammad Saheswan Abdul Wahab, B.Pharm Hons, M. Klein Parm, PhD on pharmaceutical care, and the working experience is currently lecturer in pharmacy practice, University Technology Mara, Malaysia, and fully registered pharmacist at Sabak Bernam Health Center, Malaysia. And for administrative position, Deputy Dean for Academic Affairs, Faculty of Pharmacy, University Technology. Okay, University Technology Mara for academic qualification. PhD in Pharmaceutical Care, Faculty of Pharmaceutical Science, Chulalongkorn University, Thailand in 2019. Right, Mr. Muhammad Saheswan, you have 45 minutes. There's 35 minutes for presentation and 10 minutes for Q&A session. Mr. Muhammad Saheswan, time is yours.
Yep. Thank you so much, Mr. Moderator. Let me just share my slide. Okay, can you see my slide?
Yes, clearly.
All right. So again, thank you very much. First of all, Assalamualaikum and a very good morning to the audience. And thank you very much to the organizer for inviting me to the 4th International Conference on Traditional Medicine. So I'm very honored to have the opportunity to talk in this conference. So today I'm going to talk about the use of traditional medicine for cardiovascular diseases. And I'm going to talk a little bit on the effectiveness and safety concerns. Thank you again to the moderator for introducing me. My name is Muhammad Saheswan Abdul Wahab. I'm from the Faculty of Pharmacy UITM, which is University Technology Mara. in Puncak Alam, Malaysia. So this is how my campus looks like. It is located about 40 minutes from Kuala Lumpur. It's a very beautiful campus, and I would like to invite everyone attending this conference today to visit us in Malaysia one day. Okay, so let's start with the definition of traditional medicine. So the World Health Organization defines traditional medicine as the sum total of the knowledge, skill, and practices based on the theories, beliefs, and experience indigenous to different cultures, whether applicable or not, used in the maintenance of health, as well as in the prevention, diagnosis, improvement, or treatment of physical and mental illness. So traditional medicine is quite prevalent in our countries. I believe it is prevalent in my country and your country as well. And Indonesia, you have traditional medicine in the form of jamu, which is a very popular traditional medicine. And it is also available in Malaysia as well. And we need to be proud of that, of this tradition that has been passed from generations to generations. In certain countries, traditional medicine is also called as complementary and alternative medicine. And I would use this term interchangeably in my presentation. But basically, complementary and alternative medicine can be divided into several categories, such as the manipulative and body-based therapies. And the modalities involved include massage, chiropractic, and osteopathy. Mind-body interventions, as just explained by Dr. Abhishek just now. Yoga is part of it, spirituality and relaxation. And we have alternative medical systems such as homeopathy, naturopathy, and Ayurveda, energy therapy, Reiki, magnets, and Qigong, and also biologically based approaches which use products such as dietary supplements, herbal medicines, and vitamins. And I'm a pharmacist by profession. And in my career, I would mainly encounter the use of biologically based approaches among patients to treat, prevent diseases, or maintain their health. And in this presentation, I would focus mainly on the biologically based approaches, which include dietary supplements, herbal medicines, and vitamins. So there are many people who are using traditional medicine. And according to the WHO, millions of people use traditional medicine. And there are a lot of reasons why people use traditional medicine instead of conventional medicine. These are some of the factors as reported in the study that I have cited here. Some individuals may have limited access to healthcare, which encourage them to use traditional medicine. The credibility of traditional practices at a country, for example, will also influence people to use traditional medicine. Strong cultural identities, such as in my country and your country, we have a strong cultural identities in which our culture has incorporated the use of these medicines for centuries, and this has influenced the use of traditional medicine as well. People who have certain diseases may want to try traditional medicines, and some people who understand their disease may go for traditional medicines to alleviate certain symptoms or to reduce certain symptoms. There are also many other reasons why people are using traditional medicine or complementary and alternative medicine. And for example, these products are very easily available. To access or to obtain traditional medicine or complementary and alternative medicine is very easy. It's not like when we are getting medicines at a pharmacy, for example, which require prescription. We can buy these products without prescription. Some people use complementary and alternative medicine with the aims to improve their emotional well-being, to improve their health, to maintain health, to prevent illness or treat diseases. And recently, there are a lot of influences from the media promoting the use of traditional medicine or complementary and alternative medicine. And this may influence people to use these products as well. Other than that, influence from other people. If a family member is using a product, they may influence or recommend these products to their other family members. So this is another influencing factors. And for some patients, they would like to use these products to complement their conventional therapy. So the use of complementary alternative medicine is prevalent not only in Malaysia and not only in Indonesia. It is prevalent all over the world. So the slide here shows the prevalence of use of at least one form of complementary and alternative medicine. You can see that there are differences in the prevalence of use of complementary and alternative medicine according to countries. But you can see that a considerable amount of population are using these products. And the use of the products can be as high as 75%. And this was reported in a study in South Korea. So sharing some examples from Malaysia. There are many studies conducted to see the prevalence of use of complementary and alternative medicines among the public and patients in Malaysia, and I am only showing some of the studies. So in one study, it was found that almost 45% use vitamins and 25% of the respondents use herbal medicines to manage various types of diseases. And these include diabetes mellitus, peripheral neuropathy, and dyslipidemia, and also to maintain health. In another study, it was found that many patients, about 63% of cancer patients, 53% of hypercholesterolemia patients, and 50% of hypertensive patients, and also almost 50% of diabetic patients are using complementary and alternative medicine. So this data showed that the use of complementary and alternative medicines are widely prevalent among our communities and also patients. So we need to be aware that these products are widely used. And this data also showed that there is a demand for complementary and alternative medicine. So in terms of cardiovascular diseases, I'm sure that everybody aware that cardiovascular diseases is the leading cause of death worldwide. You can see the bar chart showing that cardiovascular disease cause many deaths in high-income countries, in middle-income countries, and in low-income countries. So it is prevalent in the world. and cause death worldwide. So this slide shows some of the risk factors for cardiovascular diseases. If you can see, the first three is hypertension, diabetes, and cholesterol. And of course, there are many other risk factors that can cause cardiovascular disease. Some other risk factors include smoking, stroke, aging, and diseases such as heart failure, and this cause heart failure, stroke, peripheral vascular diseases, hypertension, myocardial infarctions, and cardiomyopathies. And these risk factors would result in either in endothelial dysfunction or VCMC alterations. So if we have herbal products that can reduce the risk factors of patients, or can counter the effect of these risk factors, either on the endothelial dysfunctions or VSMC alterations, these products may be beneficial for our patients. So some questions to ask for the audience today. We have many products, we have many compounds that have been promoted or sold as products that can be beneficial for cardiovascular diseases. But we need to ask these questions: are they really effective, and are they safe? And we need to always keep in mind that we always need to put our patients first, and do no harm, and put our patient safety first. So to date, there are many compounds that have been studied for cardiovascular diseases, and these are some of the examples. We have ginkgo biloba, grapeseed extract, magnesium, vitamin D, vitamin E, berberine, boron, citrulline, cocoa extract, fish oil, garlic, and I think garlic is quite common in our countries, green tea extract, krill oil, L-carnitine, and acetylcysteine, and Panax ginseng. And these products may have a different level of evidence for effectiveness. For example, in terms of garlic, there are actually a lot of studies that have been undertaken to see the effects of garlic in reducing the blood pressure of a patient. So those studies suggest that the intake of a garlic supplement may have the positive effect on blood pressure levels, especially in individuals with hypertension, resulting in a significant reduction of around 10 systolic points, or 8 to 10%. However, the decrease in blood pressure is smaller in individuals with normal blood pressure. So it showed that there is a potential for use of garlic in hypertensive patients. And I also list some of the studies, and these studies are human trial. They are not studies that are conducted on animals. These are studies that are conducted in human to investigate the effect of the product supplementation on blood pressure. And some other examples are olive oil extract. In one study, the researchers compare the effectiveness of captopril. So captopril is a medication in the class of ACE inhibitor, used to treat hypertension. And the researchers compare the effectiveness of captopril and olive leaf extract in hypertensive individuals. So what they found was olive leaf extract effectively lower blood pressure. Similar to garlic, it does not seem to have the same effect on individuals with normal blood pressure. And for this, if you notice, there are many studies conducted on garlic, but the studies for olive leaf extract is still limited. And Pegaga or Centella asiatica also can also have potential effects on for patients with hypertension. So there is also one study look at the effects of Centella asiatica among hypertensive patients, and what they found was the signs and symptoms associated with chronic venous insufficiency, including poor circulation, venous reactivity, and edema and leg pain have been consistently elevated through the oral consumption of Centella asiatica. So findings like this showed that there is a potential use of these plants for our patients. And we need to be aware as well that some studies may show potential benefits, as with turmeric curcumin. So for turmeric, the studies showed that this product may decrease blood pressure, but there is not enough evidence to confirm if this product really decrease blood pressure in individuals with hypertension. So for this case, we need more studies to actually confirm the effectiveness of this ingredient to lower blood pressure among hypertensive patients. However, for turmeric, there are many studies that look at the effects of the extract on patients with type 2 diabetes. And remember that type 2 diabetes is also a risk factor for cardiovascular disease. So it can be beneficial for patients with type 2 diabetes, and it can have positive benefits among those patients, and possibly can reduce their risk factors in developing cardiovascular disease. And do you recognize this plant? It is holy basil. There is also a study that showed that this plant may reduce blood glucose. But we need more good quality study to confirm its effectiveness to reduce blood pressure among hypertensive patients. So the data that I have showed you, there are a lot more data on the use on the effectiveness of plants to reduce blood pressure among hypertensive patients. And the data are increasing years to years as more data are conducted to see the effectiveness of these products on certain diseases. Okay, but we need to remember that available data is still limited for us to confirm the effectiveness of certain plant on certain diseases. So we need to conduct more research into the quality, safety, molecular effects, and their clinical efficacy of these products to establish their effectiveness conclusively. And this is important because, like I mentioned earlier, a lot of people are using these products. So which means that there are a huge demand for these products among the public and patients. So we need to have a robust scientific foundation to guide the use of these products. And this data will not only benefit the healthcare professionals, it also would benefit the patients as we can provide them with reliable information so that they can decide whether they can use, whether they should or should not use these products. For traditional medicine, like I mentioned, there are still limited studies that have been conducted to look at the effectiveness of those products. So we need to, like I said, we need to conduct more studies to look at the effectiveness of these products. And I found this interesting study that look at the effect of herbal formula consisting of Curcuma xanthorrhiza, Curcuma longa, and Phyllanthus niruri on quality of life. And it is a randomized control trial in Indonesia. So this is the type of studies that we need to aim for, so that we can have more data on the effectiveness of these products on patients. So we talk about the potential benefits of herbal medicine among patients. We are aware of the benefits that they have on humans' health and for managing many kind of diseases. But we need to be aware, and we need to realize that these products, herbal medicines, also carry some issues. This is because those herbal medicine also contain chemical moieties, which can exert pharmacological activities. So they are natural products, but they contain certain chemical compounds that can produce pharmacological effects. So when we have pharmacological effects, it can produce adverse effects, it can interact with medications. So these are the two negative issues regarding the use of herbal medicines. It can produce adverse effects, it can interact with medications, but only when they are not being used appropriately. So if they use too much, they use the wrong dose, they would get adverse effect. If they use it incorrectly, for example, if they combine with certain medications, they would have herbal and drug interactions. So this can be avoided if herbal medicines are being used appropriately or rationally. Other than that, some other issues that I have listed here is impaired adherence. So this is when a patient is using certain medications and they were introduced with a herbal medicine, for example, and they chose to use the herbal medicine and forgo or skip the doctor's prescription. So this is their adherence to the conventional medications has been impaired. So we don't want this to happen as well. So we want them to continue taking their doctor's prescription, their conventional medications, so that their disease is in control. And in some patients, they may not want to use conventional medicine because they want to use traditional medicine first. And I understand in certain situations, this may be appropriate, but in certain situation, for example, in a life-threatening situation, it is recommended for the patients or individuals to go for a more evidence-based treatment. For example, heart attack, for example, cancer. So they need to get medical attention instead of using herbs or dietary supplements. So I would like to share a study that look at the emergency department visits for adverse events related to dietary supplements. So this I present this study just to show that even herbal medicine could bring someone to the emergency department due to their adverse effects. And the data from this study showed that about 30% of emergency department visit are due to the adverse effects of herbal medicine and dietary supplement adverse reactions. So so it is not we cannot say that herbal medicine is 100% safe. It can also cause adverse reactions if they are not being used properly. And this pie chart showed that 66% of all emergency department visit were due to herbal medicine. So among all unconventional type of therapies that the patients use, 60% were caused by herbal medicine. And visits were due to cardiovascular symptoms or mild to moderate allergic reactions. And the authors even reported that this percentage might be underestimated. So there could be more cases of patients who experience adverse reactions from herbal medicine. And if you look at this table, there are a lot of herbal products out there that can cause liver injury. Some of these, in my country, some of these herbal products are very common. So for example, green tea extract is very popular in my country. Noni is also very common as well in my country. And black cohosh, a product that is normally incorporated in women's health drink, is also very common in my country. And all of these herbal products has been associated with liver injury. And it has been reported as well that some herbal medicines have caused severe adverse effects, including death. So we can see here that some products such as Oxy Elite Pro, which is used as a sports dietary supplements, have been associated with liver failure. Certain Chinese herbal medicines have been reported to cause chronic kidney disease. And other than that, other than adverse effects, many herbal products may also interact with conventional medications. So these are some examples. You can see I point out some common herbal products in the market. For example, black cohosh, ginseng. These products, for example, black cohosh can reduce the effectiveness of statin. So statin is a drug used to treat hypercholesterolemia. and it can reduce the effectiveness of statin. So this is not good for the patient, as high level of cholesterol is a risk factors for cardiovascular disease. And for patients who are using blood thinning medications such as warfarin, herbal medicines such as ginseng could actually reduce the international normalized ratio. And ginseng can also reduce blood glucose level, causing the patients to more at risk of developing hypoglycemia. And some herbal, for example, St. John's wort, this herbal medicine has many interactions with many drugs. So it can reduce the effectiveness of cyclosporin, tacrolimus, warfarin, protease inhibitor, irinotecan, and a lot of other drugs as well. So these drugs, we need to be aware of these drugs, this herbal medicine, if it is being used by our patients. So some of the, just highlighting some interactions involving common herbs and even garlic. Garlic can also potentially interact with drugs that prevent blood clots, drugs used to treat HIV infection. It can interact with drugs that decrease blood sugar level. It can increase the blood pressure lowering effects of drugs and interact with tacrolimus. So there are a lot of interactions involving even common herbal products. And turmeric, which is another common herbal medicine, has been shown to interact with many medications as well, including blood thinning medications, drugs that reduce the stomach acid, and also drugs for diabetes. So we cannot assume that our natural products are entirely safe. We need to be aware that these products can also cause adverse effects. And these are some resources that I have highlighted here, that I have included here, that can help us to know more about drug and herbal medicine interaction. I know it is impossible for us to remember all interactions among herbal medicine and drugs. So these resources are very helpful. Even for me, I need to go to these resources and look up for the interactions if I would like to check if there is any interactions between herbal medicine and drugs among patients. And we need to also remember that the use of complementary and alternative medicine is also prevalent among specific population, such as the old people, pregnant women, and breastfeeding mothers. So we know that, for example, older people, they have different physiological functions. The level of effectiveness of their physiological functions are different than their younger counterparts. So their organs are not working as efficiently as the younger people. So there is also a concern of using certain products among older people, especially in higher doses. So I would like to share one of our research that we have conducted.
Excuse me, Mr.
Yeah.
I'm sorry, but you have 5 minutes left for your presentation.
Okay, sure. So in this study, we look at the prevalence, the types, the pattern of use, the reasons of use, the source of obtainment, how much they are spending for complementary and alternative medicine, and if they are reporting the use of complementary and alternative medicine to their providers. So what happened in this research was we approached about 400 older people and 336 responded in the survey. So, so this the data that we found showed that the reason why they use herbal and dietary supplements was because it is easy to obtain, it is affordable, and they were recommended by their family and friends to use the products. And these are some of the commonly herbal and dietary supplements used by the respondents. We can see that the majority use vitamin C, honey was prevalent use as well, fish oil, and even jamu. And we can see from here, from the data, that many hypertensive patients are using herbal and dietary supplements, and some patients with diabetes mellitus and hypercholesterolemia are also using dietary supplements and herbal medicine. And what was interesting was a considerable amount of the respondents were also using conventional medicine when they are also using herbal medicine. So remember, we're concerned about drug and herbal medicine interactions. And these are some of the purposes why they were using herbal medicine: to maintain health, to prevent diseases, to treat minor illnesses, and to treat chronic illnesses. So in this study, what interesting was, we asked them why they are using the products. And you can see here, this is their response. The vitamin C was used for migraine, for constipation, for hypertension. And if you realize that there is no evidence for them, there is no evidence for vitamin C to treat conditions such as constipation, migraine, and hypertension. So this showed that they actually have the wrong idea about herbal and dietary supplements. So when we asked them, where do they get information about herbal medicine? And most of them answered they got it from their friends and families and also the internet. On top of that, they do not talk to the doctors or healthcare professionals about the use of herbal medicine. So what I'm trying to deliver to you is that first, herbal medicine use is very common among our communities, and they are using these products together with conventional medications, and these put a concern about drug and herbal medicine. It show raised concern about drug and herbal medicine interaction. And like I mentioned, they have a misconception about herbal medicine. So some of the herbal medicine that they mentioned they were using has no effect or no evidence for the disease or conditions that they want to treat. So this means that we need to provide them with more education about herbal medicine. And this is our enemies, social media, and also online shopping platform. They have been promoting a lot of products with misleading claims and false claim, encouraging people to use herbal medicine inappropriately. So traditional medicine, my final words, traditional medicine and herbal medicine is widely used among the public and patients. We are aware that there are evidences of effectiveness of this product, but we need to ensure that the products are being used safely. And we regardless of who you are, whether you are a pharmacist, whether you are a doctor, whether you are healthcare professionals, dietitians, physiotherapists, we all have important roles in ensuring safe use of traditional medicine and herbal medicine. And remember, for us, it is important to conduct more studies, conduct more research, so that we can have more robust evidence about herbal medicines, robust evidence of the effectiveness of herbal medicines for use of our patients. So that is all from me. Thank you very much for your attention. And I pass over to the moderator.
Thank you, Mr. Muhammad Taiswan. And now we are coming to discussion session. So if there are any question from the audience or participant who join offline, you can raise your hand and ask directly the question. And for participants who joins online, you can type your question in the chat box so that I can read the questions for you. Is there any question for the participant who joins offline? Okay, I will read the question, Mr. Muhammad Saiswan from Zoom meeting chat. Mrs. Pramita Yuli asks, Dr. Saiswan, I'm Pramita. I want to ask, how can we avoid side effects from traditional medicine? Does the method of preparation also affect the side effects of traditional medicine, such as heating it? Mr. Muhammad Saiswan, please answer the question.
Yeah, I think for this question is quite tricky to answer because we do not know exactly which type of traditional medicine that you are referring to. But in general, I think the dose of the traditional medicine need to be appropriate. So if a patients are taking too much of a product, the risk to develop adverse effects is could increase. If they are using multiple traditional medicines, for example, they are using a few herbs at the same time, probably, and if they are using several traditional medicines of the same effect, for example, herbal 1 could decrease blood glucose level, herbal 2 also can decrease blood glucose level, and herbal 3 could also decrease blood glucose level. So taking them all together would also increase the risk of adverse effects in patients.
Okay, thank you so much, Mr. Muhammad Saiswan, for the answer. Is there any question again for participant who joins offline, or maybe participants who join online via Zoom or YouTube? Okay, I think there's no more question for this session. Thank you so much, Mr. Muhammad Saiswan, and I would like to conclude the presentation that you have presented. People are using complementary and alternative medicine for some reason, such as easy access or no prescription, and it also affected by the trends influenced by media or environment. And then some herbal compounds has been studied for having effect for cardiovascular disease, such as omega-3, fatty acids, and vitamins. Also, herbal supplement such as garlic, olive oil, and centella has been studied for hypertension and curcumin also in turmeric, basil leaves for decreasing the glucose level in blood. And also the most thing that is important is taking herbal medicine also should be rational in order to achieve the goal of being healthy. Okay, thank you so much, Mr. Muhammad Saiswan, for sharing knowledge to us so that we can broaden our perspective and giving us insight about traditional medicine. And dear organizer, you can show, this is a certificate for Mr. Muhammad Saiswan Abdul Wahab with PARM MClean PARM PhD RPH. And later the organizer will send the soft file of the certificates directly to you. Thank you, Muhammad Saiswan. Thank you.
Thank you very much. Thank you. Thank you.
Give a round of applause for Mr. Muhammad Saiswan. And now we're moving to the second speaker. We have Dr. Kalpana Paudel Aryal. Hello, Dr. Kalpana.
Hello, namaste.
Namaste. How are you today?
I'm fine. I'm happy for today.
Oh, that's great. Thank you for coming here in the 4th International Conference on Traditional Medicine. First, I will write your profile. Okay, Dr. Kalpana Paudel Aryal is PhD in Nursing Science, Language Nepali, English, and Hindi. The office is in Tribhuvan University Institute of Medicine, Birgunj Nursing Campus, Nepal. Dr. Kalpana is a Doctorate of Philosophy in Nursing Science, PhD in 2020, and also Master of Nursing in Adult Health in 2008. For the organization, Dr. Kalpana also active as a campus chief since 20 and 23 May until now in Birgunj Nursing Campus Institute of Medicine, Tribhuvan University, and be associate professor since 20 and 21 Pokhara Nursing Campuses Institute of Medicine, Tribhuvan University. All right, Dr. Kalpana, you have 45 minutes, including 35 minutes for presentation and 10 minutes for question and answer session. Dr. Kalpana, time is yours.
Thank you. Thank you so much. I'm so happy today, and I'm very thankful for the inviting me to present my here about the yoga for cardiovascular disease. Now I would like to share my slide. Okay. First of all, I would like to say namaste from Nepal. I think I'm very happy today, and I'm very thankful to invite me to present my paper in here. And my title of the presentation of today is Yoga as a Powerful Intervention for the Prevention of Cardiovascular Disease. This is Kalpana Paudel. I have done my PhD from Prince of Songkhla University, Thailand, and I'm working as a campus chief of Birgunj Nursing Campus, Tribhuvan University, Nepal. I just would like to introduce about the Nepal. Nepal is located in between the India and China, it's a big country, and Nepal is a very small country, and the total area 56,826.90 square miles, and the total population of Nepal is 30 million in average. I think it is quite a province of the Indonesia. And this is also the Nepal, the old map. This is where we are from the Indonesia and Nepal. We are quite near from India to Indonesia. Just move to my content of the presentations. Today's my presentation is cardiovascular disease, the situation, most common types, most common risk factors, and evidence related to CBD and yoga. An introduction, types of yoga, practice sessions. I will do some practice sessions and conclusion and discussions. Sorry, have you hear me? Is okay for the moderator?
Yes, clearly.
It's okay. Okay.
Yeah.
If any problems, please you can tell me anytime.
Okay.
Okay. I'm just highlight the situation of cardiovascular diseases because already the three speaker already talk more about the situation of cardiovascular disease in the context of the global and in the Southeast Asia and the national context. So the situation, the cardiovascular, we all know about that. The cardiovascular disease are the leading cause of death globally. And an estimated that 17.9 million people die from the CBD in 19 and until now, and representing 32% of the global death. Of this death, 85% were due to the heart attack and stroke. That means the heart attack and stroke are the major cause of main disease among forgetting the death among CBDs. Over 3/4 of CBD death takes place in low and middle income countries like us. Nepal, I think Indonesia also, we live in the low and middle income countries. Most common, we all know about the most common CBD, atherosclerosis, hypertension, heart attack, and strokes. I already talked about the more than 4 out of 5 CBD deaths are due to the heart attack and stroke. So my focus is more heart attack and stroke. And I have done my PhD in stroke. That is, I integrate the yoga for stroke management in the acute stage during hospitalization. These are the non-communicable disease and most common risk factors of CBD, which are non-modifiable and modifiable. That already Dr. Muhammad already talked more about on it. I'm also highlight, which was not often said, that psychological stress is one of the most common risk factors are getting as cardiovascular diseases, but this is often overlooked. So this study says that psychological stress is one of the most common cause which can be prevented and managed in time for reduction and prevention of cardiovascular disease. That means we have to take care of stress, psychological stress or distress in time for managing the cardiovascular disease. What is the situation of global situation for progress of prevention of cardiovascular disease? Some of the articles said that the global progress in prevention and cardiovascular disease, although there is measurable global progress in prevention of cardiovascular disease, particularly in developed countries, it has been highly uneven and inadequate, particularly in low and middle income countries. Actually, there are a lot of strategies and measurable changes, measurable progress in global context focus, which most of them focus in developed countries, and that we cannot apply in the context of low and middle income countries because of the many lack of resources, many factors such as a lack of resources, a lack of fund, lack of skilled manpower, and many more. So we belongs to low and middle income countries, and we are also suffering from uneven, inadequate prevention activities, intervention in cardiovascular diseases. So there is huge demand for sustainable and framework model intervention to prevent and reduce the cardiovascular diseases. For addressing the global burden of cardiovascular disease, one of the study mentioned that we need a scalable and sustainable framework for managing and reduction of the risk factors of cardiovascular diseases, because cardiovascular disease, most of the cardiovascular diseases, risk factors of the cardiovascular disease can be prevented. These are the protectings. How can we protect the cardiovascular disease? We all know about the risk factors. So if we minimize the risk factors, we can prevent easily for the cardiovascular diseases. We know the physical activities, blood pressure, control cholesterol, effective means of controlling stress or distress. I'm moving to the yoga as a powerful intervention for cardiovascular prevention and management or risk reduction. Yoga, I think already Dr. Abhishek already mentioned a little bit about the yoga for cardiovascular health. So I'm also focusing on that. I focus only the yoga, particularly for the yoga. Yoga as spiritual and cultural practice, which is more powerful tool for prevention and management of cardiovascular disease. It could be considered an all-round exercise, or that will take care of the body, not only the body, it also take care of the mind and soul, physical, psychological, social, and spiritual health. So if we use the yoga, we can get the well-being in and get the definition of WHO. We know that the health is a complete physical, mental, social, and spiritual well-being. So we can also achieve the goal of the WHO about the health if we do the regular practice of yoga. So evidence also showed that the practicing it has been shown to be a beneficial for all age group. It can be practiced not only the one specific group, it can be practiced all group of the people since the childhood, since the children's, can adult and elderly, even in special condition patient like chronic disease conditions, like ill patient, in acute stage patient, in chronic stage for the rehabilitations, and even pregnancy, during pregnancy also we can practice it safely. So yoga has many more benefits, because we also mentioned it is a mind-body therapy, and it has a more than we expect the benefits we expect if we do it regular practice. Some evidence related to yoga intervention said that yoga, when I searched the literature about the benefits or use of yoga intervention for cardiovascular prevention, I found a more, so I just keep here some examples, because this presentation is only focused on review literature, but I have done my PhD thesis that integrate yoga for the stroke patient. So yoga, we can integrate the yoga for cardiovascular health. So yoga can be a promising technique to control the cardiovascular disease. It is already published in Elsevier by Manchanda. So I think if we use yoga as an integrative way, as an integration with other therapies or integration with medicine, herbs, herbal therapy, so we can get the more benefits. Our promising technique. So we can say yoga is a promising technique to control the cardiovascular disease. And another article also mentioned that yoga as a preventive intervention for cardiovascular disease and associated comorbidities. It is also one study that mentioned yoga also are very useful for the prevention and control of the cardiovascular diseases. Some of the literature also recommended that the future suffering can be avoided. Yoga as a strategy, if we get the yoga as a strategy in the primary prevention of cardiovascular diseases. So I think if we really use the yoga for the management and prevention of cardiovascular diseases, we definitely reduce the future suffering of cardiovascular diseases. That means which are very emerging very faster these days. So another systematic reviews of intervention was published in Cochrane Library as intervention review. This article also mentioned that yoga for the prevention, primary prevention of cardiovascular disease. That means we have a level of prevention, primary, primordial prevention, primary prevention, secondary prevention, and tertiary prevention. We can use yoga in all level of prevention. That is this also mentioned the primary prevention. We can use the yoga for disease prevention before occurring of the disease. We can, if you practice the yoga, we can get the more benefit and prevent from the vascular diseases. This is the last one for the article, yoga, a novel intervention for prevention of cardiovascular diseases. A novel, we can also say that how can we use this? It can be used a powerful tool of novel modalities for the cardiovascular disease for the prevention. In fact, yoga is not a new methods. It is a very, very old, very ancient cultural practice, which is derived from the Hindu cultures in India and Nepal, especially in Nepal. The main emerging place of the yoga is Nepal. But now this is very popular globally. So it is cultural practice, but it is novel modalities for the cardiovascular diseases. So we can use it for best methods for prevention of the cardiovascular diseases. So let's move about the yoga. What is it and how can it prevent the CVD? We'll talk about the cardiovascular disease situations and cardiovascular disease. If we integrate the yoga, if you practice the yoga, we can prevent the cardiovascular diseases. And there are many studies mentioned about the cardiovascular disease can be prevented, or yoga work as a novel or best or powerful therapy for the management and control prevention of cardiovascular disease. So that we must know what is it and how can it prevent, how can we use it in our daily life. That is the matter we must know. So I just explained it a little bit. Yoga, this is a Sanskrit use, that means union of mind and body. This is yoga, chitta, vitta, nirodha. That means yoga is neutralization of vortex of feelings. It controls our feelings. It just make our mind peace and connect the mind with body. And it is very popular traditional practice since 5,000 years as a means of spiritual discipline. It is way of life of Hindus, and in India and Nepal, it is day-to-day life. And now it become a very popular complementary care globally, and WHO promised that. The Dr. Abhishek and the other speaker already talk about that. WHO into the CAM already included in prevention and management of the cardiovascular disease. Yoga is one of the most important. We must integrate it. And UN has also declared the International Yoga Day. It is powerful practice to prevent, reduce, manage CVD globally. So I just focus on some component of Yoga Sutras that Patanjali mentioned about the Yoga Sutra. There is 8 limb path. The yoga some attitude training practice, some physical training practice, some basic mind training practice, and some advanced mind training practice. There are 8 limb paths. First the yama and niyama. These are the fundamental practice that make our attitude in good conditions, that make us in help to maintain our basic fundamental needs. And physical training is another important. We all know about the asana. Asana is physical exercise which we do in yoga. So it is very important for physical health as well as the mental health. And another is basic mind training, pranayama, and pratyahara, dhyana, and dharana and dhyana. Dhyana means meditations, that advanced mind training. And the last we can get the samadhi. That means it is very hard to get it because it is only some of the people get the samadhi states, but we can do the most common among them, 8 limbs. Most common we do it. Asana, dharana, that means dhyana, that means meditation, and breathing exercise. So we do 3 types, commonly 3 types of yoga among 8 components. So this is the figures that explore how these yoga 8 limb path is it. So yama and niyama, pranayama, and that yoga is a conscious process for the accelerating this growth and pure. And we can, if we get the samadhi, the highest level, that pure consciousness, freedom from moksha, that means the reality of life. The possible mechanism of action of yoga, how this work in for the prevention, the yama, the rules of interpersonal relationship or universal morals. Yama means, niyama means the self-discipline that make us asana, improve the strength, flexibility, and balance. This is the physical exercise. And this also help to reconditioning psychophysiological mechanism of the body, and who thereby establishing the harmonious function of the body and mind as one integrated whole. And pranayama is voluntary control of the breathing and control over the respiratory impulses, autonomic nerve impulses, which bring about emotional stability and peace of the mind. Dhyana, it brings the mindfulness, deep relaxation, inner strength, hope, joy, peace of mind. Connect to the mind, body, and soul. Self-awareness and self-control, self-consciousness. And this I already mentioned about the concept, but some most common concept that can we use in our day-to-day practice. Yoga namaste, we always say that yoga namaste, and yoga asana, yoga pranayama, yoga meditation, and corpse pose is commonly used position, but we can use more than this because already Dr. Abhishek already mentioned some of the component of yoga in their presentation, in his presentation. Nowadays, yoga is very popular globally especially since COVID-19, because pandemic. It helps because, this picture tell me is because instead of shaking hand, we use the namaste yoga for greetings. This is the way that make us happy, and this is so also decrease the spread of infection. We all know about it, even though we got the pandemics that also directly impact in our health and lead to the chronic disease and cardiovascular diseases. That stress is one of the most common impact of the pandemic. So if we use the yoga, so we can decrease the stress and can prevent the cardiovascular diseases. And use of greeting instead of hugging and shaking hands, it may also connection of self, others, and to the God. And it creates positive feelings through the maintaining the good interpersonal relationship, respect, kindness, purity of soul, as well as the spiritual connection. So people feel calm and body and peace in mind. So asana means, I already talked about, this is a physical exercise. It is very important to each and every people in their day-to-day life. It has to promote flexibility, strength and balance, lead to maintain the physical body, enhance the quality of mind through feeling peace, calm and continue spiritual connection, allow the person to create the path to connect the mind and body and proceed toward the higher level of wisdom. Asana also increase the mobility and exercise of the body, improve general muscle tone for the stabilizing the body and mind. And it helps us to decrease and maintain body weight and active parasympathetic activities and regulate the hypothalamic pituitary adrenal axis and promote the calmness and relaxation, create the path toward spiritual connection. And these some are the example of exercise we can do. Asana, yoga asana as a physical exercise. We can do, any people can do, even children can do, we older can do, female can do, male can do. We can do it in any time, anywhere. If you want, we don't need a long space for doing it. We don't need the advanced and decorative for the practicing it. So we can do it in a simple room, in outside, in indoor and outdoor. And we just need one yoga mat. It's very cheap. Only we can get a very cheap and simple. So this is the Surya Namaskar, one of the complete yoga asana. If we do it regularly, at least 15 to 20 times, we can get we don't need to do the another exercise. So I just want to suggest all of you, do the yoga namaskar, Surya Namaskar for at least 21 days and you can feel the changes inside you and outside you. I'm also doing it and I also suggest for all of you. And we also can reduce the cardiovascular diseases and you feel comfort and flexibility, feel peace and very lightness in your body. And these are the Surya Namaskar. Some of the people cannot do it. For example, pregnant women cannot do the full Surya Namaskar, so they can do the half sun salutation. And baby and mother and can do the yoga together. And some of the school children in our context, the school yoga is compulsory. The school children compulsory is mandatory to practice it. Every school should provide the yoga practice to the children in their school. This is the national rule, national policy of Nepal. And some of the international, I see that I read some of the countries in the developed country also use the yogas as a regular daily exercise of the student in the school. And same like a breathing exercise, it is one of the breathing exercise, pranayama, an essential part of the yoga. It is the powerful tool for healing the mind, body, and spirit together because of its holistic properties. However, it is quite difficult to practice in the beginning due to the less experience. There are a number of pranayams such as alternative nostril breathing, Surya Darshan Pranayam, Bhastrika Pranayam, and Kapalabhati, and so many more. And we can do that like this. It supplies the maximum oxygen to the whole body, exercise the lungs, stomach, and surrounding organs, and it helps to increase the circulations, and it helps to create the kind of balance in both hemispheres of the brain. And because if we do the alternative nostril breathing, it connects directly to the brain and two hemisphere is active and balanced. So relax, it also helps to relax the body and calm the mind and activate parasympathetic activity, promote the relaxation and increase the concentration of the mind. And some of the students, some of the girls also can do it in their daily practice. And in our context, meditation most of the government office now, the government office make the rule when they enter in the office first 10 minutes, 10 to 15 minutes, they have to spend their time for the meditation before starting their work, day-to-day work in the office. So every office should have facility to provide such type of exercise or yoga in their office premises. So this is also in Nepal, we are also doing that way, but not all office, not only some organizations and only some government organization, government offices use meditation for their workplace. Meditation, we can do the meditation and silent meditation and chanting meditations for the spiritual strengthening. Meditation is one of the third most common component and popular component of the yoga. It is considered under the Yoga Sutra and is used for the dhyana as meditation, or it can practice separately as a spiritual prayer by chanting other various mantras, mantra Om chanting and Om Namah Shivaya and many more. We have many more mantras and holy words that we chant together for doing the meditation, or we can do the meditation alone without any chanting. So according to the Hindu philosophy, chanting Om is the sound of power, faith, and symbol of the God. While practicing, it allows a person to feel the vibration and sensation and awareness throughout the body, and it helps to organize though the mental consciousness, increase the sensitivity to sensory transmission and purify the speech, protect the mind, and by maintaining the constant spiritual connection and allow the mind to connect. And Om chanting also produce a deep relaxations of the mind through sympathetic activities and decrease the vagal modulations, and it also release the emotion, converts of psychophysiological energy, promote the relaxation and inner peace. It highlights the level of consciousness and prolong concentration, also increase the concentration, enhance the immunity and inner strength, and helps to connect self and higher consciousness and the God. And this is the Shavasana.
Excuse me, Dr. Kalpana, you have 5 minutes left for the presentation.
Okay, sure.
5 minutes left from
okay, sure. Thank you. Okay, thank you so much. And it is relaxation, reduce the fatigue, pain, and boost inner strength through the calming body, relaxing the body, and enhance the quality of mind and through feeling peace and calm, along with the conscious continuous spiritual connection. Ultimately, it allows a person to create a path to connect the mind, body, and proceed toward the higher level of wisdom. This is the mechanism of yoga. You can read and you can ask me if you have any questions about this. I already talked more about the mechanism of yoga. This is the flow chart we can do. At last, this is the yoga practice first, yoga practice, yoga effect, and yoga outcomes. These, if we do it regularly, we can get the physical health more good, holistic health functions, and connection of body, mind, and soul. So if we have such type of well-being health, definitely will decrease the cardiovascular disease and prevent it. Key message from the presentation. The ischemic heart disease and stroke are the biggest contributors to premature mortality worldwide. There is need to action of affordable intervention to attain the global NCD target and SDG goal by 2020, particularly in low and middle income countries like Nepal and Indonesia, like us. And study shows that yoga, a powerful and noble in Eastern cultural practice, is very effective for maintenance of good health as well as prevention of the diseases and management of the diseases. It is more cost effective and easy to practice and less side effect, and can practice in any age group, in anywhere, anytime. So however, there is still huge need for research to better understand the effect of yoga on the primary prevention of cardiovascular diseases. Thank you so much. Thank you. Thank you so much for listening to me and your patience. If any questions, you can ask me. These are my reference. Thank you.
All right, thank you so much, Dr. Kalpana. Now we are coming to the discussion session. I will read some questions from Zoom. To Dr. Kalpana, can it be combined between traditional herbal medicine with yoga to treat cardiovascular problems, especially those that have been implemented in Nepal? Thank you.
Yes, thank you so much. Thank you so much. Actually, we have Ayurveda in Nepal. You know, it's the yoga and Ayurveda. The origin of yoga and Ayurveda is in Nepal, and later on it goes to the India and all over the world. So we can do it, because yoga is like an exercise. It's mind-body therapy. It is our day-to-day life activities. And we do it start from the beginning. It is better to do in the early morning. It is far better, but you can practice it anytime. But we cannot practice it with full stomach. At least after meal, 2 hours after meal, we can practice it. As we can integrate it with others. Just if you are taking the medicine for the blood pressure or others, or any medicine, you can practice. There is no any barriers to do it. We can do with other. We can combine together, because it is just practice. We cannot eat it. It is just practice. Thank you. Thank you for question.
All right, thank you, Dr. Kalpana. And next, I will read a question coming from YouTube. Hello, my name is Dianovita. I practice daily yoga every day. And my question is, what is the minimum duration to do the daily yoga to achieve CVD prevention effect? Thank you.
Thank you so much. Yoga, you know, it is low intensity exercise. It is not a jerky exercise, not a very high intensity exercise. That already the previous speaker talked more about it, because it is better if we do the low intensity exercise. It definitely have to decrease the cardiac. It is lower the cortisol level of the body and directly help to prevention of the diseases. So at least we can do the 30 minutes for the exercise, for the practice. We have to do 10 minutes, at least 10 to 15 minutes for the breathing exercise, alternating nostril breathing, or you can do the Brastika, or you can do the other breathing exercise. You must do at least 10 to 15 minutes for the meditation. I suggest you, if you really want to decrease the cardiovascular or any problems, we must do at least 30 minutes yoga asana, 10 to 15 minutes breathing exercise, 10 to 15 minutes for the meditations. It's enough for, if you do regularly at least 15, 21 days, you can get benefit. You absorb you feel the benefits from the yoga at practice. Thank you. Thank you.
Thank you, Dr. Kalpana. And I think the time is already. I'm sorry. There's one more question from Zoom. I will read it for you. Is it safe to do the yoga without a trainer? And which one is more effective doing yoga for cardiovascular, whether as promotive, preventive, curative, or rehabilitative? Thank you.
Thank you. Thank you for questions. Actually, yoga is more benefits for all level of prevention. That means for the prevention, promotion, management, even management and prevention, even in rehabilitations. I think the question, can you read the question again?
The operator, I will read it for you again. Is it safe to do yoga without trainer? And which one is more effective doing yoga for cardiovascular, whether it's promotive, preventive, curative, or rehabilitative? Thank you.
Thank you. Yes, we know that. I'm the international yoga trainer, and I also have done my PhD in yoga for the cardiovascular, especially stroke. It can be practiced only with the trained practitioners, because sometimes if they are not practiced, how can they do it? So we can follow the guru, guru, the teacher. So if you get the most benefit, first of all, you should have gained the knowledge or skill from the trainer. And then if you gain the skill, you can do practice yourself. Since in the beginning, you must do the practice from the practitioners. And after later on, you can do practice by yourself. It's no problem. Thank you.
Dr. Kappa. So is it safe for us for
yes.
Doing yoga?
Safe. There is
doing yoga like we watch in the YouTube or something like that, and we practice it at home. Is it safe without a trainer?
Yeah, it is safe. If you do if you can follow the steps, it is okay. But if you have problems to follow the steps, sometimes the YouTube, sometimes may not be good. They are only for the commercial purpose or something like that. So you have to use the like formal or read down YouTube that is good for the organization. But many people right now, put the yoga exercise in the YouTube. Maybe sometimes that is not good for all. So you have to think what type of YouTube or trainer people as deliver the yoga practice in the YouTube. You must know about that first. But it is better if you do the physically inside in the beginning. It's better. But we can use the Zoom link virtual. If we have time, I can also do in the Zoom. I teach my student, and sometimes I do the practice through virtual link. It is also good online.
Okay, so still we have to be selective for choosing the right video on YouTube for yoga, right? Am I audible, Dr. Kalpala?
Yes.
Oh yeah. So there's one more question. I will read it for you via Zoom. Dr. Kalpana, may I ask question? Are there any contradiction to yoga for pregnant women? Thank you.
Yes. Pregnant women cannot do all type of yoga practice. They cannot do the bending forward and stretching, some more stretching, because we have to protect the womb, abdomen. So there are some specific yoga practice for the pregnant woman. We have a package program, yoga program for the pregnancy, during pregnancy. People can do it since the first trimester, but only selective. We cannot use all for the pregnancy. So I have a package for the pregnant woman, what type of yoga they can do. So, and I'm using it in my context. I'm doing research for this too in here.
Okay, so there's a specific yoga for pregnant women, right?
Yeah, yes.
Okay, thank you so much for the answer, Dr. Kalpana. Is there any more question on YouTube or the audience here, participant here offline? Okay, thank you so much, Dr. Kalpana Pauda Arya, for sharing knowledge to us so that we can broaden our understanding on yoga and giving us new insight. Thank you so much, Dr. Kalpana. And from the organizer, we will
And
send you.
namaste. Thank you and namaste. I just want to say one key message from my side. Please make your back straight. Always make your back straight. If you do your back straight, and you can prevent many more diseases. You know, only for the best position, maintaining the best sitting position, we can get benefit and prevent many more chronic diseases. And just suggest all of you. Thank you so much. Thank you so much.
Thank you so much. From the organizer, we will show you the certificate. Dr. Kalpana, here's the certificate for doctor, and the organizer will send you directly after this. Thank you. Thank you so much, Dr. Kalpana.
Thank you so much. Okay, bye-bye.
Okay. And finally, distinguished guests, ladies and gentlemen, we have reached the end of the second session of this conference. Thank you for our speakers and participants, for our speakers who have delivered the material and presentation. And thank you for all the participants who actively joined the session and completely joined the session. And I would like to apologize if there are some mistakes that I made while delivering the session. I'm Ardian Julianto, and I give the time back to the MC. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
The next agenda is the chairman of the committee is invited to hand over the certificate for the Honorable our moderator, Mr. Ardian Julianto, AMD.
For the participant, please give applause.
We would like to thank you for the Honorable Mr. Muhammad Saheswan Abdul Wahab, Dr. Kalpana Pudel Aryal, and our moderator, Mr. Ardian Julianto, AMD.
The next agenda is a break session. For participants in a room Zoom can leave at the room Zoom, and it will start again at 1 p.m. West Indonesian time, Greenwich Mean Time, +7. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Distinguished guests, ladies and gentlemen, the next session is panel session, will be delivered by Ms. Dr. Sri Wahyuni Midwifery, Department Health Polytechnic, Ministry of Health, Surakarta, Ms. Arum Dwi Agustina, SSI MSc, from Pharmaceutical and Food Analysis, Department Health Polytechnic, Ministry of Health, Surakarta, Ms. Murwanti SKM MKes, from Pharmacy Department, Health Polytechnic, Ministry of Health, Surakarta.
Ms. Apoteker Pramita Yuli Pratiwi, S-Pharm MSc, from Indonesia Traditional Herbal Department, Health Polytechnic, Ministry of Health, Surakarta. Also, Mr. Solihan Badri, SST AKP MPH, from Akupuntur Department, Health Polytechnic, Ministry of Health, Surakarta. The panel session will be moderated by Ms. Rahayu Tri Budianti, AMDKes. Before we start, we will read out the CV of our moderator. She is Ms. Rahayu Tri Budianti, AMDKes. Curriculum vitae. Name Rahayu Tri Budianti, AMDKes. NIP 91999704162020072001 with number 08783176581 and 2. Email rayu1697@gmail.com. Sosmed account ayu_ayui. Education SD Negeri 2 Bejen Karanganyar. Senior High School Negeri 8 Surakarta. Junior High School Negeri 8 Surakarta. And Senior High School Negeri Karangpandan. Poltekkes Kemenkes Surakarta. Experience Poltekkes Men's and Women Finalist in 2018. President of BPM Anafarma Polkesta 2018 until 2019. MC of Kupas Tuntas Sipenmaru 2021. Education Laboratory Technician of Anafarma Polkesta in 2020 until now. Ms. Rahayu Tri Budianti, AMDKes, time is yours.
Okay, good morning, everyone. Oh, I'm sorry, afternoon, everyone. Thank you for your attention to our international conference, Traditional Medicine. Honorable all participants of the International Conference, Traditional Medicine. Today, I'm Rahayu Tri Budianti. Call me Ayu, the moderator of this session, and last session. And now, we have 5 speakers who are already with us. We have Dr. Sri Wahyuni, Ms. Arum Dwi Agustina, Mrs. Murwati, Mrs. Paramita Yuli, and Mr. Salihan Badri will be joining us later on. Okay, our presentation till the next 2 hours, and you all the speaker will talk around 20 minutes. And after the 5 speaker have present their topic, the paper will have a discussion if we have the time. So we can go to first speakers. Okay, I'm going to invite Dr. Sri Wahyuni. Hello, Dr. Sri Wahyuni. Do you hear me?
Yes, I hear you. Oh, yeah, you.
Okay, thank you, Dr. Sri Wahyuni. I will read your profile first. Dr. Sri Wahyuni. Dr. Sri Wahyuni is a lecturer in midwifery department, Health Polytechnic Ministry of Health Surakarta. And she got a Master Midwifery and Catholic University Australia on 2003. And she is currently a lecturer now. Next. And more presently teaching in major of midwifery since 2003. Is the experience work in 1998, 1996 until 1998, beliau bekerja sebagai perawat di RSI Surakarta di tahun 1900. Oh, and now in 2023 kerja sebagai dosen di jurusan Kebidanan Poltekkes Kemenkes Surakarta. Okay, Dr. Sri Wahyuni, you have 20 minutes and to present your works and your paper. You're ready?
Yes, thank you, Bu Rahayu.
Okay, time is your please.
Yeah, thank you. Baik, Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone. I hope we are still focused in this international conference in this afternoon. Let me share. Can you see my share screen?
Yes.
Yes, thank you. And let me use two language, English, and I also use bahasa. Yang saya hormati Direktur Poltekkes Surakarta beserta Wakil Direktur 1, 2, 3, Ibu Kepala Pusat, dan yang berbahagia Ibu Ketua Jurusan Jamu, Ibu Indri beserta jajaran. Let me share about our paper. The title, Increasing the Role of Midwives in Early Detection of Critical Congenital Heart Disease through Newborn Screening. I hope my title in accordance with the topic, the International Conference, Integration of Traditional and Conventional Treatment for Cardiovascular System. I am Sri Wahyuni, the one of lecture in Midwifery Department of Surakarta Head Polytechnic. Okay. Yes. Tentang topik webinar siang hari ini adalah tentang penyakit jantung, dan bicara masalah penyakit jantung, kita tidak bisa terlepas dari congenital heart disease atau penyakit jantung bawaan. Dan penyakit jantung bawaan ini kita memang tidak bisa tiba-tiba muncul pada saat dewasa. Sehingga nanti fokus materi atau sharing saya ini terkait dengan screening pada bayi baru lahir, di mana kita akan mengawali dari beginning of life, jadi awal dari kehidupan, mulai dari kehamilan sampai nanti bayi baru lahir. Karena memang seiring dengan perkembangan teknologi, mungkin juga diiringi dengan perkembangan penyakit, sehingga siang ini saya akan melihat point of view-nya dari ilmu kebidanan. Dan outline-nya seputar congenital heart disease, jadi briefly, kemudian regulasi atau peraturan-peraturan yang terkait dengan screening bayi baru lahir, kemudian sedikit tentang peran bidan, dan nanti kita akan diskusikan tentang screening bayi baru lahir. Sebelum masuk ke screening bayi baru lahir, kita akan sekilas tentang apa itu congenital heart disease, ya, penyakit jantung bawaan. Ya. Jadi penyakit jantung bawaan itu atau PJB, kalau bahasa Inggrisnya GHD, congenital heart disease, itu didefinisikan sebagai abnormalitas struktur dari jantung atau pembuluh darah, di mana pembuluh darah yang terkena biasanya adalah pembuluh darah yang besar, intratorakal, yang dapat mempengaruhi fungsi kardiovaskuler secara signifikan dan secara umum. Dan GSD ini merupakan salah satu tipe dari kelainan pada saat bayi baru lahir. Dan ini tidak terjadi tidak hanya di Indonesia, tetapi di seluruh dunia. Jadi GSD ini merupakan kongenital, ya, kelainan kongenital yang umum terjadi di Indonesia. Angka kejadian sendiri, GSD, congenital heart disease ini 1% dari 100 kelahiran. Jadi seandainya ada 100 bayi baru lahir, 1%-nya itu ada congenital heart disease. Dan dari 1% tersebut, 25%-nya adalah kelainan jantung bawaan kritis, ya, PJB kritis atau critical congenital heart disease. Jadi mengingat angka kejadiannya itu cukup tinggi, sehingga berbagai upaya telah dilakukan untuk mencegah atau mendeteksi. Salah satunya adalah bidan. Nah, secara umum gejala klinis dari congenital heart disease, ya, ini dibedakan menjadi dua, ya. Jadi berdasarkan sirkulasi sistemik seluruh tubuh atau didasarkan pada sirkulasi pulmonar. Dan kalau dari sistemik, ya, itu ada sirkulasi kolaps, nah, seperti septic shock, kemudian ada gangguan perfusi, dan adanya denyut nadi femoral yang lemah. Kalau adanya gangguan pada sirkulasi pulmonar, yaitu kebiruan, sianosis, dan penurunan oksigen. Dan ini terjadi pada neonatus atau bayi baru lahir yang sebelumnya tampak sehat. Ya, jadi lahir bayi itu menangis, sehat, Apgar skor baik, tetapi pada jam-jam berikutnya 24 jam pertama, 72 jam pertama terjadi penurunan kondisi. Beda kondisi kalau memang bayi baru lahir itu lahirnya memang sudah mengalami aspeksi, lahirnya sudah mengalami kelainan. Itu itu memang sudah jelas terjadi kelainan bawaan. Tapi yang fokus kita bahas siang ini adalah yang bayi sebelumnya lahir kondisi sehat. Secara umum, clinical appearance yaitu adanya sindrom pada wajah, jadi memang wajahnya khas itu ya. Kemudian cyanosis, ini jelas, baik di seluruh wajah atau di bibir atau mungkin di ekstremitas. Kemudian ada udem pada jari, kemudian kalau neonatus atau bayi itu tampak malnutrisi, kemudian adanya dadanya bulging, jadi tidak simetris pada dada. Ini nampak pada pemeriksaan fisik. Nah, pada bayi atau anak-anak itu akan nampak sekali. Nah, tandanya yang muncul kalau anak tersebut mengalami congenital heart disease. Gagal tumbuh ya, berat badan, tinggi badan, ya pertumbuhannya ini mengalami kegagalan. Tumbuh ya, berat badan, tinggi badan. Atau penundaan perkembangan ya. Ya, delaying of development, harusnya sudah bisa berjalan, ini belum bisa berjalan. Refleks kasar, halus juga mengalami keterlambatan. Kemudian dari hasil pemeriksaan fisik, ya, nafasnya cepat dan pendek. Ya. Kemudian pada mata kadang disertai dengan pembengkakan. Kemudian pneumonia yang berulang. Ya. Kemudian aktivitasnya mengalami keterbatasan. Ya, karena mengalami peningkatan kebutuhan oksigen, beraktivitas sedikit mengalami peningkatan frekuensi nafas sehingga anak tersebut otomatis akan mengurangi aktivitas. Kemudian nyeri dada atau palpitasi. Kemudian stroke, kemudian cyanosis. Ini juga merupakan beberapa tanda yang kita dapatkan pada saat pemeriksaan pada anak atau bayi yang mengalami congenital heart disease. Secara umum, CSD ini juga berpengaruh terhadap stunting yang merupakan masih menjadi masalah utama di negara kita khususnya. Jadi CSD ini juga berpengaruh ya, sangat berpengaruh terhadap kejadian stunting. Jadi stunting bukan melulu pada kurangnya kebutuhan nutrisi, tetapi ada faktor lain yang ditunjang karena adanya penyakit. Ya, salah satunya adalah congenital heart disease. Many risk factors from various research. Ya, ini adalah beberapa penelitian-penelitian terkait dengan faktor resiko kelainan jantung bawaan pada bayi atau neonatus. Ya, kalau diringkas ya, ini ada 3 ya. Jadi ada obesitas. Jadi ibu hamil yang mengalami obesitas. Merokok ya, ibu hamil merokok baik pasif ataupun aktif. Diabetes yang diderita atau beberapa penyakit yang diderita pada kehamilan trimester 1. Kemudian riwayat penyakit pada keluarga, khususnya penyakit jantung, atau bayi tersebut mengalami kelainan, atau usia ibu yang pada saat hamil itu lebih dari 40 tahun. Ini dikaitkan dengan Down syndrome. Atau ibu hamil yang mengalami komplikasi seperti preeklamsi atau hipertensi. Hamil kembar ini juga punya faktor resiko, kemudian ibu punya kelainan jantung, ini juga memungkinkan bayinya juga mengalami penyakit jantung. Nah, dari kondisi lain, ini juga terkait dengan infeksi virus, ya, rubella, sitomegalovirus, kemudian HIV tentu saja, miokarditis ini juga merupakan faktor resiko terjadinya CSD pada bayi. Dan Down syndrome ya, Down syndrome ini memiliki 40% ya beresiko terjadi terjadinya penyakit jantung baik pada anak-anak atau nanti pada saat anak tersebut menjelang dewasa. Jadi 40% ya Down syndrome berpeluang terjadi penyakit jantung. Sementara faktor lain, jadi saudara yang memiliki CHD ini juga 30%, kemudian bayi lahir dengan berat yang rendah atau makrosomia ini juga beresiko terjadi penyakit jantung. Dan keluarga, jadi dari keluarga yang memiliki penyakit jantung ini juga berpengaruh atau beresiko tinggi terjadi penyakit jantung bawaan. Nah, saya akan fokus ke peran bidan, ya, karena saya bicaranya dari kebidanan. Ini ada satu artikel tahun 2000 berapa ini, baru ya, artikel baru ini, terkait dengan delayed diagnosis in children with congenital heart disease, a mixed method study. Jadi keterlambatan diagnosis ya pada congenital heart disease. Nah, keterlambatan diagnosis penting karena tentu akan mengakibatkan keterlambatan penanganan. Nah, salah satu ya banyak keterlambatan ya. Yang pertama keterlambatan dari diagnosis dokter ini 57%. Keterlambatan diagnosis oleh bidan ini 14%. Kaitannya dengan keterbatasan finansial ini 9,7%. Keterlambatan rujukan 9,2% dan adanya faktor sosial 92%. Studi ini di Indonesia, di Sarjito gitu ya. Jadi ini sangat dekat dengan kondisi kita. Dan salah satu 14% tadi karena keterlambatan di diagnosis kaitannya dengan kebidanan ya, midwifery care. Dan penelitian ini adalah mixed methods di mana salah satu sitasinya karena ini adalah mixed method. Jadi pada saat di anamnesis, di wawancara, pasien itu menjawab bahwa ketika menangis anak tersebut kebiruan ya. Memang ini merupakan tanda umum yang terjadi pada bayi menangis ya, pasti akan nampak kebiruan. Nah, pada hasil wawancara tersebut ibu mengatakan bahwa ketika menangis anaknya kebiruan. Dan bidan ya mengatakan bahwa itu adalah normal. Kebiruan pada saat bayi menangis. Nah, ini menjadi concern kami sebagai bidan bahwa kondisi normal ya, bayi menangis kebiruan itu merupakan normal, tapi tidak selalu itu menjadi normal. Karena menyumbang 14% keterlambatan diagnosis. Ya. Dan ini adalah ringkasannya dari hasil wawancara. Ya. Jadi misalnya anak saya memang sudah didiagnosis PJB sejak usia 2 bulan. Tapi dokter menunggu sampai dia tumbuh dewasa dan seterusnya. Jadi concern kami terkait dengan keterlambatan bidan, jadi bahwa anak menangis kebiruan tidak selalu 100% atau tidak selalu mutlak merupakan hal yang normal. Baik, kita lanjut ke regulasi. Seiring dengan perkembangan penelitian, ya, kemudian ada regulasi atau aturan-aturan yang mengatur tentang penata laksanaan mulai dari screening sampai tindak lanjutnya. Nah, kita ketahui bersama bahwa Kementerian Kesehatan melakukan transformasi, salah satunya adalah transformasi layanan primer, di mana transformasi layanan primer tersebut kita khususnya bidan diharapkan untuk memperkuat upaya promotif dan preventif. Nah, salah satu bentuk upaya preventif yang melalui screening, ya. Screening bayi baru lahir. Jadi banyak sekali yang dilakukan screening pada bayi baru lahir. Salah satunya ya gangguan congenital heart disease, kemudian gangguan pendengaran, kemudian penyakit jantung bawaan yang kritis, kemudian gangguan penglihatan. Ini semua adalah screening-screening yang dilakukan pada bayi baru lahir. Semakin dini ditemukan, semakin cepat dilakukan screening, itu akan penanganan atau keberhasilannya akan semakin tinggi. Nah, tahun 2022, Menteri Kesehatan membuat keputusan terkait dengan panduan praktek klinis ya bagi dokter di fasilitas pelayanan tingkat pertama. Di dalamnya juga ada aturan yang mengatur bagi kami bidan. Nah, poin pasal 1A ya, poin G ini dikatakan bahwa screening penyakit jantung bawaan kritis dengan menggunakan saturasi oksigen pada setiap bayi sehat. Jadi bayi sehat. Asumsinya kalau bayi itu sakit, ya pasti sudah dilakukan penanganan ke tingkat lanjutan. Nah, pada bayi sehat, universal, jadi semua bayi sehat harus dilakukan screening dengan menggunakan saturasi oksigen. Dan di dalam keputusan menteri tersebut sudah ada tindak lanjutnya, sehingga kapan dilakukan pemeriksaan. Terkait dengan program layanan yang sekarang mungkin ada one day care ya. Setelah bersalin, pasien pulang 6 jam sudah pulang atau 12 jam sudah pulang. Bisa saja seperti itu, nanti bidan akan menindaklanjuti dengan kunjungan rumah. Tetap melakukan kunjungan rumah untuk melakukan screening, khususnya untuk congenital heart disease. Sekarang kita beranjak ke peran bidan ya. Peran bidan terkait dengan pencegahan atau screening penyakit jantung bawaan. This is a midwife visit during postpartum and during newborn or neonatus. There are 4 times ya kunjungan ulang pada ibu nifas ya. Jadi 6 sampai 40 jam. Pertama setelah melahirkan, diulang berikutnya 3 sampai 7 hari, diulang berikutnya 8 sampai 28 hari, dan terakhir kunjungan masa nifas itu periode 29 sampai 42 hari. Pada yang neonatus atau newborn, bayi baru lahir, bidan melakukan kunjungan ulang pada 6 sampai 48 jam pertama, 3 sampai 7 hari, dan 8 sampai 28 hari. Kunjungan ini bisa dilakukan melalui kunjungan rumah. Jadi bidan atau nakes berkunjung ke rumah pasien, atau pasien atau ibu datang ke fasilitas pelayanan kesehatan. Dan di dalam buku KIA yang dipunyai oleh ibu, ini sudah tertulis kapan harus melakukan screening ya, screening bayi baru lahir. Jadi pada saat KN kunjungan neonatus pertama yaitu 6 sampai 48 jam pertama. Dan ini adalah pendokumentasiannya juga, memang harus diisi pada setiap kunjungan. Sekarang kita move ke newborn screening. Screening bayi baru lahir kaitannya dengan pencegahan critical congenital heart disease. Jadi penyakit jantung bawaan kritis. Ya, kita tahu bahwa slogan-slogan ya, nah ya, jadi deteksi dini itu akan bisa meningkatkan kehidupan ya, bisa menyelamatkan beberapa penyakit atau kondisi karena bisa terdeteksi lebih dini. Penyakit jantung bawaan atau critical congenital heart disease itu bisa dilakukan sejak kehamilan atau prenatal dengan ekokardiografi feta. Dan tentu ini menggunakan teknologi. Nah, pada saat postnatal dilakukan pada bayi baru lahir dengan menggunakan pulse oximetry neonatus dan menggunakan ekokardiografi. Kalau sekarang ini puskesmas, mungkin beberapa puskesmas belum mempunyai pulse oximetry khusus neonatus, tapi kedepannya mungkin akan diharuskan mempunyai pulse oximetry khusus neonatus yang digunakan untuk melakukan screening penyakit jantung bawaan pada bayi. Nah, di Indonesia ini ada INPUS ya, di Indonesia Newborn Pulse Oximetry Screening atau PONSEL ya, Pulse Oximetry Newborn Screening e-learning yang difasilitasi oleh IDAI, Ikatan Dokter Anak Indonesia, dan ini sudah disebarluaskan melalui pelatihan-pelatihan kepada seluruh nakes ya. Jadi ada dokter, perawat, bidan di seluruh puskesmas. Karena sasarannya adalah seluruh bayi sehat. Ya, bayi sehat artinya ini adalah screening. Screening dilakukan pada bayi yang sehat. Dan pelaksanaan untuk screening ini ada 2 tempat, yaitu tangan kanan dan salah satu dari kaki bayi. Jadi ada predukta, jadi aliran ini tangan kanan ini untuk mengukur aliran atau sirkulasi darah sebelum ductus arteriosus. Kemudian salah satu kaki, bisa kanan, bisa kiri, ini untuk mengetahui sirkulasi setelah ductus arteriosus.
I'm sorry, Dr. Sriwahyuni, your time is 5 less.
Yes, thank you. Thank you, Bu Rahayu. I'm almost finished. Ya. From evidence, ya. Jadi ini adalah beberapa penelitian terkait dengan screening menggunakan pulse oximetry pada bayi baru lahir untuk mendeteksi critical congenital heart defects. Ini semuanya memang mendukung ke arah alat ini memang valid, ya, valid dan presisi untuk mendeteksi. Sekali lagi untuk mendeteksi screening awal. Kalau ada kelainan di awal pasti nanti akan dilakukan tindak lanjut ya, tindak lanjutnya. Tetapi di awal alat ini memang valid, sensitif untuk mengetahui gejala dini dari congenital heart disease pada bayi. Nah, bagaimana untuk screeningnya? Menggunakan pulse oximetry khusus neonatus. Dan sudah ada algoritmanya, dan screening ini memiliki sensitivitas 76,3% dan spesifikitas 99,9%. Jadi ini sangat sensitif dan sangat spesifik. Dan screening program ini tidak hanya di Indonesia, tetapi di seluruh negara. Ini sudah diterapkan pada bayi baru lahir. Dan pelaksanaannya, screening, this is the optimal time for examination is 24 up to 48 hours after birth. 24 sampai 48 jam setelah lahir bayi tersebut. Apabila bayi itu pulang sebelum 24 jam, bidan bisa melakukan kunjungan rumah atau kunjungan ulang ke rumah pasien untuk melakukan screening. Dan apabila ditemukan hasilnya positif, perlu diulang lagi. Dan kalau itu memang masih di tempat pelayanan, maka kepulangan harus ditunda. Dan pada saat pemeriksaan, agar hasilnya nanti tidak bias, ya, pada saat bayi tenang dan tidak posisi tidur, tidak posisi nangis. Karena kalau bayi dalam kondisi tidak tenang atau menangis, hasil pemeriksaannya akan berbeda. Dan hasil pemeriksaan dicatat di dalam pencatatan, format pencatatan, dan ini juga dari IDAI, ya. Jadi kalau yang hijau ya memang berwarna ya, memang harus dicetak berwarna sehingga mudah untuk mengetahui. Jadi kalau di hijau hasil pemeriksaannya ini normal. Kemudian kalau nanti masuk di area yang kuning ini perlu diulang 1 jam berikutnya, maksimal pengulangan ini 2 kali. Dan apabila hasil pencatatannya merah, jadi kurang dari 89, baik di tangan ataupun di kaki, ini harus dilakukan rujukan. Dan ini adalah algoritmanya. Jadi hasil pemeriksaannya normal itu kalau usia 24 sampai 48 jam. Dan hasilnya lebih dari 95%. Ya, dan tidak ada perbedaan, kalaupun ada perbedaan kurang atau sama dengan 3% antara pemeriksaan tangan dan pemeriksaan di kaki. Itu baru dikatakan lolos atau lulus. Ya. This is enough for today. I hope this is inconvenient and according with the topic about integration of traditional and conventional treatment for cardiovascular system, and I start from the beginning of life, yeah, still since pregnancy and the newborn. This is enough from me, Bu Rahayu, and waktu kami kembalikan ke Bu Rahayu. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much, Dr. Sri Wahyuni. So we get a new insight from your presentation. Thank you, Dr. And next, we move to second speakers, to Miss Arum Dwi Agustina. You hear me, Miss?
Yes, I hear you. Ayu.
Okay, thank you. I like to read your profile first. And she is experienced in 2019. She is a lecturer in Pharmaceutical and Food Analysis Department, Health Polytechnic Ministry of Surakarta. And she have 3 oral presentations, and she have 5 publications. Next, the education history. She's undergraduate program of in 2005 until 2010, and postgraduate program of chemistry in 2012 until 2014. And so, Ms. Arum Dwi Agustin, you have 20 minutes for present your material or topics. You're ready?
Okay.
Okay, so please, time is your.
Okay, thank you, Miss Ayu. Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. My name is Arum Dwi Agustin from Pharmaceutical and Food Analysis Department, Health Polytechnic Ministry of Health Surakarta. First of all, my Honorable Directors of Health Polytechnic Ministry of Health Surakarta, my Honorable Head of Traditional Health Council Indonesia Health Workers Council, an Honorable Olaf Head Department of Health Polytechnic Ministry of Health Surakarta, and all participants of the 4th International Conference on Traditional Medicine. Today, I will sharing with all of you about my research, formulation functional powder drink of avocado Persea americana meal seeds with adding spices and stevia rebaudiana L. I took the theme about functional food that contain antioxidant because antioxidants function as a compound that plays an important role in maintaining cardiovascular health in accordance with our theme today, integration of traditional and conventional therapy for cardiovascular system. Introduction, avocado seeds. The production of avocados in Central Java has increased every year, and products of seed that have not been utilized optimally will be produced, whereas the content of antioxidants and fiber compounds in avocados is more concentrated in the seeds of the fruit than in the flesh, including flavonoids, steroids, terpenoids, saponins, tannins, cardiac glycosides, and alkaloids. Avocado seeds have a bitter taste, so they need to be combined with other ingredients such as spices to give the drink formulation a taste and aroma. BPS 2020 and 14 et al. 2021. Spices. Indonesia has many spices that are used aroma given and have antioxidant activity such as red ginger, Zingiber officinale rubrum, star anise, Illicium verum hoc F, cinnamon, Cinnamomum burmandinus and Tines bloom, nutmeg, Myristica fragrans haut, and clove, Syzygium aromaticum F. The above spices contain flavonoids, a total phenolic, and an essential oil with very strong antioxidant activity. Therefore, we need a way to process avocado seed into food with a higher selling value, one of which is made functional food products often found and in demand, such as functional powder drink with adding spices and stevia. Research aim to determine the result of organoleptic and pH test, qualitative and quantitative tests of flavonoid, also antioxidant activity functional powder drinks of avocado seeds with adding spices and stevia. Benefits of research, adding insight and knowledge for the community in the development of making alternative food ingredients from avocado seeds and can be used as reference material or reference in further research. And then, functional powder drinks making is divided into 3 steps. First step is powdering method of avocado seed, spices, and stevia, starting with raw material washed under running water, and then dry with oven on temperature 40 until 50 degrees Celsius, and then mash and shape it using 60 mesh sieve. Second step is functional powder drinks making, starting with infused extract of avocado seed and spices, and then mixture of stevia and extract is heated over a steady, and then crystals are smoothed with an 18 mesh sieve. The last step is analysis functional powder drinks of avocado seeds with adding spices and stevia. Functional powder drink formula can be seen from the table. Formula of functional powder drink is divided into 5 formula. F0 is no spices, F1 is adding red ginger, F2 is adding cinnamon, F3 is adding clove, F4 is adding star anise, F5 is adding nutmeg. Its spices are added as much as 15%, and the formula is modification from Rifkowati et al. 2019. Analysis for functional powder drinks of avocado seeds with adding spices and stevia include organoleptic tests using the human sense, pH test using pH meters, flavonoid qualitative test was carried out by a color reaction, flavonoid quantitative and antioxidant activity test using UV visible spectrophotometry. Result and discussion. This is the picture of avocado seed powder, spices, and functional powder drinks of avocado seeds with adding spices and stevia. Quality tests for functional powder drinks of avocado seeds with adding spices and stevia include organoleptic and pH tests. For organoleptic, include color, aroma, taste, and texture test. For color test, for F0 until F5 is British chocolate color. For aroma, to F0 is distinctive avocado seeds. For F1 until F5 is distinctive avocado seeds and spices. For taste, all of the sample have typical spices and sweet. And texture, all the sample have fine powder texture. Overall, the result of organoleptic following standard requirement SNE 014320 1996 regarding the quality standard of traditional powder drinks. And for pH test, to F0 is 6.399, F1 is 6.243, F2 is 6.167, F3 is 6.089, F4 is 6.347, and F5 is 6.287. Based on the data, the test result pH of functional powder drinks showed that these drinks had weak acid properties due to the presence of flavonoid content in them. This is the qualitative and quantitative test of flavonoid. From the picture, the result of qualitative test flavonoid of all the sample is positive content flavonoid. From the color is red or orange. This is the result of total flavonoid levels, functional powder drinks of avocado seeds with adding spices and stevia. From the absorbance of the result of absorbance of quercetin and calibration curve quercetin, we have result of flavonoid content. For avocado seeds powder is 14 until 150. For F0 is 10.234. F1 is 12.336. F2 is 13.908. F3 is 14.566. F4 is 10.929. And F5 is 11.415. Based on this data, functional powder drinks with the addition of cloves or F3 have the highest flavonoid levels. And for antioxidant activity test, antioxidant activity of sample in 1,000, 2,000, 3,000, 4,000, and 5,000 ppm in methanol mixed with 50 ppm DPPH in methanol was measured on 518 nanometers wavelength. From the table, antioxidant activity of functional powder drinks of avocado seeds with adding spices and stevia, we know that sample F0 FIC15 was 62.768. F1 is 46.524. F2 42.367. F3 40.950. F4 49.451. And F4 is 47.682. Based on the result, we know that F0 is strong category and F1 until F5 is very strong category. Conclusion: organoleptic test of functional powder drinks of avocado Persea americana meal seeds with adding spices and stevia. Stevia rebaudiana L had a whitish chocolate color, typical spice smell, typical spice and sweet taste, and a fine powder texture. The average pH test of functional powder drinks of avocado, Persea americana meal seeds with adding spices and stevia, Stevia rebaudiana L, had weak acid properties due to the presence of flavonoid content in them. Powder of avocado, Persea americana meal seeds, spices, stevia, Stevia rebaudiana L, and functional powder drinks of avocado, Persea americana meal seeds with adding spices and stevia, Stevia rebaudiana L, contain positive flavonoid compounds. Functional powder drinks of avocado, Persea americana meal seeds with adding cloves and stevia, Stevia rebaudiana L, have the highest flavonoid, was 40.566 milligram per gram. Functional powder drinks of avocado, Persea americana meal seeds with adding spices and stevia, Stevia rebaudiana L, for F1 until F5 have a very strong antioxidant activity. The highest level is F3, or adding cloves, was 40 until 950, and F0 has a strong antioxidant activity level. Suggestion. First, it is necessary to study the content of other compound of functional powder drinks of avocado, Persea americana meal seeds with spices and stevia, Stevia rebaudiana L. And second, it is necessary to study the shelf life of functional powder drinks of avocado, Persea americana meal seeds that adding spices and Stevia rebaudiana L. Okay, this is my presentation. I hope my presentation is accordance with our theme today. Thank you for all the participants. The time is yours, Ayu.
Okay, thank you, Ms. Arum Dwi Agustin, about your presentation, and your material is a very amazing and very good. Thank you, Miss. And next third speaker is Mrs. Murwati. Mrs. Murwati here.
Ya, saya di sini, Mbak.
Okay. Mrs. Murwati, is your time, and I'm gonna read your profile first. Mrs. Murwati is a secretary in Pharmacy Department, Health Polytechnic Ministry of Health, Surakarta. In Science 2021 now, and she has a lot of publication. I have noticed there are over 12 papers. That's a number of our in this conference, right? Mrs. Murwati? An expert in material. Okay, Mrs. Murwati, you have 20 minutes to present your material, topic, and paper. So please, time is your, Mrs. Murwati.
Baik, terima kasih Mbak Rahayu. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Kepada yang terhormat Bapak Direktur Poltekkes Kemenkes Surakarta beserta jajarannya, Bapak Wadir 1, Wadir 2, dan Wadir 3. Kepada yang terhormat Ibu Kepala Pusat Pengembangan Polkesta, kepada yang terhormat Ibu Ketua Jurusan Jamu beserta jajarannya, kepada seluruh panitia penyelenggara International Conference on Traditional Medicine di tahun keempat ini, dan juga kepada seluruh yang hadir di Zoom Room pada siang hari ini. Baiklah, pada sore hari ini kami akan menyampaikan yang berkaitan dengan baik. Nah, hari ini kami akan membicarakan tentang penggunaan obat tradisional dan obat konvensional yang ada di masyarakat dalam rangka untuk mengatasi penyakit-penyakit tidak menular pada masyarakat yang ada di Indonesia. Baik, saya besarkan dulu ya. Nah, bahwa di Indonesia sampai saat ini penyakit menular dan penyakit tidak menular itu bukannya semakin berkurang, tapi justru semakin meningkat. Pada era puluhan tahun yang lalu, penyakit menular di masyarakat itu sangat tinggi. Namun demikian, seiring berjalannya waktu, bahwa di Indonesia pada saat ini justru terjadi dua hal yang beban gitu ya. Jadi double burden di Indonesia, yaitu penyakit communicable dan non-communicable disease di Indonesia. Nah, bisa kita lihat yaitu bahwa berdasarkan riset kesehatan 2018 itu bahwa di Indonesia itu ternyata masih ada penyakit menular dan tidak menular. Ini bisa kita lihat ya bahwa penyakit menular yang ada di Indonesia itu mulai dari diare, ispa, pneumonia, malaria, filariasis, hepatitis, sampai TB paru gitu ya. Jadi bahwa di sini prevalensi yang paling tinggi itu adalah diare gitu ya. Dan sementara itu seiring berjalannya waktu ternyata di Indonesia itu untuk sebaran penyakit menular itu juga cukup tinggi, bahkan lebih tinggi dari penyakit menular. Nah, ini bisa kita lihat di sini, yaitu ada hipertensi, ada stroke, ada hipertensi yang terdiagnosis, kemudian ada penyakit sendi, ada asma, ada diabetes mellitus, kemudian kanker, penyakit jantung, kemudian juga ada gagal ginjal kronis. Nah, ini sangat luar biasa sekali dan ternyata paling tinggi adalah untuk hipertensi. Gitu ya, baik dia itu yang hasil pengukuran ya. Jadi ini berdasarkan hasil pengukuran di lapangan itu sampai mencapai sebanyak 31%. Kalau dari hasil diagnosis dokter itu sebanyak 8%. Sedangkan stroke itu menempati urutan kedua untuk penyakit tidak menular. Nah, ini sangat luar biasa ya. Jadi bahwa ternyata sebaran penyakit menular di Indonesia itu menghantui kita semua, di samping kita masih memiliki PR yaitu penyakit menular. Nah, adapun untuk mengatasi hal tersebut, baik penyakit menular maupun penyakit tidak menular di masyarakat Indonesia itu tentunya yang paling lazim itu adalah mengkonsumsi obat, baik itu yang sifatnya obat tradisional maupun obat yang konvensional. Dan ternyata masyarakat kita itu banyak yang mencintai juga menggunakan obat tradisional untuk mengatasi gangguan-gangguan kesehatannya. Nah, dari hasil riskesdas juga itu yang cukup banyak menggunakan itu adalah diare pada balita, itu sebesar 12,1%. Itu untuk kategori penyakit menular. Kalau untuk kategori penyakit yang tidak menular, yaitu adalah hipertensi. Itu sebanyak 14,5% itu suka menggunakan obat tradisional. Kemudian kanker di semua usia. Nah, penyakit kanker ini tidak begitu ada kejelasannya dia menggunakan apa ya. Tapi yang jelas dari 24,1% itu mereka menggunakan pengobatan lainnya, di mana lainnya ini kemungkinan di dalamnya ada tradisional medicine. Kemudian diabetes mellitus. Diabetes mellitus ini ternyata yang menggunakan obat tradisional juga cukup tinggi ya Bapak Ibu, yaitu sampai mencapai 25%. Nah, ini berarti memang pengguna obat tradisional di masyarakat kita untuk mengatasi penyakit tidak menular juga menjadi pilihan. Nah, beberapa penelitian yang lain juga mengatakan ya, jadi bahwa batuk, demam itu juga mereka menggunakan obat-obatan tradisional. Begitu juga nyeri haid, ya. Jadi mereka juga menggunakan obat tradisional. Jadi memang obat-obat tradisional ini sampai saat ini menjadi salah satu pilihan alternatif bagi masyarakat kita untuk mengobati atau mengatasi gangguan kesehatan. Nah, selain obat tradisional, ternyata masyarakat kita itu juga senang memanfaatkan pelayanan kesehatan tradisional, gitu ya. Jadi untuk yang ini juga hasil riskesdas ya. Jadi bahwa masyarakat kita itu di kota itu yang memanfaatkan pelayanan kesehatan tradisional itu mencapai 32%. Kalau yang di desa itu 30%. Oh, ternyata lebih banyak yang di kota nih Bapak Ibu. Jadi mungkin orang kota ini ya lebih penasaran, jadi mereka memilih untuk melakukan pelayanan kesehatan tradisional. Kemudian untuk pemanfaatan toga atau tanaman obat keluarga itu juga cukup tinggi, yaitu prevalensinya secara umum mencapai 24,6%, di mana desa itu masih banyak yang memanfaatkan mencapai 30%. Nah, untuk yang memanfaatkan ramuan jadi itu sebanyak 48%, dan yang melakukan membuat sendiri, memilih membuat sendiri itu mencapai 31,8%. Nah, Bapak Ibu semuanya, jadi dengan kondisi data-data seperti ini berarti menunjukkan bahwa ini bisa menjadi peluang dan juga bisa menjadi tantangan untuk tenaga kesehatan yang ada di Indonesia, baik itu tenaga kesehatan secara umum maupun tenaga kesehatan tradisional. Nah, apalagi masa pandemi COVID itu penggunaan tradisional medicine itu cukup tinggi dan malah lebih tinggi ya. Jadi mulai dari menggunakan herbal apapun namanya, karena masyarakat itu kalau ditanya jawabannya obatnya apa, herbal begitu ya. Jadi ini ada herbal, daun kelor, jahe merah, kunyit, jamu, delima, kurkumin, sama untuk digunakan imunitas itu mencapai 43,75%. Nah, ini dari yang tadi penggunaannya 30-an% sampai mencapai 43,75%. Hampir 50% masyarakat di masa pandemi COVID itu menggunakan tradisional medicine, dan itu juga tidak menutup kemungkinan bahwa setelah pandemi selesai penggunaan herbal medicine ini juga masih cukup tinggi dan menjadi primadona begitu Bapak Ibu. Karena apa? Karena bahwa ternyata persepsi masyarakat tentang penggunaan obat tradisional ini memang masih bagus gitu ya. Jadi bahwa dengan tagline yang ada di traditional medicine yang tentunya back to nature gitu ya. Jadi bahwa ini kembali ke alam itu orang itu langsung berpikir, berpersepsi bahwa barang ini adalah aman, barang ini adalah tidak berefek samping gitu ya, jadi aman, sehingga banyak masyarakat kita beramai-ramai itu ya, jadi bahwa menggunakan itu dengan alasan keamanan tadi. Selain memang harganya juga lebih murah, lebih simpel gitu ya, seperti yang disampaikan pada pembicara sebelumnya tadi. Nah, hal ini digunakan untuk self-medication ya, jadi atau untuk pengobatan sendiri. Nah, apakah persepsi seperti ini salah gitu ya? Hal ini tidak semuanya salah gitu ya, karena sebenarnya self-medication baik menggunakan tradisional medicine maupun konvensional itu adalah bagian terapi non-farmakologi, di mana sebenarnya melakukan self-medication ini adalah mampu menciptakan pengobatan dan meningkatkan kualitas kesehatan secara mandiri. Jadi selama penggunaan self-medication ini benar dan rasional, itu memang sudah dibenarkan. Nah, dengan adanya trust yang tinggi, gitu ya, jadi kepercayaan yang tinggi terhadap pengobatan tradisional tadi, ternyata memang self-medication itu sampai mencapai 74,72% ya Bapak Ibu ya. Jadi ini berdasar data BPS 2022 itu orang yang melakukan self-medication itu cukup tinggi, sampai mencapai hampir 75%. Jadi 3/4 warga Indonesia itu suka berobat sendiri. Nah ini berarti berita gembira, tapi juga harus warning, hati-hati gitu ya. Dan 47%-nya itu ada pada wanita gitu ya. Jadi ternyata juga cukup tinggi ya. Jadi ibu-ibu itu banyak membeli obat sendiri. Di mana bahwa jenis obat yang dibeli itu yang obat tradisional mencapai 21,4%, sementara yang obat kimia 78,6%. Nah, ini data yang luar biasa. Nah, untuk yang self-medication tadi, itu dari karena ini sesuatu yang selain tadi tantangan juga sebuah ancaman gitu ya, maka kita perlu tahu apakah self-medication di masyarakat itu sudah tepat atau belum. Nah, hasil beberapa penelitian itu yang rasional self-medication itu sebesar 61,4%. Kemudian yang irasional itu sebesar 38,6%. Berarti ini cukup tinggi juga ya. Jadi hampir 40% itu masyarakat itu masih irasional self-medication. Nah, kenapa hal ini? Kalau yang rasional self-medication itu tentunya terapi yang digunakan secara mandiri tadi bisa optimal dan tentunya ini ekonomis ya dari sisi pembangunan kesehatan di Indonesia sangat membantu self-medication ini gitu ya, karena salah satu tujuan pembangunan di Indonesia itu kan bagaimana masyarakat itu bisa sehat secara mandiri. Nah, beberapa faktor gitu ya, kenapa kok masyarakat itu banyak yang irasional self-medication, padahal jika ini terjadi maka bisa terjadi kesalahan dalam rangkaian pengobatan atau medication error. Hal ini beberapa faktor itu tentunya yang paling utama adalah pengetahuan yang kurang tentang penggunaan obat, baik itu obat tradisional maupun obat konvensional. Kemudian adanya iklan yang menyesatkan. Nah, ini ya, jadi kadang-kadang kedua hal inilah atau gabungan dua hal antara kurangnya pengetahuan dan termakan oleh iklan ini, sehingga pengobatan yang harusnya bisa menjadi sebuah solusi itu justru menjadi permasalahan, yaitu terjadi medication error. Sehingga hal ini membutuhkan peran oleh seluruh jajaran gitu ya. Jadi bahwa peran ini tidak hanya peran tenaga kesehatan kefarmasian gitu ya, tapi dari pihak pemerintah, kemudian semua tenaga kesehatan yang berkaitan, kemudian industri farmasi, kemudian akademisi, kemudian juga pemerintah daerah, stakeholder terkait, serta masyarakat itu sendiri. Jadi antara pemerintah, tenaga kesehatan, swasta, dan masyarakat itu memang harus terpadu bagaimana mengatasi permasalahan tentang penggunaan irasional self-medication ini. Nah, ini adalah beberapa peran dari pemerintah. Tentunya ada 3 hal utama dari pemerintah, yaitu regulasi, kemudian adanya kemitraan lintas sektoral dan organisasi pengobat tradisional, kemudian pendayaan sentra pengembangan penerapan obat tradisional, serta penelitian dan pengembangan. Nah, hal ini bukan tugas kita semua ya, jadi ini adalah tugas pemerintah, meskipun nanti di antara tenaga kesehatan dan swasta itu akan bisa masuk di dalam program-program yang dibuat oleh pemerintah, seperti penelitian, kemudian di sini di akademisi seperti ini, gitu ya. Ini adalah beberapa regulasi yang berkaitan dengan penggunaan obat tradisional. Nah, kemudian bagaimana peran tenaga kesehatan dalam mengawasi obat tersebut gitu ya, agar obat-obat itu aman, dan ini bisa dilakukan oleh seluruh tenaga kesehatan ya. Yaitu yang pertama tentunya pentingnya mengetahui obat yang telah memiliki izin edar. Karena pada prinsipnya ternyata di Indonesia itu banyak sekali obat-obat yang beredar itu ada yang tidak memiliki izin edarnya, sehingga penting bahwa harus membaca brosurnya, kemudian membaca packagingnya dulu itu ya. Jadi semua harus dibaca itu agar kita mengetahui. Jadi itu salah satu bentuk bagaimana pengawasan obat oleh tenaga kesehatan. Jadi meskipun kita tenaga kesehatan melihat juga harus ini lebih dibanding warga yang biasa. Kemudian pentingnya pharmacovigilance. Nah, hal ini didasarkan dari buku BPOM ya. Jadi bagaimana pengawasan obat aman untuk nakes. Nah, perannya ada 3 ini ya. Jadi yang pertama tentunya adalah pada saat proses persiapan itu yang tepat. Kemudian yang kedua adalah edukasi terhadap masyarakat. Yang ketiga adalah pelaporan efek samping obat. Nah, lalu bagaimana upaya kita itu kepada masyarakat secara umum gitu ya, dan bagaimana peran tenaga kesehatan secara umum dalam mengatasi hal tersebut. Nah, tentunya yang di masyarakat secara umum itu upaya kesehatannya adalah promotif dan preventif. Namun demikian tanpa mengabaikan kuratif dan rehabilitatif. Sehingga harapannya dengan promotif dan preventif tersebut itu masyarakat kita itu bisa sehat dengan gratis gitu ya. Karena kalau gratis mungkin tidak ya, tapi lebih murah dan lebih ekonomis. Salah satunya tentunya included rational self-medication. Ya, jadi bagaimana kita menggunakan self-medication itu yang rasional di masyarakat. Nah, kaitannya tentang upaya promotif dalam rangka transformasi layanan kesehatan, jadi bahwa peran tenaga kesehatan khususnya di komunitas itu salah satunya adalah peran transformasi layanan primer ya, di antara 6 pilar dari transformasi kesehatan itu. Di sini kami akan menyoroti pada bagian transformasi layanan primer. Karena apa? Karena ini yang langsung bisa dikerjakan dan terlihat pada peran tenaga kesehatan di komunitas dalam rangka bisa mengawasi dan bisa meningkatkan pengetahuan tentang self medication yang rasional, yaitu pada bidang promotif preventif. Nah, bisa kita lihat yang pertama tentunya adalah memberikan edukasi. Nah, edukasi ini bisa dimulai daripada saat pemberian resep ya. Kalau yang pelayanan di masyarakat itu berarti pada saat pemberian resep itu bisa langsung diberikan KIE berkaitan dengan penggunaan obat yang benar gitu ya. Nah, selain itu edukasi untuk meningkatkan pengetahuan penggunaan obat itu juga bisa melalui PIO, yaitu pemberian informasi obat ya, bisa dalam bentuk leaflet, kemudian video edukasi, kemudian bisa dengan brosur dan lain sebagainya. Kemudian yang kedua ini adalah pemberdayaan masyarakat. Nah, pemberdayaan masyarakat ini adalah ciri khas untuk di komunitas ya. Nah, beberapa program yang selama ini sudah ada berkaitan dengan obat itu ada gerakan cerdas minum obat ya, atau Gema Cermat. Kemudian juga ada Degusibu, yaitu program atau penyuluhan tentang bagaimana mendapatkan, menggunakan, menyimpan, dan membuang obat yang benar. Kemudian ada juga penggunaan obat melalui metode cara belajar insan aktif. Nah, untuk yang ada kaitannya dengan BPOM gitu ya, jadi BPOM itu menyediakan bagaimana agar masyarakat itu bisa mengecek bahwa obat itu aman atau tidak, kemudian ada izin edarnya atau tidak dengan menggunakan aplikasi ceklik. Nah, ini maaf ya. Nah, itu adalah pemberdayaan masyarakat. Nah, selain itu ada juga yaitu bagaimana tentang usaha kesehatan yang berbasis masyarakat, yaitu melalui Posyandu, pos pelayanan terpadu, baik itu Posyandu balita, kemudian Posyandu lansia, kemudian juga Posbindu. Nah, hal ini nanti salah satunya di sana akan dilakukan screening untuk beberapa penyakit ya. Jadi kalau untuk yang balita tentunya adalah stunting, kemudian berat badan dan tinggi badan. Terus kemudian kalau untuk lansia itu bisa dengan pemeriksaan tekanan darah tinggi, kemudian kolesterol, asam urat. Nah, ini juga bisa menjadi screening ya, preventif. Kemudian juga ada program GERMAS, Gerakan Masyarakat Sehat, dan juga PHBS, Perilaku Hidup Bersih Sehat. Jadi bahwa sebenarnya selama ini sudah ada kegiatan promotif dan preventif untuk meningkatkan pengetahuan masyarakat agar bagaimana masyarakat itu mengenali penyakitnya, kemudian bagaimana cara memberikan obat secara mandiri yang rasional. Nah, akan tetapi pada kenyataannya angka-angka irasional self medication itu tetap tinggi. Maka pada beberapa tahun ini ya, itu Kementerian Kesehatan memberikan penguatan dan perubahan lensa melalui transformasi kesehatan untuk mempercepat, meningkatkan kesehatan masyarakat ya. Nah, salah satunya adalah 6 pilar transformasi itu, yaitu transformasi layanan primer. Dan ternyata transformasi layanan primer ini memang isinya mengedukasi kesehatan masyarakat, memberikan pencegahan baik primer maupun sekunder, dan memberikan pelayanan kesehatan pada puskesmas, posyandu, bahkan pada kunjungan rumah. Nah, seperti itulah kira-kira Bapak Ibu semuanya. Jadi peran tenaga kesehatan dalam menggunakan obat tradisional dan obat konvensional di masyarakat. Terima kasih. Waktu saya kembalikan kepada Mbak Ayu.
Okay, terima kasih. Thank you for your presentation, Mrs. Murwati. And then next, the fourth speaker. Fourth speaker is the Apotheker Paramita Yuli Pratiwi. Do you hear me, Mrs. Paramita?
Yes, I am. Is my
Okay.
voice clear?
Okay.
Hello.
I'm gonna read your profile first, Mrs. Mrs. Paramita Yuli is a faculty in Indonesian Traditional Herbal Department Health Polytechnic of Ministry of Health Surakarta. She's pursued her master degree on Gajah Mada University in Yogyakarta 10 years ago. And so it's quite a long time ago, Mrs. Paramita Yuli. And she has more than 5 papers. And now she is a lecturer in Indonesian Traditional Herbal Department Health Polytechnic Ministry of Health Surakarta. Okay, Mrs. Paramita Yuli, you have 20 minutes to your present paper. Are you ready?
Okay. Thank you,
Okay.
Miss Ayu. Thank you, moderator or Miss Ayu. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, ladies and gentlemen. Let me introduce myself. My name is Pramita Yuli Pratiwi, and I'm from the Indonesia Traditional Herbal Medicine, Herbal Department, Health Polytechnic, Ministry of Health, Surakarta. The Honorable Mr. Sudiro Eskepnes MPD, Director of Health Polytechnic Ministry of Health Surakarta. The Honorable Mrs. Emi Suryani Emit as a Chairman Center of Excellence, Pujakusuma Health Polytechnic Ministry of Health Surakarta. And the Honorable Head of Jamu Department and Head of all Departments of Health Polytechnic Ministry of Health Surakarta. The Honorable all speakers and all of the participants in this 4th International Conference on Traditional Medicine. Okay, ladies and gentlemen, let me present my presentation material. Let me share about my PowerPoint slide. Okay. Okay, my presentation about free radical scavenger activity of herbal tea bags. What is herbal tea? Herbal tea is a general term used for drinks that do not come from the tea plant, Camellia sinensis, which are made from flowers, seeds, leaves, or roots of various plants. Tea bag means tea that is packaged in a bag, filter paper, like a filter paper, for one serving by dipping it in hot water in a glass or cup. It can be cooled with adding ice in a glass or a cup. And why herbal tea bags? There are 3 reasons why herbal tea bags. First is functional drinks. Herbal tea bags is a functional drinks that are in the great demand by all groups. And the second, in 2080, from research results, the prevalence of degenerative diseases has increased. One of them is cardiovascular. And the third is exposure to free radicals. Free radicals causes oxidative stress, Oxidative stress occurs due to an imbalance between oxidants and antioxidants, which then has the potential to cause cell damage. It's from research of Zaitun in 2019. Consuming tea can increase vitamin intake, reduce the risk of certain diseases, and increase stamina. This plant is made into tea bag so that it's easier to consume and more practical. Plants that contain antioxidants are lemongrass, rosella, and telang. In Latin term, lemongrass is Cymbopogon citratus, rosella is Hibiscus subderiva, and telang in Latin terms is Clitoria ternatea. Okay, this is one of the bag ingredients. There are three ingredients. First is Hibiscus subderiva floss powder, or in Indonesian is bunga rosella. And the second is Clitoria ternatea floss powder. In Indonesian is serbuk bunga telang. And the third is Cymbopogonis citrati caulis powder, or batang sereh, in Indonesian. And why use that ingredients? The ingredients, benefits of ingredients, first, with Hibiscus subderiva floss, it has dominant acid compounds like ascorbic acid or vitamin C, namely citric acid and malic acid. And it has the anthocyanin level was in 88.9 milligram per liter, and the IC50 values was 67.3 ppm in category strong antioxidant. It from research of Ingrid in 2018. And the second, we have Clitoria ternatea floss or bunga telang. It has polyphenol content which acts as an antioxidant. The main content is anthocyanin. It includes in flavonoid and about 5.40% as an antioxidant. And the third is Cymbopogonis citrati caulis or batang sereh. Yeah. It has total phenol content 42.959 milligram per kilogram extract as an antioxidant, as anti-inflammatory, antibacterial, analgesic, anti-emetic, and antitussive from the research of Hairi in 2016. The free radical scavenger activity can be determined by DPPH method. What is DPPH method? DPPH is a simple and fast antioxidant testing method. This method uses DPPH free radicals to measure single electrons, such as its transfer activity, as well as to test an antioxidant compound in reducing free radicals. In this method, the DPPH solution acts as a stable free radicals. And this is the one of formula from 3 ingredients. This is a herbal tea bag formula with 3 variations in weights. We have 3 formula. The formula 1, more content in Hibiscus subderiva floss. In formula 2, more content in Clitoria ternatea floss, and the formula 3, more content in Cymbopogonis citrati caulis or batang sereh. And from the ingredients or tea bag formula, it testing by the antioxidant or free radical scavenger, the antioxidant content of the 3 formulas. Formula 1, Formula 2, and Formula 3 was determined using the DPPH method with spectro UV-Vis, and the first test for pH, the second is test for organoleptic test, and the third, water content test, and the last, free radical scavenging test. The first is pH test about tea bag herbal. The pH test of the preparation is carried out to determine the pH of the preparation that has been made. The tea bag preparation with the pH requirement for tea bags is about 3 to 8. This is the table. In the table is the result of the pH test. We can see from the table that in Formula 1 is more acidic than Formula 2 and Formula 3. It can happen because the amount of the Rosella content in Formula 1 is greater than in Formula 2 and Formula 3. And the second is test water content. The physical test in the form of a water content test is one that is very important in testing tea bags because the higher water content makes it easy for bacteria, mold, and yeast to breed, which will cause changes to the tea bag preparation. From the table, we can see that the result of the water content test. The water content test results show that the three formula, Formula 1, Formula 2, and Formula 3 have water content values that comply with standard national Indonesia, less than 10%. And the third is organoleptic test. The organoleptic test was carried out to determine whether tea bag that had been made were suitable for giving to respondents or not, which was carried out by observing using the 5 senses. And we can see from the table that the organoleptic results show that all the tipping formulas were suitable to be given to the respondents, like color, aroma, and flavor. The three formulas, the flavor is sour because there are bunga telang and bunga rosella or hibiscus subderivai flowers. And the fourth is test in free radical scavenging test. In this table, we can see that the result of IC50, IC50 is a result of free radical scavenging test. We use the comparator. The comparator used as a positive control is vitamin C with a secondary free radical scavenger and has been proven to have free radical scavenging activity. It depends on the research of Lung and Destiani in 2018. And then the positive control or vitamin C, solution of vitamin C, is using the DPPH method and has an IC50 values 7.695 ppm, which means it has very strong free radical scavenging activity because it is in the range of IC50 values below 50 ppm. So it is in the range of very strong activity. And the sample solution measurement at Formula 1, Formula 2, and Formula 3, the three bag formulas have very strong free radical scavenging activity too, because they range the three formulas in IC50 value below 50 ppm. The Formula 1 is 35, Formula 2 is 28, and Formula 3 is 30 ppm. And the free radical scavenging activity of Formula 2 is the strongest compared to Formula 1 and Formula 3, because the Formula 2 has the smallest IC50 value compared to the others in Formula 1 and Formula 3. The increase in free radical scavenging activity is caused by anthocyanin levels found in rosella flowers and anthocyanin 2 in telang flowers. Okay, the conclusion from this is the first, the pH test on the tea bag preparations. Sample produce a pH value that met the requirement, pH 3 to 8. And the second, the water content test on the 3 tea bag preparation formulas produced with water content values that met SNE less than 10%. And the third, the organoleptic results show that all the tipping formulas were suitable to be given to respondent, include aroma, color, and flavor. And the last, the free radical scavenging activity of the comparative with vitamin C and Formula 1, Formula 2, and Formula 3 TPEX preparation produced an IC50 value that fell into the very strong category. Is IC50 below 50 ppm. The IC50 values of vitamin C is 7.695 ppm. Formula 1 is the more content of rosella is 35.665. The formula through the more content is telang or Clitoria ternatea is to 28.59, and the formula 3 more content in batang sereh or Cymbopogon citratus caulis is in 30.86 ppm. Okay, thank you. That's all my presentation. Hope it is useful, and I apologize if there is a mistake. I give the time back to moderator. Thank you, and wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Mrs. Paramita Yuli, for your presentation. Thank you, Mrs.
You're welcome.
And the next last speakers is Mr. Solihan Badri. Okay, Mr. Solihan Badri will be gonna read your profile first. Solihan Badri, STT AKP MPH, place and date of birth Klaten, August 9 in 1990. Occupation, he is lecturer in the acupuncture department head Polytechnic Ministry of Surakarta, and he is acupuncture therapist at Dewan Daru Terapi Nyeri and Pasca Stroke. Okay, Mr. Solihan Badri, you have 20 minutes to present your presentation and your paper. So please, time is yours.
Okay, thank you, Ms. Ayu. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, ladies and gentlemen. I'm Solihan Badri. Now we learn about acupuncture therapy for hypertension due to firing up of the liver fire and hyperactivity of the liver yang. Introduction. Hypertensive disease can be categorized into two. Number one is Swan Yun or vertigo, and number two is Taofeng or headache. A primary hypertension is an independent disease with no clear cause. It might present with additional symptoms such as headaches, dizziness, tinnitus, flushing of the face, insomnia, and irritability. In several cases, it might cause blurred vision, palpitation, shortness of breath, poor memory, numbness of the finger, or even stroke. Often, there is a family history of primary hypertension which suggests that this may be a disorder of the central nervous system. Secondary hypertension is caused by underlying issues such as kidney, heart, or endocrine disorder. In such case, hypertension is a symptom of the underlying condition known as symptomatic hypertension. Secondary hypertension is caused by underlying issues such as kidney, heart, or endocrine disorder. In such case, hypertension is a symptom of the underlying condition and it also known as symptomatic hypertension. Etiology and pathogenesis hypertension. In Chinese medicine, most cases show excess of the liver in the form of hyperactivity of the liver yang or flaring up of the liver fire. Yes, there are two most cases show hypertension syndrome. Number one, liver yang rising, and number two, liver fire. The primary cause of this, number one, mental injury, especially hungry, which results in stagnation of the liver Qi and subsequent flaring up of the liver fire. Another case is wasting disease, which damage the kidney yin, leading to hyperactivity of the liver. Syndrome hypertension in acupuncture. Number one, hypertension syndrome liver fire, characteristic by headaches, dizziness, flash face, pink eyes, rumbling tinnitus, dry mouth with bitter taste, redness, irritability, constipation, yellow urine, red tongue with yellow coating, and rapid weary pulse. Number two, hypertension syndrome liver yang rising or hyperactivity of the liver yang, characterized by dizziness, headaches, flush face, blurred vision, creeping tinnitus, insomnia, poor memory, restless, sore and weak back and knees, dry red tongue with a little coating, and rapid ready or weary pulse. Treatment hypertension in acupuncture. In this presentation, there are three treatments. Number one is body acupuncture. Number two, bloodletting acupuncture. And number three, auricular therapy, auricular acupuncture. Number one, blood acupuncture. Main point acupuncture, several points that can be used for hypertension. Number one, puncture, Tai Hui, and then Tai Chung, and then Tai Yang. Puncture, as important point of the gallbladder meridian, function to transverse the mean. Location at the lower border of the occipital bone in the depression between the origin of the sternocleidomastoid and trapezius muscle. Number 2, Taihui, the meeting point of the two liver and sick hand and foot young meridian. Is treated by subdue endogenous wind and calm the mind. Location at the junction of the line connecting the apex of the ear and the midline. 5 June from the anterior or 7 June from the posterior hairline. Number 3 is Taichung, the yuan source point of the liver meridian. Calm the liver and clinical effectivity point for treating hypertension. Location on the dorsum of the foot between the 1 and 2 metatarsal bone in the depression proximal proximal to the metatarsophalangeal joint and the proximal angle between the two bones. Number 4, Taiyang is a clinically effectivity point for treating hypertension. Location on the temple in a depression approximately 1 June lateral to the midpoint of the line connecting the lateral extremity of the ear, ear brow, and the outer canthus of the ear. The body acupuncture, we can puncture or pressure. And then occipital syndrome acupuncture, acupuncture point according the differentiation syndrome. Number 1 for syndrome hypertension, hypertension syndrome liver fire, we can puncture or pressure Xinjian, Jizhe, and Jianying using the reducing method. And number 2, hypertension syndrome liver yang rising. Oh, yes, liver yang rising. We can puncture or pressure point Taixi, Yongguan, Sanjiao using the even method. Treatment number 2, bloodletting puncture. We can bloodletting acupuncture point Taiyang, Taichui, and Jizhe. We can select 1 or 2 points first time, pick the thread needle and cup for 10 until 15 minutes to extract 3 until 5 milliliter of stagnant blood. Number 3, auricular therapy. Several points that can be used. Sympathetic point, ear segment, liver, kidney, and heart point. Sympathetic regulate vasomotor to lift pump of the blood vessel. Ear segment, the tranquilize the mind. And for syndrome, we can manipulating liver, kidney, and heart point. We can bloodletting in the auricular point. There are 2 points in the auricular. Number 1, apex of ear. Number 2, growth of dorsal surface. Bloodletting puncture of the 2 points is in turn with thread needle lowers to blood pressure. The conclusion, hypertension caused by liver fire and liver yang rising be effective treat with a combination of body acupuncture, bloodletting, and auricular therapy as adjunctive therapy. Okay, thank you for your attention. Assalamualaikum warahmatullahi wabarakatuh.
Thank you, Mr. Salihan Badri, for your presentation. And next session is a handing certificate to all speakers. And to all speakers, you have joining us. Dr. Sri Wahyuni, Mrs. Pramita Yuli, Mrs. Murwati, Miss Arum Dwi Agustin. Okay. I'm sorry, all the speakers. In this one, in this quick Q&A, and then quick for Miss Paramita Yuli. Your result in IC 5C was very strong free radical deafening activity. What other range category for IC 50? Please, your answer.
Yes. Okay, thank you, Miss Ayu. Is my voice is clear? I'm sorry.
Yes, yes.
Okay. Okay, I try to answer the question from Mrs. Nur Atika about a range of category for IC50. Okay, that's the question. Okay, Ms. Nur Atika, there are 4 category in range of free radical scavenging activity from below from 50 ppm. It is in the category of very strong, and then in range about 50 to 100, the category is strong, and then the third is category from 100 to 101 to 150. The category is moderate, and the last is category weak. It's in a range more than 150 ppm. Yes, there are 4 category from the free radical scavenging activity for IC50 value. Okay.
Okay. One more. Okay, to finish it. Okay, to finish that session discussion. And next session is handing certificate to all speakers. This one certificate for Dr. Sri Wahyuni Amit, Master Midwifery. And next certificate for Arum Dwi Agustin, SSI MSc. And next to Mrs. Murwati SKM MKes. The next is certificate for Apotheker Paramita Yuli Pratiwi S from MSc. And last, yes, this certificate for Mr. Solihan Badri SST AKP MP. Thank you for our speakers join us in International Conference of Traditional Medicine. Thank you very much, and thank you for the wonderful opportunity to me. And so yes, I think have the 5 speakers here and know that we are hand in hand to work in this and every provision and they repeat. So I'm happy today and happy join in the international conference. So thank you very much. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Thank you.
The Honorable Miss Dr. Sri Wahyuni M. Midwifery, Miss Arum Dwi Agustina SSI MSc, Miss Murwati SKM MKes, Miss Apotheker Pramita Yuli Pratiwi S Farm MSc, Mr. Solihan Badri SST AKP MPH. Please remain at Zoom for a while, as we will be taking picture with all guests. To all guests, please turn on the camera.
We would like to thank Ms. Dr. Sri Wahyuni M. Midwifery, Ms. Arum Dwi Agustina SSI MSc, Ms. Murwati SKM MKes, Ms. Apotheker Pramita Yuli Pratiwi S Farm MSc, Mr. Solihan Badri SST AKP MPH, and if there is another agenda, you are welcome to leave the room soon. Thank you. The next agenda is the chairman of the committee is invited to hand over the certificate for the Honorable our moderator, Ms. Rahayu Tribudyanti, AMDKes.
Please give applause.
Thanks for Ms. Rahayu Tribudyanti, AMDKes, being moderate on this session.
We also remind to all guests of today's international conference to fill the attendance form, evaluation, questionnaire, and post on the link provided by the organizer in the WhatsApp group and Zoom chat room. Post will be open until 5 p.m. For participants who have asked questions, there will be attractive prize from the organizer. So please confirm in the participant WhatsApp group.
We would like to thank the director, deputy director, all heads of department, lecturers, and the academic community of Health Polytechnic of Surakarta, the entire international conference organizer conducting this international conference. Thank you also to the invited guests and participants of the international conference. Hopefully the knowledge we have gained today may bring benefit and the goodness for us.
This event of the 4th International Conference on Traditional Medicine of Health Polytechnic, Ministry of Health, Surakarta has been complete. I am Novia Putri Nurhaliza and my colleague
Tatit Kuntawijaya Danu
as the Master of Ceremony today. Wassalamualaikum warahmatullahi wabarakatuh.